Services and Elderly Affairs Committee. I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with House Rule 67 and the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. This today will be a session of public hearings and executive sessions. Please note that there is no physical location for the members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously during this meeting through the Zoom electronic meeting platform, and that the public has access to listen contemporaneously, and if necessary, participate in this meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar and through the electronic calendar on the General Court website. The notice for this meeting complies with House rules and with RSA 91-A. Anyone who has a problem accessing the meeting should call 271-3600 or email hc@leg.state.nh.us. In the event the entire public is unable to access the meeting will be adjourned and rescheduled. Christina Daya is the staff assisting us. Please note that all votes that are taken during this meeting shall be done by roll call votes. We will start the meeting by taking a roll call attendance. When each member states his or her presence, please also state whether there is anyone in the room with you during this meeting. This is required under the right to know law. Would the clerk please call the roll?
Thank you. Representative Marsh.
Present in the elevator.
McMahon, Representative McMahon.
Present in my office in Wyndham.
Representative Nelson.
Present in Brookfield, and no one's with me.
Representative Acton.
I'm present in Fremont and I'm alone in the house.
Representative Gay.
I'm present in Concord.
Representative Cushman.
Present and in the room.
Representative Folsom, present. Representative Kelsey.
Good morning, Representative Alexander here, subbing for Representative Kelsey. I'm here in yellow.
Thank you. Representative King.
Present at the LOB.
Representative Kofal.
Present in my home office in Wilton, and there's no one in the room with me. There are other people in the house.
Representative Weber.
I'm here in my home in Walpole, and I am alone.
Representative McKay. Representative McKay. Representative Snow.
Present here in my apartment in Manchester. My wife is also here. I need to explain to people that at some point the fire department is coming in and they're going to be setting off alarms, which are unbelievably loud. So I'm going to have to remain muted and vote with thumbs up and thumbs down. Otherwise, it'll blow you all out of your chairs. Sorry about that.
Thank you, Representative Snow. I'll look for your thumb.
Okay.
Representative Knook.
Yes, I'm home alone in my study in Freedom. My wife is in the house, but we'll be going to work later.
Representative Soloway.
Representative Soloway is present at his home in the office in Lee, New Hampshire, and I am alone in the room.
Representative Cannon.
I'm home alone in my living room in Somersworth, New Hampshire.
Representative Nutter Upham.
Good morning. I'm here in Nashua, alone in the room, but not in the house.
Representative Shapiro.
I am here
I'm in my home office in Keene.
Representative Woods.
Good morning. I'm at home in my study. I'm alone in my study, but my wife is elsewhere in the house.
Representative Merchant.
I'm home in my house in Claremont, New Hampshire, and my wife is somewhere in the house.
Representative Pearson.
I am here in the meeting room. And we have everyone or a substitute except Representative McKay. Is that correct?
Yes.
Thank you. And when he shows up, we'll make sure to call upon him. Opening the hearing now on House Bill 506, relative to equal access to places of public accommodation. And the chair calls on Representative Comtois to introduce her bill, please.
Thank you, Mr. Chair. Good morning, Mr. Chair and honorable committee members. HB 506 is about anti-discrimination. Nobody should be discriminated against for any reason. If it were up to me, I would have one anti-discrimination law, but as we have seen over the years, we need to keep adding special classes because our world keeps changing. It is too bad we cannot have a law that says no one can be discriminated against for any reason ever. It would solve a lot of our problems. But let's be real, if we all just practice what we learned in kindergarten, be kind, give someone a helping hand, we would not need any of these laws, but that is not the case in today's world. So today I come before you because people are being discriminated against, harassed, losing their jobs, tattling on each other. It is ridiculous, and now we are seeing other states talking about implementing laws where you need a card to access public places. Since when do we need a card to access a public place? We say no discrimination for anyone, but today discrimination is rampant. And I am talking about families turning on each other. Parents turning on children, children turning on parents. I have never seen anything like it in my life. I have lived through discrimination, I've seen it, been a victim of it, and I understand it. I have constituents who have been denied access to a grocery store they went to for over 20 years because of a severe medical condition. And now we look to another state who is talking about a COVID passport to get into an arena, a public place. We hear terms all the time, but really, show me your papers? We have the argument about requiring an ID to vote, but yet going into a public place, you will need an ID. We have people calling the police or the AG's office, not knowing that the person may have a medical condition. We're denying access to those people from entering food and beverage establishments and to other public places because of a medical condition. We were denying the owners of these establishments the income they may receive from them if they were allowed access. These businesses are denying access because they are afraid of the government shutting them down. When we are afraid of what our government will do to us in jeopardy of losing all of our liberties and freedoms, this flies in the face of our state motto. Live free or die, because death is not the worst of all evils. And yet here we are today. We do not live free. People are in constant fear. People are tattling on each other, talking behind their backs, snickering. Some people are afraid to go out in public places because they cannot wear a medical device, or they're afraid they will be denied access because they do not take a mandated vaccine. Public health is very important, and we need to be cognizant of that. But everybody should have a choice. We have a choice of religion. We have a choice of occupation. We have a choice of sexual orientation. We should not be denied access to public places because of our choices. People should not be looking at people with medical conditions or disabilities and causing them psychological harm and making them feel less than human. This is what discrimination is, making someone feel less than. The last time I checked, we are all created equal, and that means everyone. You will hear that this is creating a special class of citizens. Unfortunately, it is the road we have gone down as we keep updating our special classes of citizens. And it is a shame that we have to do this so that people are not discriminated against. But this is our reality. It is not the way it should be, but it is the way it is. It is unfortunate that anyone discriminates against anyone for any reason. So I please ask you to pass this anti-discrimination law so that everybody, no matter who they are or what reason they have, is not discriminated against. And thank you, and I'm open for any questions.
Will you take questions?
Yes, I will.
Anyone in the committee wishing to ask a question of Representative Comtois? Representative Soloway.
Thank you, Mr. Chairman, and thank you, Representative Congressman. Does this mean that if a person comes to my store and has not been vaccinated and declines to wear a mask, that I cannot request that they not enter the store so that I can protect my employees?
Is your store available for public access?
Yes.
Then yes, that would be the case because you are denying the public. You are discriminating against those that cannot wear a mask, that have a medical condition.
Thank you.
The chair recognizes Representative Merchant.
Thank you, Mr. Chairman. Representative Soloway asked the same question.
Representative Nelson.
Thank you, Mr. Chairman. Thank you for taking my question. If I own a business and a child comes in that's not well behaved, tearing the place apart, and the parent is oblivious or could care less, and these people do exist, do I have a right to put them out of the store, or do I let the child continue to be disruptive to my business?
What type of business? Is it a private business or a public business? And what I mean by that, is it open to the public?
Yes, it is. It's a grocery store.
Okay. So this doesn't have anything to do with a child. This has to do, there are certain things where you cannot discriminate against somebody for. And this is just adding one of those items. If I were a store owner, I would ask the parent to please get their child in check. And if they're being destructive I would assume that you could ask them to leave. But you didn't deny them access. You let them come into the store, but for other reasons, because they were being destructive to your products, you asked them to leave. But this law has nothing to do with that.
Representative Comtois, this is Representative Pearson in the chair.
Thank you.
What about something that is closer? For example, the signs that say no shirt, no shoes, no service. I'm wondering if some people post that sign because no shirt and no shoes is a health problem or perceived as a health hazard. Would this bill speak to that? And if not, should it?
It does not speak to that. This bill speaks specifically to medical devices, mandated vaccines, and medical treatments.
Thank you. Representative Knurr.
Yes, I would like to follow up on both Representative Soloway's and Representative Pearson's comments then. If we, my initial question was the same, but I'll come back. If you feel that we cannot, that a business that's open to the public does not have a right to set a rule to, let's say, prevent you coming in without a shirt or shoes, or let's say even stark naked, where that's really more an issue of offending people's prudish sensibilities. But you think, though, that they would not have the right to set a rule that would protect their employees' health or their own health? And if so, I'm trying to understand why you would allow one and not the other.
So when you deny everyone access for not, your shirt, shoes, and the shirt and shoes, and I'm sure all clothing, because we have decency laws in this state, which I believe that would be kind of covered under. But this is regarding discriminating against people with medical conditions and disabilities. There's actual discrimination happening because of this.
Follow up?
Follow up.
Well, wouldn't you consider you're discriminating against the person who doesn't wish to wear clothing? And if so, again, why would that be any different than discriminating? I mean, you could almost look at a mask as a piece of clothing, which it isn't, but it's certainly similar. And why would we have a special treatment for that over a person who wants to just come in naked?
Thank you, Representative, for the question. But like I said, we have decency laws in the state, and a face mask under the FDA is considered a medical device. So they're two. You can't compare the two. And the people in the store, apparently, they're protecting themselves if they're wearing masks. And there's plexiglasses. There's all kinds of things in place. But you're making it so that people cannot go to the grocery store, or they cannot go to a food establishment. You're actually discriminating against them because they cannot wear a medical device. I don't know how else to answer your question.
The chair recognizes Representative Marsh.
Thank you, Mr. Chairman, and thank you, Representative, for taking my question. As you may be aware, I'm a hospital trustee, and I'm a little concerned how this bill might affect the ability of my hospital to conduct its operations. Am I correct that if this bill were to become law, if I had a nurse in my ICU who happened to have tuberculosis, my hospital was not able to mandate that that nurse be treated before she could take care of patients?
I'm sorry, you broke up at the end there. So could you please repeat your question?
Yes. If my hospital happens to have a nurse who's acquired tuberculosis, if this bill were to become law, would it be true that my hospital could not mandate that this nurse be treated for her tuberculosis before she took care of patients in the ICU?
So thank you, Representative. Let me see if I understand. You said you have a nurse with tuberculosis?
Yes.
And she could not be treated in the ICU?
She doesn't want to be treated.
She doesn't want to be treated.
Would that mean that I, as a hospital administrator, would not be able to keep her from working and taking care of patients in my ICU?
So I don't believe, because she is an employee of yours, I don't believe that in the medical profession, I mean, this has happened to me. I actually applied for a job at a hospital, and because of the mandates that they were going to require of me, I chose to not take that job. So I don't know. We're talking about public access. I'm talking about patrons going into establishments, into public housing. You're talking about an employer-employee relationship.
Thank you.
Yeah.
Again, this is Representative Pearson. As I read this, no individual shall be denied benefits of rights. What about children in going to school where there is a mandate for certain basic vaccines? My own opinion is this can go way, way too far, but there are certain basic vaccines that virtually all school systems agree to. As I read this bill, if a parent did not want that, the child could not be denied going to school.
So,
is that
so I guess there are a lot of people out there who are denied access, and they actually have to end up homeschooling or going to other schools because they refuse mandated vaccines. I can remember when the chickenpox vaccine came out, my pediatrician actually told me not to give my son the vaccine, but to infect him. And now I know that's a normal vaccine that's required to go to school. So, there's different, even within the medical profession, there's different ideas of what should be mandated and what shouldn't be. And I know there's probably a set standard, But if you base it, parents should be allowed to make, they know their children and they should know what's best for their children. I mean, you know, do we make an exception for schools? I don't know. But I think everyone should have the choice.
Let's grant that every parent has the right to keep the children from being vaccinated. If this bill were to pass, then Hempstead Middle School's policy of mandatory vaccines for a child to attend is now gone. We're not talking about the parents' rights here. We're talking about the school's right to set policy. If you do not get these vaccines, you may not attend this school. This bill would eliminate that, wouldn't it?
Thank you, Mr. Chair. Honestly, I didn't really think of schools when I was talking about this because I wasn't looking at the school as a public place, because to me, it's just like the public cannot go into that school. They are just, it's just for children. And if you actually want to go into that school, you have to go sign in, because not anyone can walk into that school. And children can already be exempt from vaccines based on religion. They can do religious exemptions already.
Is it not true then that you're broadening the exemption to everyone? And in terms of public school being public, I'm going to guess by its title, it probably is.
Okay. Then I guess you would need to put an exemption in that it doesn't apply to public schools. That's the only answer I have.
Okay, thank you for answering. Representative Merchant.
In today's environment, many people offer to go. In other words, you could order product online and you could actually show up and have it delivered to your car without having to actually go into an establishment. Would that not take care of a lot of the issue? Because it still allows the person to order something without having to physically go into the store. Yet they can still do their shopping. They can still obtain things that they need without violating the establishment's concerns about public health. Would that not be a way to allow people to still be able to shop and do things that they want in normal commerce?
Thank you for the question, Representative. So I understand why you would say that, but they are being denied access to food and beverage establishments. And that is part of everyday living, and that is part of, you know, human connection is really important. And we're denying them that.
Thank you.
Representative Cushman.
Thank you, Mr. Chairman. Thank you, Representative Comtois. Wouldn't you agree that this practice of, to speak to Representative Merchant's question, of making people who have medical conditions or psychological conditions, maybe developmental disabilities or religious objection to, say, wearing a face mask or accepting a vaccination, this practice of you know, having them to do curbside pickup or not allowing them into establishments is marginalizing a subset of society. It's a population group based on, you know, their rights of conscience or medical needs. Wouldn't you say that that is that's what this bill is for? It's to make sure that we're not setting up a two-tiered society that where people who can or will or do not object to certain medical treatments are allowed to participate, and those who do object or can't for medical reasons are then not allowed to participate in society?
Thank you, Representative, for the question. So yes, I mean, I am seeing, even in healthy people, that we have created classes already in society today. I see the psychological damages that's happening with children. I mean, children deal with emotion through facial. You can see what's going on with a child when you can see their facial expressions. By making everyone emotionless in this society is doing great harm. But that's a separate issue. So I would say that, yes, we have created two classes of citizens. And not only that, is you're making people who cannot wear one if they go into a place, the looks, the stares, I mean, they're made to feel like a second-rate person and that they don't deserve to be out in public. Who gets to decide that?
Can I follow?
Follow up.
Thank you. To speak to the issue about schools, I think that your bill is sort of extending the exemptions that we provide. We provide religious exemption and we provide medical exemption for the requirements for school children to be vaccinated. So there are already unvaccinated children in schools with vaccinated children and intermingling. They're not required to be, marginalized. We allow for that so that they're not discriminated against. Would you say that this bill is just expanding on that to the public?
Thank you, Representative. And yes, it is. It's, like I said, nobody ever should be discriminated against for any reason. And we have done that, and I'm seeing it. I'm watching families being torn apart over this. It is so sad what we have done to our society.
The chair recognizes Representative Kofalt.
Thank you. Representative, I wanted to ask about the question concerning tuberculosis or a medical worker. Would medical professionals potentially be covered under Federal Regulation 29 CFR 1630, which does essentially carve out a scenario in which there is a direct threat and can call upon the employer to either demand treatment or not perform their duties as normal if there is a direct threat as a result of a medical condition. Do you believe that this federal regulation would apply under these circumstances?
Thank you, Representative Kofalt, for that. And I'm not familiar with that CFR directly, but I would assume yes, because I deal with public policy over in the environmental and agriculture, and there are certain guidelines where we have to be cognizant of public health, and that's very important. And this is not to take away from what's already mandated in certain sections of code. This is just to say you can't discriminate against people for not doing something. It's not saying if someone has tuberculosis or a, like a zoonotic disease or something, that you can't treat it or that you shouldn't treat it. It's saying stop discriminating because people cannot wear a medical device or do not want to take a mandated vaccine. Thank you.
The chair recognizes Representative Snow.
Thank you, Mr. Chairman, and thank you, Representative, for taking my question. What you're saying is that people who have certain beliefs have a right to make a choice. And I think equally, everybody else has a right to make a choice. If you're a physically vulnerable person and you wear a mask and you choose to socially distance and you follow all the rules, and this bill passes, and I no longer have any guarantee that the rest of the people are not going to follow the rules that have been generally accepted, doesn't that put me in a class that's being discriminated against? I can no longer access a public building because I lack any guarantee that I wouldn't be exposed to an extreme risk to myself. So your bill eliminates risk to one group of party, but it creates discrimination against another whole group who really believe that they cannot access those buildings because it is no longer safe.
And I'll add 2 words to that. Wouldn't you believe? To make it a question.
Would you believe? Yes.
All right, that's 3 words.
Okay, thank you, Representative. So this bill has nothing to do with social distancing. So social distancing can stay in place, but it does have everything to do with equal access to a public place. And I'm not saying that you cannot wear a mask. I'm not saying that someone can't wear a medical device or take a vaccine. I'm just saying that there are other people out there and that cannot wear a medical device or do not want to take the mandated vaccine. We should be able to coexist. If you choose to wear a mask, you're protecting yourself. And if you're practicing social distancing, because this has nothing to do with social distancing, then everything should be okay.
Follow up?
Yes, follow up.
I don't wear a mask to protect myself. I wear a mask to protect everybody else around me. And if I can't be sure that those people without a mask aren't ready to pass that illness on to me, even if I am wearing a mask, am I not being discriminated against?
Thank you, Representative, for the question. I don't believe that you're being discriminated against because no one's making you do one or the other or denying you access because you choose to wear a mask. However, you are being discriminated against if you choose not to. And it is about discrimination and equal access.
Well, I
Thank you. Ask an answer. Representative McKay, I believe you joined the meeting. Would you announce yourself, please?
I'll get it.
Representative McKay, if you are in the meeting, I think you are, would you please unmute and announce yourself?
Representative McKay, you need to unmute.
Okay. This is Representative Jim McKay. I'm present in Concord in my office, and I just finished getting my inoculation, and I'm very pleased. Thank you very much.
Welcome. Do you have a question? Okay, thank you. Representative Merchant.
No, I lowered my hand, Mr. Chairman.
Then let me ask another question. This is Representative Pearson in the chair. My undergraduate degree was in history. And so I'd like to recollect somebody in history about 100 years ago named Mary Mallon. We know her better as Typhoid Mary. And OTM had 3 options, as I see it, maybe theoretically. Number 1 was to receive treatment until she was no longer contagious and in the meantime be quarantined. Or if she refused treatment, she had the option to be quarantined. Or third theoretical option, she had the right to infect, we know, at least 53 people with typhoid. And if this bill were to pass, Typhoid Mary could have elected, I think, that third option. And so my question to Representative Comtois is this what you're intending?
Thank you, Mr. Chair, for the question. And no, it is not what I'm intending. I am not intending to say that if you've been exposed to something or have a contagious disease that you should go out in public. That is not what I am saying. What I am saying is that a healthy human being should not be denied access because of their medical choice, because of their choices. Now, right now, we have in place that if you are near somebody or have been in close contact with someone who has had tested positive for COVID, that you should quarantine or and not go out in public until you have had have tested negative, which I think is fair, and no one is denying that. You know, however, should you be denied access to a public place, a healthy human being denied access for not wearing a medical device?
Follow up, I do not see the word the phrase healthy human being here. What I do see on line 8 is no individual shall be denied a right by refusal. So our friend here, Mary Mallon, could refuse. There's nothing in here that says she has to be healthy in order to have these rights. Do you agree?
Could you please repeat?
Sorry?
Then I need to.
I wasn't able to hear you.
She wasn't able to hear you.
All right, let me continue, repeat it. In line 8, the bill says no individual shall be denied. And I do not see the phrase no healthy human being or no individual who is tested negative. It simply says no one shall be denied because they've refused treatment. So Mary Mallon, AKA Typhoid Mary, could refuse treatment, and by this bill, she's an individual who shall not be denied access. Is that correct?
Mr. Chair, I guess I can't really honestly answer that question because, I mean, we're talking about something in history, and I don't think that anybody, and this is my personal, in good conscience, would go out and infect people on purpose. I mean, I just don't see that happening in today's world, but maybe I'm wrong. I do believe that healthy people should have access.
Representative Shapiro.
Thank you, Mr. Chairman, and thank you, Representative Comtois. You've spoken eloquently about the types of psychological and material harm done to people through what you describe as discrimination. So I am wondering, in order for us to better understand how much of a problem this is, are you aware of any more objective collection of data about people who feel discriminated against because of this? Any kind of surveys that have been taken or places where complaints are made, but any kind of information that we could have that would tell us how big a problem this is?
Thank you for the question, Representative. I know of some establishments where folks would try and go into the with a disability and a food and beverage establishment, and the establishment called the AG's office on them. I know of an employee who had worked in a food and beverage establishment for over 20 years. And the patrons, she couldn't wear a cloth mask, but wore a shield and was discriminated against for that and had to cut her hours. And I'm actually not sure if she's still employed because she was discriminated against because of a severe medical condition. And this is an establishment that has been called on if they saw one little infraction, and it's not many because I've gone in there and almost, I would say 99% of the people are complying, as well as the workers. But the discrimination is happening, and that is just in one establishment that I know of personally. I also know personally the folks that were discriminated against going into a grocery store. And I know that because of that, they won't go to a food establishment places because they have that medical condition where they can't go from the door to their seat. So it is happening. And if I know of 2 places that that's happening in my little neck of the woods, how many other places and how many other people is this happening to? Would be my question.
Follow up.
Follow up.
That is what I'm asking. When you say, you know, how many other places is it happening? That's the question I'm asking, because we're going to be asked to vote on this and weigh a certain kind of public good versus individual freedom. And I'm trying to get a sense if we have an understanding of how much this is happening and how many people are affected. But I guess I would understand if there is no objective collection of that kind of data, which it sounds like there isn't, that you know of.
Thank you, Representative. No, I do not know of any data at this time.
The chair recognizes Representative Gay.
Thank you, Mr. Chairman. I actually have 4 questions, so if you'll let me just say them all at once, you can answer them however you'd like. Would that be okay?
Yes.
Okay. So if I understand right, this bill is not affecting rules on social distancing at all. That's question 1. Number 2, aren't employees who are sick already not permitted to work? Again, I don't think, and would you approve of an amendment that just added to, or they have declined a medical treatment, adding the words for an active communicable disease? OLS is fast, so would that be okay? Would that cover the concerns of allowing someone to come in who's sick? Isn't it non-discriminatory to allow no masks, no vaccines, because everyone else has the choice to wear a mask or have a vaccine? And we've been told repeatedly that we should wear masks to protect ourselves as well as other people. So I think that covers my four questions.
Thank you, Representative. And yes, I would be amenable to the amendment. And it is true on all your points that you spoke to. You know, we have to understand that there are people with disabilities that this mandate is doing harm to. And although people say there are exemptions under the ADA, there is not, because the federal guidelines say that disabilities are not are gone away under this. So people are being discriminated all the time.
Representative Cannon.
Thank you, Mr. Chair. Representative, would this bill apply to elderly housing facilities where the occupants are high-risk people?
Thank you, Representative. Could you repeat the question, please?
Would this bill impact elderly housing facilities where the residents are high-risk people to high-risk to infection? Thank you.
Thank you for the question, and I don't believe so. I don't believe it would affect those facilities.
Again, Representative Pearson in the chair, are you aware of any federal laws or statutes that would nullify this bill should it pass?
Thank you, Representative. No, I am not.
Thank you. Anyone else? Last call, Representative Cushman.
Thank you, Mr. Chairman. Representative Comtois, are you aware of the statute language in RSA 141C that requires those who are ill with a communicable disease to be quarantined?
Thank you, Representative, for the question. No, I am not, but that would just be common sense.
Thank you. Follow up?
Follow up.
So would this law then would not override that requirement for certain communicable disease? And the commissioner does have that ability to quarantine someone who they believe is a threat. And on that subject, would you say that society is kind of tilting into a position where people are deemed sick until proven healthy?
Thank you, Representative, for the question. I wouldn't go, yes, the HHS commissioner does have the ability to quarantine an individual. That is true. I don't know if society has tilted that far yet. However, fear has been instilled into the populace, and I am very concerned of the psychological effects that it is having on our populace as we speak. And I see what it is doing to children. We see a rise in emergency room cases due to thoughts of suicide and depression for kids. That is a fact that was reported in a local newspaper. So all of this is having a detrimental effect on people.
Seeing no further hands up from the committee, the chair thanks Representative Comtois for her testimony.
Mr. Chairman?
It is the custom of the committee to take state representatives not in the committee next, and we have none who are signed up.
Mr. Chairman?
Then it is the custom to take people from state agencies. And so the chair calls on Ani Malachi, and he's a state agency staff member, and Ani is called into the meeting.
Mr. Chair, we do have one more hand up amongst the committee.
I did not see it, I'm sorry. Ani Malachi is called into the meeting.
Hey, it's me. I'm sorry, I was testifying, Travis. I would have taken your call.
Good
morning.
Thank you, Ani.
Okay. Yes. Good morning, Mr. Chair and committee members. I do have a point of order question. Would you like for me to continue, or did you want to recognize the representative or representatives that had additional questions before I start? I'm very okay to wait.
I appreciate that. We have a lot on our plate today. I appreciate your going ahead.
Okay, thank you very much. Good morning. For the record, my name is Ani Malachi. I am the Executive Director of the Human Rights Commission. And I will try to, without going into too many dizzying details, really try to sum up my testimony. I do need to go backwards a little bit to talk about the commission and then move as briskly as possible without moving too quickly into the topic at hand.
I would appreciate brevity, please.
Absolutely. For those of you who may not know, the Human Rights Commission, established in 1965, is the enforcement agency for New Hampshire's laws against discrimination. We cover employment, public accommodation, housing, and education. K through 12 was added to our statute in 2019. So just for the sake of the conversation, I need to read to you two definitions for public accommodation, and then we can move forward. So in our statute, which is RSA 354-A, and the definition that I'll be reading is in section 2 under definitions. And it is Roman numeral 14. And it says a place of public accommodation includes any inn, tavern, or hotel, whether conducted for entertainment, the housing or lodging of transient guests, or for the benefit, use, or accommodations of those seeking health, recreation, or rest, any restaurant, eating house, public conveyance on land or water, bathhouse, barbershop, theater, golf course, sports arena, healthcare provider, and music or other public hall, store or other establishment which caters or offers its services or facilities or goods to the general public. And then there's a carve out for private clubs. So that's fine. And then the one other thing, because this, if this passes, this goes into 354A16. And 16 deals with discriminatory practices. So there's quite a bit there. But in a nutshell, what this tends to do, and I appreciate Representative Comtois' very passionate testimony and her patiently taking questions and answering those and wanting to look after the constituents that have contacted her. Ultimately, what this does is, based on the language that's there, it creates another protected class. So usually a protected class is based on immutable characteristics. And that's where we go with age, your sex, your gender identity, sexual orientation. Those two were added more recently: race, religion, color, marital status, physical or mental disability, national origin. Those things are covered under our laws against discrimination, which are in line with the federal laws against discrimination, the 1964 Civil Rights Act. We are a little more restrictive with gender identity. So when you have what's written here, you are saying, regardless of my physical disability, because I think that was where the Representative Comtois was trying to go, this says anyone at any point can say, I can't be discriminated, quote unquote, discriminated against for not participating in these requirements. And we already have the ADA, which provides for that. If it's an employment setting, then the employee has to have some level of conversation with the employer to work through what's called a reasonable accommodation. And there are businesses that have created reasonable accommodations for people who have not been able to wear a mask or can only wear a shield, to meet them at the curb. In some places, it doesn't matter what your physical condition is, they will do curbside pickup. And so what this is doing is it won't just affect the number of people that may have a disability. This is open to every single person who wants to refuse a medical treatment, refuse a medical test, or a vaccination, or a medical device. And I'm not sure how you would get into HIPAA to determine if I don't want to wear a mask because I just don't want to, but someone else can't wear a mask because of a medical condition. That's personal information. So I'm not quite sure how we square that circle. My looking at this, certainly it would be something that would have to play out in the courts. And if there were someone that were suing us because we didn't take a case, the AG's office would have to make a determination. But many businesses that are following the guidelines that have been presented and have the signs posted, you can't come in without a mask, et cetera. Those are things that are the law of the land. And so they are in constant communication with the Attorney General's office, who would then make that determination. So to make this law sort of goes around what the Attorney General's office is doing. And I don't know, that would be a conversation to have with the AG's office. I certainly have more to say, but I will pause here, and I am absolutely open to any questions or clarifications needed. I thank you all for your time and your patience.
The chair will now entertain questions for Ani Malachi and a leftover question for Barbara Comtois. And I believe that would be Representative Woods.
Thank you, Mr. Chair. Just as an aside, I had my hand up for some time. Is there another way that I should use other than just raising my hand on the side? in the Zoom. Is there a better way for me to raise my hand?
I think this was a little accident from our normal, very good procedure, so I can't think of anything.
Okay, I thought it might have something. Thank you, Mr. Chair, and thank you for taking my question, and either might be able to answer it. I too had questions about Typhoid Mary and the healthy individual. The question that remains is, does this apply to the vaccination card to get on an airplane at Manchester Airport and the use of masks in that venue?
Thank you for your question, Representative. I would like to say yes on that, but my guess is going to be because you are leaving one state and going to another, what we dictate here would also have to be applied in everything being flown over. So I can't honestly say that that would apply to airlines, although I would like it to.
Now, any questions for Ani Malachi? And we've got a list going, and Representative McMahon.
Thank you, Mr. Chairman. Ms. Malachi, relative to the 354A law that you referred to, and knowing it's the specifics that the bill is addressing relative to a medical effect on our fellow citizens, do we have a precedent that provides a doorway for adjustments in this bill that is reflected in 354A10 number 6? Specifically, what that refers to is AIDS and the medical exemption, not exemption, but statement that you couldn't discriminate if an individual had AIDS and preventing them from entering a space. Does this not apply, or would that be similar to what is being proposed here?
Representative McMahon, thank you very much for your question. I would actually have to take that up with the Attorney General's office to see if there's a similarity. However, this is specific to people that have one issue. So that would be AIDS. The bill that we're discussing, HB 506, is relative to anyone, anywhere that would refuse to wear a mask, to have a medical test, to have medical treatment, and not be able to, quote unquote, discriminate against them. So relative to AIDS, that's one segment of the population. Whereas this bill is available to the entire population. And then the other piece of that would be there could be a health and safety issue. So if I have, and we're in a pandemic, so however you feel about that, if you're looking at the ability of this disease to be communicable, and then whatever information we know now to attempt to slow that down or stop that. If I choose not to participate, certainly that would be my choice, but then we're removing the choice of a business to keep other customers as well as their employees safe. And so a health and safety concern would be a plausible defense for a business if it was an employee-employer conversation. That would be something, if there was a charge of discrimination, that we would take into consideration. So I'm hoping that I answered your question.
Thank you, Ms. Malachi.
Any other questions from the committee? Representative Gay.
Thank you, Mr. Chairman. Mrs. Malachi, how do you feel about those of us who have hidden disabilities? Would that mean that we would have to be card-carrying disabled people in order to be covered and protected by bills like this? My allergies are hidden, but they put me at great risk taking the vaccines. So, I mean, this sounds like to be considered protected by anti-discriminatory bills, we would have to go get somebody to document that we are handicapped or disabled. What is your feeling about that?
Representative, thank you for the question. To be very transparent, I work really hard to leave my personal feelings out of the conversation and really look at the law as it stands to understand and interpret what the legislative body has instructed my agency to do. And in so being, I have to follow the rules that are here. And we give guidance. We have businesses that contact us. We have individuals that contact us for guidance. And we absolutely administer that guidance, not bearing on one side more so than the other. To have a card of some sort to prove a disability based on your question, that would be something that would be above my pay grade and would not at all be something that I would determine. What I would do is if there was a law that stated one way or the other, then we would follow that law and explain to individuals and businesses what their responsibility is to follow the law. And that is my job. That is my due diligence to make sure that that happens. The ADA is available for people, and I do understand that some people's disabilities or illnesses are hidden, but there's nothing that I can do to force someone to comply with the law. I can explain what the law is, make sure people understand what their rights are, and for businesses to understand what their legal responsibilities are. And then, of course, the Attorney General's office for the state of New Hampshire will interpret those laws and further assist businesses and individuals in understanding what their responsibilities are. And such has happened during this time, as there were fines that were levied regarding businesses and other issues. So that would be the most concise and most clear answer I could give you to that question. Thank you.
Follow up.
I understand. Thank you for taking my question. I am trying to understand and accept that you are, let's see, what's the right word? Hindered. You have strong responsibilities to follow the law. And yet they are putting you in a position, are they not, of commenting on a proposed law. This sounds like it's kind of out of your area of responsibility, and that I appreciate that you're trying to follow the responsibilities as defined.
Question?
Well, is that how you feel, that you must abide by the laws, but yet this law is something different, and so it's not in your regular responsibility? Question mark.
Thank you for the follow-up question. Anything relative to 354-A is my responsibility, whether it's on the books or proposed. And my duty here today is to advise or to inform the committee, should this pass, this is what we're looking at. We're looking at everyone and anyone being able to refuse or decline medical treatment, medical tests, or vaccinations, or medical devices. It's not specific to people with disabilities, whatever that disability is, whether it's a physical disability, so autism, or someone that has a sensory issue, whether it's someone that has a medical disability, meaning allergies or emphysema, et cetera. The CDC has guidance on what businesses can do. And so maybe there's a better way to communicate these things. However, there are competing interests. So I'm the enforcer of the law. Well, not me personally, but my agency enforces the law as it is written. The AG's office does their level of enforcement. The CDC is providing information. We have our public health officials providing information. And I mean, at the end of the day, hopefully when however many people decide to become vaccinated or enough people have it and we have this herd immunity thing, this is a non-issue. But I look at this not relative to COVID today, but once the law is on the books, what does this look like going forward? Even though we're talking about a pandemic that is happening right now, there are other things that may move forward. And so if I have whatever I have, I'm not required to disclose that to anyone. So I could have something else that's highly infectious and communicable, and I decide that I don't want to wear a mask or some other way to stop myself from spreading to others. I could do that with the language as written. The larger concern for me is making these individuals a protected class. That adds another protected class to the list that we are currently responsible for. Whereas there is the ADA that deals with people specifically with disabilities. And the hope would be that businesses would work together with an individual that has a disability who cannot enter and find some common ground for that person to be able to participate with that restaurant or that business. But, you know, as we know, if people are staring and jeering or complaining about someone, this bill does not stop the heart of someone. So what we're looking at is entering public spaces and being charged with discrimination for the business potentially following the law. So I hope that answered your question.
Anyone who hasn't spoken has a question for Ms. Malachi. Seeing none, I thank you for your testimony. And we do have a hearing at 10 o'clock, and it is now 10:15. And the chair invokes a custom when there's numerous people willing to test or wanting to testify, to put a time limit on that. In the past, when we've done this and it has been in the committee room, it's quite easy for someone to hold up a sign saying, you have half a minute left. It's difficult to do it here. And I've been wrestling with how to do it because the last time I did it, we just simply had people's microphones cut off. That left me unsatisfied, and I'm sure it left others even more so. So I took counsel with people who've been here a long time, and this is what they suggested we do. When we call on the people who have signed up indicating they wish to speak, you will be given a certain time amount, and you'll be given a 15-minute warning, so a 15-second warning. So if you hear something that's spoken about as loudly as you're speaking, that is your 15-second warning, which means you wrap it up, and at 2 minutes, your microphone goes off, and we go to the next person. We had a wonderful example last time of somebody who said 3 very powerful points in 38 seconds. It can be done. So with that understood, just to Christina, are you watching the meeting?
I am, Chairman. I am also running 2 meetings, though.
I'm sorry, I can't hear you.
Yes, I am.
Thank you. So we're going to be giving each speaker 2 minutes, and at 1:45, if you could say 15 seconds to go, and then at 2 minutes, we'll go on to the next person who's called.
Would it be possible for Representative Acton to do that? Only because I have 2 meetings going on at the same time, and I worry that I won't be able to keep up.
Yes,
I volunteer if you need a volunteer, but if Representative Acton is ready to go, that's fine.
Okay, and we have people back up as well. Thank you. The chair recognizes Mary Holland, and your email address indicates you're from the children'shealthdefense.org. So if Mary Holland could be unmuted and come into the meeting, please.
Quick point of order, Mr. Chair. What was the, is that a 3 minute?
2.
2 minutes. Okay, I got that. And if the next speaker could raise her hand so I can promote her.
I'm sorry?
If the next speaker could raise her hand, we have 98 people in.
I raised my hand. Can you hear me? This is
There we
Mary.
go.
Okay, you're good, thanks.
Great. Thank you so much. I appreciate this brief opportunity. I don't think there's any question that under public health laws, state and federal, one can isolate and one can quarantine people who are proven to be infectious. I think the issue really revolves around vaccines, testing, and masks, all of which right now are considered emergency use authorization devices or products. In other words, none of those things for COVID-19 have yet been proven to be effective. They've been authorized. And so I think the question to you as legislators is, do you want to participate in creating a regime around separate but equal? People who don't mask, people who don't test, people who don't vaccinate. Those regimes of separate but equal are already being put in place around the world. And even in New York City, where I exist, children who don't submit to testing, which is not proven to be correct or accurate for infectious status, are being restricted from access to public school. They must go into remote learning. There's no question that remote learning is not equal to in-person learning, and yet that is what's happening. So I would urge you to consider very carefully, do you want to create that kind of society where if someone won't wear a mask or they won't submit to testing or they won't be vaccinated, they are in effect put into internal exile? That's the issue. Thank you.
Thank you. Thank you very much, and for your brevity, appreciate that. The chair calls upon Lisa Matthews. And yes, when you're called, please put your hand up so we can find you quickly. And then unmute, thank you.
Unmute. Okay. All right. Can you hear me?
We can.
Okay. Thank you so much. I want to try and keep it brief. Growing up in this great nation, and especially in New Hampshire, I've always known that America is special, the beacon of hope to the world. I have taken for granted my freedom and my liberties. Now that I'm in my 50s, time has taught me that when we give up freedoms and liberties, it's very hard, if not impossible, to get them back. I'm an avid believer in the Constitution of the United States and the Constitution of New Hampshire. Other countries are forcing their people to fall in line with this idea that in order to be free, you must do what we say first. That's not the way America does it, and it's definitely not the way New Hampshire does it. You can look through the Constitution forever and you will never find anything that would oppose this bill. It is right in line with our great Constitution. When I think historically about the times where having freedom relied on doing what you're told, it was the beginning of the end for all freedoms. We all know the countries and oppressed people I speak of. Thank you so much for this bill and this opportunity to support it. Live free or die. I only have a follow-up thing, a couple of things for Representative Shapiro, because I happen to live in the Keene area. In the Keene Sentinel, there was an article about a mother who had her baby in a pack in front of her. She went into the Monadnock Food Co-op and the baby was fussing. She had to take down her mask briefly to speak to it, and to try and calm the baby. And she was followed, harassed, yelled at, humiliated in public. They called the police on her. It was a horrific scene, according to her. My last thing, as a registered nurse who works in Massachusetts on a COVID unit, I can tell you that out in the public, we should have a greater fear of picking up MRSA, MSSA, C. diff, staph, those sort of things, than what a mask can protect us in the community. Thank you.
Thank you. The chair recognizes, and I apologize, please help me pronounce more accurately, Radaya Sivalingam. Radaya Sivalingam.
She's not listening. She's there. She's muted.
You have to unmute.
Thank you, Mr. Chairman, and honorable representatives for offering me the opportunity to speak. I'm here to share testimony to support non-discrimination on the basis of medical choice. There are many reasons I'm in support of non-discrimination, but for today I would like to focus on 2 points. First, the importance of approaching medical choice with cultural humility and responsiveness. And second, the need for true informed consent. First, I'd like to speak to the importance of cultural humility and responsiveness as it relates to supporting individuals and making their own medical choices. I stand with my peers who consistently advocate for the importance of self-reflection, awareness of our own viewpoints, and humble recognition that our ways of viewing the world are not shared by all, and that it is incumbent upon us to be responsive to those with cultural differences, even when their voices may be few, and even when we may not understand the perspectives they represent. In the past year, it has become obvious that there is a dominant health ideology that has sought to eliminate all alternative ways of thinking and seeing life, death, health, and well-being. Instead of responding to a novel situation with humility and openness to cultural, religious, and indigenous approaches to health, we have instead entered a realm of centralized, authoritarian health dictates which seek to shame, silence, and marginalize all of those who disagree. Instead of responding to a novel situation by honoring the creative potential of our neighbors as fellow souls to come together to express and share their inherent health wisdom, the public health authorities have shut down channels of communication and minority perspectives who have dared to share hope, optimism, and encouragement. I'll close by saying it is not in our true nature to coerce our neighbors, to ignore their inherent health wisdom, nor should we insist they make specific health choices to engage in society. Thank you.
Thank you very much. The chair recognizes David Smith, Esquire, from Bloomfield, New Jersey.
Good morning. Can you hear me?
Yes.
Okay, good morning. Thank you so much. I'm representing Mr. Sivalingam. And in support of this legislation, the Genocide Watch lists 10 signs of genocide, including classifying people and limiting their rights to access to different things based on their classifications. And the head of Genocide Watch, when he was confronted with the issue of all these classifications occurring today, said, oh no, this doesn't apply to our times because everything we're doing today is scientifically based, and it's therefore justified to classify people, and therefore it's justified to exclude people. And this is the fatal flaw of our times, that we're putting ahead that science trumps everything, trumps people's ability to choose, trumps ability to think for themselves, and only one thread of scientific thinking is allowed. What we have to recognize is making the distinctions of essential, non-essential, healthy, not healthy distinctions are the distinctions that were established in Germany as the public health ideology took force in Germany in the 1920s in the Weimar Republic, and then it was taken with the most efficient execution of it through the Holocaust, where people were identified as essential, non-essential, and was not limited to the Jews. It was attacking the people who were not healthy, attacking the people who were considered disease bearers, of which the Jews were then conveniently identified. So death, as John Stark said, John Stark said, is not the worst of evils. The fear and hysteria today is because that has been lost. And as a result, live free or die cannot be kept in effect if people think that death is the worst of evils. Our job is to make sure that cruelty does not become the ruling paradigm in the name of public health that will eliminate the rights of every person to investigate, inquire, and make their own decisions and live their lives. Thank you.
Thank you very much. The chair made a mistake earlier when I said that we call on people from the state agencies earlier. I didn't turn the page over. So the chair now calls Patricia Tilley. Patricia Tilley, DHHS.
If she could just raise her hand, it would be much easier to identify.
Thank you.
Good morning, Chairman and committee members. Thank you for the opportunity to provide information about the impact of HB 506. Again, for the record, my name is Patricia Tilley, and I represent the New Hampshire Department of Health and Human Services Division of Public Health. As Ms. Malachi and the Human Rights Commission noted, the public accommodation definition is broad in scope, including not only retail stores, but also food establishments and healthcare. And as you know, there are particular considerations that must be made when we think about health and safety in these places, in restaurants and healthcare provider offices and other areas that are included within that definition. This committee has already thought through some of these questions as you considered HB 220, which stated that individuals had a right to bodily integrity, free from threat or compulsion. And as you may recall, that bill was amended to not limit the ability for DHHS to order treatment or quarantine, as has been discussed in this hearing. It also was amended to not supersede the requirement for vaccination as a prerequisite for admission to a school or childcare agency. The amended HB 220 also considered that healthcare providers or hospitals or even other employers were appropriate in limited scenarios in enforcing certain requirements for vaccine or medical treatments in order to protect the health of others, and in very limited cases to protect the health of the individual. You know, minimizing the transmission of infectious disease is a core function of public health law. In general, public health laws should authorize compulsory treatment only in circumstances where individual behavior creates a significant risk of transmission of a serious disease. As discussed, if a medical device includes masks or face covering, HB 506 could limit healthcare providers from requiring individuals to wear masks or maybe even gloves that protect the health of others in seeking care in the same environment. As written and discussed, HB 506 may impact our ability to protect the public's health from communicable disease, and the committee will have to balance private rights with the public health interest today and public health interest in the future. Thank you.
Thank you. The chair calls Andrew Manus from Derry, New Hampshire. Please put your hand up, and you need to unmute yourself as well.
Honorable members of the committee, I've come before you in support of HB 506. This is a bill that will clarify existing law, but ensuring that bodily autonomy is always protected as a civil right in New Hampshire law. Arguably, human immunity is an immutable idea, whereas gender identity or marital status may not be immutable. So I would counter that argument in that way. Currently, the law protects equal access to places of public accommodation for all people, regardless of age, sex, gender identity, race, creed, color, marital status, physical or mental disability, national origin, or sexual orientation. Arguably, whether or not I wear a facial covering, face shield, take a COVID-19 test, or show proof of vaccination, I'm already protected under this law due to my faith or my physical or mental disability, or all three. Those can certainly account for my protection under the law, but I believe that because of violations of people's rights during this pandemic, that the clarification in the law is absolutely necessary so that people like me, whether or not I have a disability is irrelevant. This law should apply to everybody. And I feel that for me, it is a matter of faith. And so I guide you to my written testimony, which is far more voluminous than I can speak in 2 minutes. But what I want to summarize and say is the language in this bill simply states I have a right to buy essential goods for my family, which is a human right to be able to feed my family without having to be vaccinated or tested or wear a mask. Wearing a mask is ineffective. Masks do not work to prevent the spread of virus. There have been multiple studies that show this. I can show them to you if you would like. But this bill is a clarifying act to protect my constitutional rights. The government is instituted to protect individual rights, and I would argue that this bill is simply codifying that. Thank you, committee members.
Thank you, Mr. Sorry. Sorry. The chair calls Fred Miller from Amherst. Mr. Miller, if you wave your hand and unmute, please.
No sign of Mr. Miller in the attendees.
Thank you. The chair calls Randy, I'm going to pronounce it the way I was taught, Hebert. Randy Hebert. If it's Hebert, I apologize.
Oh, I prefer Hebert, but I will take Hebert. Thank you very much for the French pronunciation.
Yeah.
I am definitely in support of this bill. I really appreciate this being brought forward. Yes, with everything to follow up on pretty much what everyone has been saying, there really isn't any documentation supporting masks, stopping the spread. They had referenced tuberculosis. You can ask most doctors, masking up for tuberculosis is like trying to swat a mosquito with a chain link fence, which is much like this virus. This bill is needed. I myself am tired of being asked for medical conditions or exemptions or anything to related to this in any place I go. My HIPAA rights are continuously being violated. I do not feel the need to have to explain myself to anybody. In other states, basically stores post the signs, you read the signs, no shoes, no shirt, no service. That's for your safety as well. But in addition to that, if it is understood that someone is not wearing a mask, it is their right to have their HIPAA rights protected. It is understood that if they have a mask that they are not wearing, then they should probably have a medical condition. This is known in other states that they do not harass people. And this is what's going on here. People are being torn apart out of the sheer fear of this. The data that exists in Health and Human Services is non-existent. You haven't even isolated this virus. This virus is nowhere to be found in this state. Health and Human Services has been requested for this information. I've had 91A requests. There's nothing supporting this. And I strongly urge that this bill be passed for the sake of integrity and the sake of our privacy and for the sake of our own choice. The government has the right to protect us, but the government does not have the right to dictate medical censorship on us. Thank you.
The chair calls Julie Tucker. And would you raise your hand, please, and unmute.
Okay, yes. I speak in support of House Bill 506. The mask mandate that we are living under currently does have exemptions for people with health conditions that make it unsafe for them to wear a mask, and rightfully so. The problem is those exemptions are not working. Not that I do have my HIPAA rights, but I'll explain to you, I have a disease called multiple sclerosis or MS. It has caused me many difficulties that I do not want repeated or exasperated. I get an infusion that kills my B cells, lowering my immune system. My doctor, who made me a lot better with this disease, advises against me wearing a mask for my health. I trust him implicitly with my health decisions. He is a medical doctor, not a politician. He also says numerous studies have shown I will not harm the health of anybody else by not wearing a mask, as this virus aerosol is small enough to get through any mask. I have been publicly harassed by store employees for not wearing a mask and have been refused service. I have politely explained to them I cannot wear a mask for medical reasons, and therefore I am exempt. At 2 different stores, employees told me they do not honor the governor's health exemption. I am very courteous. I always keep my distance from fellow shoppers, and I shop as late as possible at night. I have been yelled at across a store for not wearing a mask. And again, I have a health issue that does not allow me to wear one. Last, do not compare no shirts, no shoes, and no service to wearing something over your mouth and nose that impedes your ability to breathe fresh air and oxygen. They are not the same thing. And as my doctor has told me, I need oxygen to do well. I hope you vote in support of this bill.
Thank you, Ms. Tucker. The chair recognizes Kelly Potenza. Please put your hand up and unmute.
Can you hear me?
We can.
Yes, I'm calling in to strongly support this bill, and I kind of speak with everyone else that has been saying this too. And I think it's very clear that we have to define mandates are not a law, and everyone's talking about all of these things, and politicians are involved in this. When you have a 14 or 15 or 16-year-old person at a grocery store that is using their dirty hand to reach into a box to hand you a mask. There are many people that have just invisible disabilities. A girlfriend of mine, her daughter has severe autism and can never put anything over her face. The amount of discrimination that has been going on is absolutely appalling. I could tell you stories and stories and stories. There was another person on here, I think it was a representative, that was asking about data. You want data? Go on Facebook, look on Health Freedom New Hampshire, look on all of these maskless support groups that are going on. There's tons of them in the States. We're talking thousands of people that are done with this. This is protecting people's rights. This virus has never been isolated. The testing is all bogus. Why are we muzzling people that have, that are healthy? I mean, you have people walking around by themselves outside with a mask on, riding a bike. It is just crazy. The amount of times that I have been accosted at the grocery store, at the dump, is just unbelievable. My daughter has anxiety. She can't wear a mask. My kids are home now because they can't be in school because we're masking up all of these kids all day long. This is just appalling. We need this to pass. No one's looking at the medical exemptions that the governor has in line 6. That mask mandate rule just basically gave everybody free will to discriminate against everyone that, wants to live freely. I mean, I can go on and on. Please support this bill.
Thank you, Ms. Potenza. The chair recognizes John Schmidt from Keene. And if you would put your hand up, please, and unmute. John Schmidt.
Mr. Chair, he is in and unmuted, but we can't hear his audio.
And I apologize to Mr. Schmidt for that. We'll try at the end. The chair recognizes William Finkston from Merrimack. And would you put your hand up, please, and unmute?
Good morning.
Yes, good morning. We can hear you. Thank you.
Thank you. I would just urge your support on this bill. As you've heard from others, I support it. In September 2019, I was diagnosed with hypothyroidism, which ultimately does affect my respiratory system. I don't currently and will not wear a mask. And I have been subject to looks, language, for both me and my family. It's got to come down to common sense, ladies and gentlemen. If you're sick, stay home. We're all adults. We know what's best for us. We know what's best for our families. So I'd urge you to do the right thing and let adults be adults.
Thank you, Mr. Fingston.
Thank you.
The chair recognizes Stephen Petty. The chair also confesses to envy because the address here is Pompano Beach, Florida. Mr. Petty, hand up and unmute if you would, please.
He is in the room and unmuted, but we can't hear him.
Again, apologies. We'll circle back in a few minutes, see what we can do. The chair recognizes Nick Paransevich from Concord. If you, sir, will put your hand up and unmute.
Mr. Chair, see if he can come through here.
I'm here. I would like not to make any comments at this point. I thought I was going to be testifying on a different bill at this point.
Okay, I've done that too.
Thank you.
Now, I have called on everybody who has signed up by this morning's deadline. And I would like to circle back just to those that we couldn't get. So that would be Fred Miller, Stephen Petty, and John Schmidt. So John Schmidt, Stephen Petty, Fred Miller, we're going to try to reach you as best we can. Representative Acton, I can't hear you. I don't know if you're just talking to not
Sorry,
me.
yeah, Mr. Schmidt is, we can't hear him even though he's unmuted.
Okay, sorry, Mr. Schmidt. How about Stephen Petty and Fred Miller?
I don't see either in the list.
Okay, so this is now exhausting the list of people who signed up to speak by the cutoff time. And if there's anybody else who either we couldn't hear because we just had a technological problem, or you wanted to testify but you missed the deadline, just please send the committee your written testimony and we'll take a look at it.
Mr. Chairman, there's only 3.
What's that?
There are only 3 who have
I
their hand
understand
raised.
that, and I've just decided what I'm going to do. And with that, I am now closing the hearing on 506. And we will take a 5-minute break before we move to what is next, which I think is House Bill 602, the continuation of the recessed hearing.
Hello?
Hello.
I did a whole thing on Egyptian history, early Egyptian history, and we actually made chadas, which is how they irrigated by dipping these things into the water of the Nile, and so we made our own. We had fun. I made this archaeological dig for each of them, and I basically used vermiculite and phosphoric Paris, but I hid a whole bunch of little objects in it. And then they had to dig them all out and then tell me about the person who those objects belong to. So you had to make a lot of
Bills on the surface, they sound good.
objects. Oh, no, those, I couldn't do that so much, but I used other things, because you can buy little miniature things in the store. So I had like little miniature garden things in one, and just a whole variety of things. Sounds so much fun. And it was great. And the kids, you know, we all had fun doing it, and well, I wasn't. I didn't really start working a lot of hours so much as a older. I was working and I was injured, and I couldn't work for a long time because I was having surgeries. And no, I was walking into the building I worked in, and the day after a blizzard, where we had gotten 2 feet of snow. And well, I was walking in, and it had metal slope roofs, couple stories, no snow gems. Landed right on me. Oh, yeah. So,
How the reimbursement?
You know, when the kids were younger, I couldn't work at that point because I was. Yeah, but you know, I could do most of it just sitting, and you know, I could. The thing is, what comes in is I could pace my day out. Yeah, that's right. You know, yeah. So when they Yeah.
So frustrating. I feel like to do laundry. Wow, whole accomplishment.
Yeah, my kids learned how to do their laundry when they were really young, and that was part of the deal. I would oversee it, but they'd have to get their own. They'd have to get their help.
Leah's young. She can do this.
Pass it down. You loosened it up for me. Yeah, no, it was too easy, so you must have gotten it very close.
That's what happens when you have arthritis in all of your finger joints.
Okay, are we back? Are we back? Everybody here? I can't hear you. Do we need to turn the?
Not muted. It's not muted on our end.
Okay, is it muted on the other end?
With someone on the outside line. We're here. Yeah.
Okay, good. Are we good to go? I call to order the continuation of the hearing on House Bill 602 FN, and there's been a flurry of activity. And the chair is going to call on Vice Chairman Marsh to get us up to speed on that.
Yes, thank you, Mr. Chairman. This is to reopen the public hearing on reimbursement for telemedicine, House Bill 602. We've heard an awful lot of testimony about audio only and how people would like that to be maintained. I personally contacted Senator Shaheen's office and learned that the 1135 waivers from the federal government that are allowed audio only on a temporary basis will continue through the end of the year. So that at least is put to rest for at least some time, but we do have more hearings that.
Thank you. Is Representative Edwards, the prime sponsor of the original bill, available to come into the meeting?
I do not see him in the list, Mr. Chair.
Thank you. Representative Weber.
Thank you, Mr. Chair. I was going to just say that Representative Marsh was a little difficult to understand, but that time has passed, so we're all set. I would also have objected to recalling Representative Edwards, who's already testified.
My predecessor is correct. Thank you. The chair calls upon Courtney Tanner listed as a lobbyist from Dartmouth Hitchcock, who is opposed to 602 as originally put forward.
Good morning, Chairman Pearson. Can you hear me?
Yes.
Great. Thank you so much. My name is Courtney Tanner. I'm the Director of Government Relations at Dartmouth Hitchcock. I appreciate that there's been a lot of voice about this bill, and I'd like to add a couple of thoughts. First, I want to note that since February 2nd, since the hearing was published, we received a lot of inquiries from providers and concerns about House Bill 602, both as it was originally drafted and as amended. In that vein, I just want to note for the committee that Dartmouth Hitchcock has supported and helped providers and administrators submit testimony. You'll find the written testimony in your inbox. That testimony has come from Dr. Will Torrey, the Department Chair of Psychiatry at Dartmouth Hitchcock Medical Center, Dr. Kevin Curtis, the Medical Director at the Connected Care Unit at Dartmouth Hitchcock, Catherine Wilberger, the COO of Cheshire Medical Center, and Ben Gertson, who's a primary care provider in our national clinic. I want to back up for just a second and remind the committee that there's been a lot of work done on telehealth, and that work was done last session. As you know, House Bill 602 1623, which was passed last session, shifted telehealth reimbursement and coverage in New Hampshire. And as originally drafted, House Bill 1623 was based on a premise that of providing necessary treatment to vulnerable populations. Representative Marsh's original bill expanded telehealth services for MAT to special populations. However, responding to a need and a group of bipartisan senators and representatives worked to expand House Bill 1623 to make it the innovative telehealth bill that we saw last session. Thanks to Representative Marsh, Senator Bradley, Senator Khan, and others, House Bill 1623 ensured access for the most vulnerable populations in New Hampshire, the elderly, people living in rural pockets, people without means, just to name a few. House Bill 1623 also created a commission to study telehealth services in New Hampshire, and that commission was charged with collecting data from provider facilities, the New Hampshire Insurance Department, Department of Health and Human Services, and other sources to review that data. And upon review, the commission will recommend legislative changes if appropriate. As DJ Betancourt, the Deputy Commissioner of the Insurance Department, testified in your February 2nd hearing, there are many unknowns still. It's still too soon to make policy changes for telehealth in New Hampshire. We must allow the commission to study the data that will be put forward and make policy recommendations. House Bill 602, even as amended, is a bit premature and I think uninformed at this point. And so we recommend that the committee vote ITL for this bill. I'm happy to take any questions from the committee.
Any questions from the committee? Do you see any questions from the committee? Seeing none, thank you for your testimony. The chair recognizes Kevin Curtis from Lebanon, New Hampshire. Your email has Hitchcock in it. So, Mr. Curtis, if you would put your hand up and unmute yourself, please.
I do not see Mr. Curtis.
Thank you. Chair recognizes.
Sorry, he just popped in.
Just in time. Mr. Curtis, please. Thank you.
No, I'm sorry. This is Matthew Hood, also at Dartmouth Hitchcock.
Okay.
Dr. Curtis is coordinated his testimony with Courtney Tanner, who you just heard from, and we had, I think Courtney mentioned, but I would just reiterate, we're happy to have Dr. Curtis available, but we just wanted him to be a resource for the committee. So what he was going to present, I think you have in writing, and was shared with by Courtney Tanner, and we're happy to circle back with the committee should you wish to hear from Dr. Curtis, but I don't think he's available at the moment.
Thank you very much. Appreciate that. The chair recognizes Lindsay Staples. If you would please put your hand up and unmute.
Good morning.
Good morning.
So hello, my name is Dr. Lindsay Staples, and I'm a licensed psychologist in the state of New Hampshire. I appreciate the opportunity to share my experience and illustrate why in mental health, telehealth and phone services are equal to or greater in value than in-person services. Next week will be 1 year since, with hesitation, I transitioned all of my patients to telehealth due to COVID. I believed that the video conference format would adversely affect quality of care. It turns out I couldn't have been more mistaken, because these tools have instead helped my patients get better faster than ever. Some people feel like you lose something over telehealth, and I get it. I don't like spending time with friends over Zoom as much as I like spending time with them in person, but therapy is not a chat over coffee, it's a medical intervention. In the past year, I've observed that telehealth not only preserves the essential ingredients of effective mental health care, but also has resulted in increased remission and the lowest ratio of hospitalizations among my own patients that I've ever seen. I believe there are three main reasons for this: accessibility, customizability, and generalizability. First issue, accessibility. Clinicians agree, better access to outpatient services creates better outcomes and reduces hospitalizations, which are a costly tool of last resort. Second, telehealth improves my ability to customize interventions to the needs of the patient. Most gold standard therapies involve behavioral exercises. Most exercises cannot be easily simulated in an office, so clinicians end up assigning homework, crossing their fingers the patient actually does it. Over telehealth, we just do it in the session. It's not a simulation, it's reality. Third, generalizability. There's a principle of human learning that says when you learn something in one environment, it's hard to carry that learning over to another environment. In short, therapy sticks when you do it at home. I've learned firsthand why telehealth is the future of mental health care and not just a substitute format during COVID, and it should be reimbursed accordingly. With respect, as a practicing psychologist, I would ask that the government avoid creating interference in my clinical decision-making and avoid restricting my ability to respond to trends in an evolving market. The impact of this bill cannot possibly match the intentions of those proposing it. It will harm patients, add to costs of care, take choices away from doctors, and stifle the market if parity is not protected. Thank you.
Thank you. Any questions? Seeing none, thank you for your testimony. The chair recognizes Ann Campbell. And your email says you're administrator at the Campbell Houses. Please put your hand up and unmute yourself.
I do not see her as an attendee yet, Mr. Chair.
You. Chair recognizes Dr. Catherine Robbins from Hanover.
Hello, good morning. Can you hear me?
Yes, Dr. Robbins, welcome.
Thank you so much to be with you all this morning. I'm Dr. Katie Robbins, and I come to you as a board member with the New Hampshire Psychological Association and chair of its Public Relations and Public Ed Committee. I'm also a clinical child and family psychologist here in the Upper Valley and travel widely to other parts of New Hampshire. You know, as you all know, we do have the mental health crisis nationally and in New Hampshire, and with that, a workforce shortage of providers to meet the need. And these issues weren't caused by the pandemic. They're really only worsened, and we expect the issues and the need to continue. We would like to be on record to oppose this bill. We see it as detrimental to these longstanding issues. Two words I really want to highlight: access matters. It should matter to all of us, and we should be doing everything we can to promote and preserve people's access to care in whatever form that is, and the provider's ability for that access. Quickly, two parts: the audio-only services of telehealth. In a recent survey to providers that we did, we know that 73% of our providers use audio-only services. That's almost 3 out of every 4 providers. And why? Well, lack of internet, difficulties with internet, visual impairment issues, sometimes just due to privacy needs. And as an example, I would have a colleague with me here this morning, Dr. Atkins, but he's actually doing an evaluation of a veteran in the Colebrook area. He expects that that evaluation will be primarily audio only for the difficulties I just talked about. We want and need regulations that clearly state audio only is reimbursable, and we feel the wording in this amendment is pretty vague. Lastly, I just want to address the parity of the reimbursement. Really regulating parity is critical. The services we provide regularly through in-person or telehealth are really the same, and the overhead cost is going to be the same. If we get reimbursed at lower rates than in-person services, we're worried that providers and practices might be forced to limit the telehealth offerings to not lose income, and that could result in reduced access for our underserved populations, and a negative economic impact because there's so many small businesses of mental health providers. So thank you for your attention. We just really want to highlight that we want and work hard to meet the need, and we really need to promote access and parity so that we can do it. Thank you so much.
Thank you, Dr. Robbins. Chair recognizes, and I'm going to make a stab at it, John Desjouet. If you put your hand up and unmute.
Thank you, Mr. Chairman, members of the committee. For the record, my name is John DeJoy. I'm here representing the National Association of Social Workers, the New Hampshire chapter specifically. The NASW New Hampshire is a membership organization which represents licensed and unlicensed social workers throughout the state of New Hampshire. I rise on their behalf to oppose House Bill 602. For much of what you've heard today, and I won't repeat what you've already heard, what I will say is that we think that telehealth has been vital during the pandemic, and we agree that it will be vital moving forward for our clients and other clients across the state. But even more importantly than that, we think it's premature for this bill to come forward. The law was changed last year, and as part of that, this committee was used sorry for my puppy, used significant foresight in creating a commission to review all of the questions that you've been hearing and others that we heard last year. That commission is active and moving forward, bringing people in to discuss these topics, and is not even required to submit an interim report until 2022. We suggest that changing the legislation at this point is premature until this commission is permitted to do their work, and would respectfully ask the committee to allow that commission to move forward. With that, I will conclude my testimony.
Thank you very much. The chair recognizes Catherine Wilbarger from Keene, and it looks like Cheshire Medical Center. If you would put your hand up and unmute.
I do not see her in the list, Mr. Chair.
Thank you. The chair recognizes Dr. Deborah Warner.
Thank you very much. I appreciate the opportunity to testify before this committee. It's an honor always to be able to participate in our government process. So thank you very much for this. You've received my written testimony previously for the February 2nd hearing, and also some communications since then. I did submit something yesterday, and as you know, we are, as psychologists, having quite a time dealing with telemedicine. There's much to do, and as Dr. Lindsay pointed out, there's a lot of application work that's done. It's very fast moving, and I think it's very, very good for the patient. We want to make sure that the fees that are able to be reimbursed by the insurance companies remain the same as in live, in person, and in office sessions. That's essential to this. When it was lower before the previous bill that ensured parity, we got to a point where you could only afford to have a very few number of telemedicine patients. And I would think that that's damaging to the access to care. We also, I've been in communication with Representative Edwards, as you may be aware, as I told you in my email, but I'd like to let other people know that he does appreciate the negotiation problems that there are with the individual providers not being able to negotiate fairly in group with the insurance companies to bargain for these rates and reimbursements because of federal acts, the Sherman Act, that does prohibit that assembly. And Representative Edwards is interested in finding out what can be done about that, and we do realize it's a huge issue at the federal level, and federal preemption is involved. But having brought that forward, I have contacted the chairman of the commission, Senator Khan, and he is interested in bringing that question to his commission, and I'm very, very happy about that. And so I think that we're on the right track. I hope you will ITL if this comes to a vote now, or retain it for other purposes for the committee. Thank you very much.
Thank you, Dr. Warner. And with your testimony, unless we have found Catherine Wilbarger, second shot at Catherine Wilbarger. Representative Acton, have we found her?
She is not on the list.
Thank you very much. With that, we have gone through the list of those who have signed up by the cutoff time. And with that, I will bring the hearing on House Bill 602 to a close. And with that, I will open up the exec session on the same while we're fresh in our minds. We have before us an amendment dated February 2nd, amendment -205H, put forward by Representative Edwards. Should anyone wish to move it? Representative Marsh wishes to move it. In a second.
That number again?
I think I see Dr. Shapiro on amendment 0205H. So Marsh and Shapiro. And Representative Marsh, would you speak to the amendment, please?
I was moving it for the purposes of discussion because you seem to want someone to do it.
Well, I don't know what to do if nobody did. I guess it dies. Representative Weber, please.
Thank you. An amendment does not have to be offered. It just exists until somebody offers it. I am a little at sea because I did not hear the amendment number.
I'm sorry, 0205H.
0205H. Okay.
It goes back to February 2nd.
Okay. There is no need to offer it if anybody, if people don't want to offer it. My understanding from the chairman is it has been offered and seconded, and I didn't see or hear Representative Shapiro seconding it. So if he wants to second it, that's fine. I don't want to stand in his way, but I also don't want him co-opted if he wasn't doing that.
I did not second it.
Thank you.
Okay, and Representative Marsh wishes no longer to move it. So it will seem, yes, Representative Marsh.
Thank you, Mr. Chairman. What I wanted to do was to move to retain House Bill 602. I would be happy to speak to that one.
Okay, I believe I had to give the theoretical possibility that somebody would want 0205H, but I don't see that anybody does. So your motion to move 602 is in order.
Mr. Chairman, may I second Representative Marsh's motion?
Well, you may. And Representative Marsh, please speak to your motion.
Thank you, Mr. Chairman. First of all, we had considered an amendment, or an amendment is in existence to use former chairman's language to make this bill into a study committee, but we already have a study committee to study telehealth reimbursement. And I, in fact, am the vice chairman of the telehealth study commission. And so I know that this is in fact happening. We also heard an awful lot of testimony about continuing reimbursement for audio only. Currently, audio only is allowed on a temporary basis by a federal 1135 waiver. I contacted Chuck Henderson in Senator Shaheen's office, and he has told me that the president is committed to maintaining audio only reimbursement on a temporary basis, at least through the end of the year, and hopefully through the end of the COVID-19 pandemic. So there's no action needed about that immediately. However, were that waiver to go away at the end of the year, we may need to do something. And this bill would provide a vehicle to the Telehealth Commission if the vehicle is needed at the end of the year. And therefore, I think that retaining this bill at this point in time is most appropriate.
Any further discussion?
Yes.
Yes, Representative Snow.
Yes, I had a question. My understanding is that Representative Edwards had added a 180-day transition after the state of emergency ends, which extends it a little bit. But if that state of emergency ends, say, in September of this year, that 6 months would run to February. And it's my understanding that the final reporting on the bill isn't required until June of 22. So there could be a gap where all of those provisions would go away for a period of time. Am I correct about that, or am I not correct about that?
Representative Marsh.
Yes, I'll be glad to answer the question. Right now, House Bill 623 is signed into law, so nothing goes away until and unless we change it in the statutory law, with the exception of the federal waiver, which is temporary and is really entirely out of our control. So if the federal waiver does go away, then that would create a problem. You're perfectly correct about that. However, I have received assurance that it will remain in place at least through the end of the year. I understand that there are efforts undergoing on a federal level to continue it on a longer basis and perhaps permanently. But at this point in time, we have statutory law resting on a temporary federal waiver, and that is somewhat problematic.
And all follow up, and all of those include telephone only. Is that not correct?
The federal 1135 waiver is what allows reimbursement, particularly from Medicare and Medicaid for audio only. If that were to go away, it would not matter what the state of New Hampshire does, that reimbursement would go away.
Representative Gay.
Thank you for taking my question. Does this mean that we are safe in retaining it, or should we do a very simple amendment that wipes out the wording that's currently in there and just say that it extends telehealth?
It is my opinion that we do not need to extend telehealth because it's already audio-only telehealth, because it's already in state law at this point in time. However, the Telehealth Commission might need a vehicle to address the change in the federal law if this waiver is not made permanent and if it were to go away.
Follow up.
So if I understand properly, does this mean that you're recommending retention, and as the time progresses, by the end of the year, we'll be in much better shape to figure out what to do to extend telehealth?
My intention as the vice chair of the Telehealth Commission would be to bring back to this committee any recommendations from the Telehealth Commission, including any recommendations for legislation, which might include ITLing this bill come fall once we have more information. It depends upon what we learn over the course of the coming months.
However, if we ITL this bill right now, we have no vehicle. And if we attempt an amendment, it must go through all the hoops. It must be brilliant, and it's got to be out the door by Thursday afternoon. I don't think we can put in a bill this complicated. So I would suggest also that we retain it and have it as a vehicle. Anyone else from the committee? Remember, it doesn't have to be a question because this is an exec session. I'm thinking I'm seeing, I think I am seeing, yes, Representative Shapiro.
Thank you, Mr. Chairman. I have a question and then I have a comment. My question really is to Representative Marsh. And my assumption, and I could be wrong, was that the federal waiver applied to Medicare only, and that so our state law really can't mandate what Medicare pays for. But are you saying that also affects how we can reimburse for Medicaid?
It is my understanding that CMS is the Center for Medicare and Medicaid Services, and therefore, yes, it would affect Medicaid.
I'm not sure that's accurate. I don't know if we could get a, you know, if there's someone like from the insurance department or somebody who knows. My second point, which is not a question, is it's my feeling that the initial HB 602 was so skewed in terms of doing away with some of the parity and some of the access to care that comes with telehealth, that I would prefer to see it ITL'd. And to really give respect and time and consideration to the commission, which is, I think, not skewed and would come at this with a more kind of independent, objective look at what needs to change if something does need to change, and that we start all over. You know, I'd be okay with it being retained, but I would prefer it being ITL'd. I don't know if at some point in this discussion, if we could take a straw vote to see how other people feel.
We could do that after a little bit. The difficulty is if we start all over from scratch, it probably will not be signed into law until a year from this June. Whereas if we retain it and make an amendment, it's much quicker.
That would be fine with me if it took longer.
I'm sorry?
It would be fine with me if it took longer.
Okay. Representative Weber.
Thank you, Mr. Chairman. A series of comments. First of all, there is nothing in the bill as it stands that I like. I am firmly opposed to dropping the audio only option, and I am firmly opposed to dropping parity. So that's item number one. Item number two is there's nothing in any of the amendments that we have seen to date that I like. So that's just my own personal feeling that I want on the record. The third thing is that we have in front of us now a motion to retain. And so having people testify about what the federal mandate may or may not be is at least tangential and possibly interesting, but we have a lot of work in front of us that I would like to get to. So my position is that I would be willing to retain with the thought that if we decide to amend this bill, the only thing I would be voting for would be an amendment in its entirety that addressed completely different aspects of telehealth, which will require new notice and new hearings, but we can do that. It will allow us to do some kind of necessary tweak on an expedited basis. And my opinion is that it's okay to have the bill out there in case we need to do that, and we can fight whether it's necessary to do it or not then rather than now. But I will not be supporting either of the two major premises of this bill. I will support retention because I think it gets us farther forward at least, and might get us on to the next bill. Thank you.
Representative Snow.
The only time Representative Edwards' 180-day extension or transition period comes into being is if the original bill passes. It has absolutely no bearing if the bill is being retained or anything else. I am assuming I'm correct about that. Is that right?
Representative Marsh?
Yes.
Thank you.
Representative Gay.
How much time do we save by retaining the bill and working on it as opposed to starting fresh? You said otherwise it would be a year and a couple of months before it could be signed. Does it really save us any time if we retain it? That doesn't happen at the same time?
Representative Weber, you've been here a few times. What would you say to that question?
The time frame for retention is that we will have to, as long as the deadlines aren't shifted again, and let us all hope that we don't need to do that, that the committee will have to report the bill out sometime around the end of October, and the House will vote on it sometime at the very beginning of January, and then it will go straight over to the Senate. What the Senate does with it is the Senate's business. So the Senate might decide it was a really important bill and they could pass it the third week in January and send it winging on to the governor's desk. Or the Senate could hold it and deal with it under their regular calendar, which means that it wouldn't have saved any time at all. But what we are doing is preserving the possibility that it would get acted on in an expedited fashion if that were necessary and agreed to by pretty much everybody. So we're just holding on to a possibility here. There's no guarantees one way or the other. If we started a new bill, obviously, it's not going to get to the governor before May or so unless somebody acts on it in a very expedited basis, which we have done, but unlikely in this case.
Anyone else? Representative Shapiro has suggested a straw poll, which I kind of like.
Why?
Sorry?
Why?
Why?
Ask Representative Shapiro.
Excuse me?
My question was, why would we do a straw poll? Why don't we just vote on retention?
Representative Shapiro had thought we
People
might.
don't want to retain and would prefer another motion such as ITL. They are certainly free to vote no on retention.
Well, I wanted to give Representative Shapiro the courtesy of what he had asked for. And Representative Shapiro, do you still wish to ask for a straw poll? Are you ready to vote?
Well, I guess I wanted to find out if there was any sentiment for ITLing it. I would certainly go along with retaining it. It seems to me that a whole new bill could be brought if it addressed different issues about telehealth for the next year. And I think that this bill is skewed and is not the bill to be passed, and that we should give the time for the commission to do its work. I would certainly, if there's not a sentiment of wanting to ITL it, I would certainly go along with retention.
I didn't hear a sentiment to ITL it. Is there one?
I would, if I may, Mr. Chairman.
Hey.
I have expressed my sentiment that the bill as it stands ought to be ITL'd, but given the time frames and other considerations, I am willing to vote to retain. So having given my word on that, I will vote to retain. It's not a question of my sentiment. It's a question of tactics and having a vehicle available in case we need one. We've all seen bills that have been taken and changed to something very, very different from what they were when they were filed. And we've also seen bills that have been captive and changed into something diametrically opposed to what their original intent was. That happens in the legislature. And if that happens with this bill, fine. I'm not in, I just want to make it clear, I'm not in favor of the bill as it is, but I'm perfectly happy to go ahead with retention.
Representative Weber, I'm of the exact same sentiment, what you just articulated. Representative Gay.
I agree with y'all. And so I was wondering, would it be more palatable if we first amended it to wipe out everything that's in it and just say something to the positive effect of telehealth, so that when we retain it, it doesn't retain all this negative stuff?
Well, first of all, I don't think that's necessary. And secondly, I don't want to do this on Thursday, so probably no. Well, I did not hear a great sentiment to ITL except as a couple of us have said about at least it's a vehicle, it might work, and if it doesn't work, we can ITL it later. So without objection, I would like.
Can I ask a question, Mr. Chair?
You may ask a question.
Thank you. Representative Marsh, just to restore my confidence in the commission, in addition to you, who I do have confidence in, can you tell me who serves on that commission from this committee, and if there are other representatives from mental health, behavioral health in general, that sit on that commission?
I can pull that up for you. It's on the general court website. Senator Khan is the chairman. And
oh yeah, okay.
The agenda of what we are going to be discussing on a monthly basis over the next year has already been put out, and that's available on the website. It's hard for me to pull the website up while I'm also monitoring this.
I know it is.
On my screen.
Do you know if there's anybody else from this committee, in addition to you, that serves on it?
I don't recall. I can pull up the minutes. That would be the way to find out. Give me a second. I'll answer your question.
Here I do.
Here.
Mr. Chair, I do.
The House Committee Services people have just said they can forward the link to everybody on the committee about this commission.
I have the members right here. I found it.
Okay.
The members of the committee are Senator Khan, myself, Representative Woods, who, as you know, is also on our committee here, Dr. Jonathan Ballard, Tyler Brannon, Sabrina Dunlap, Mary Lowry from the Hospital Association, Bill Ryder from Community Behavioral Health Association, Patrick Poe from the Medical Society, Joan Tulp from Bi-State Primary Care, Ken Norton from NAMI, Tim Mohan, Rachel Chaddock, and Scott Wester.
You have restored my confidence. Thank you very much.
Anyone else wish to speak? I see a few yellow hands, but I can't quite recognize who they belong to. Representative Shapiro.
Yes, having not heard any outpouring of support for ITL, I would withdraw request for a straw vote and suggest that we go ahead with our vote on retaining the bill.
Which I hear as you move the question. So the question before us is House Bill 602 FN, and it was moved by Representative Marsh and
I'll second.
Echoed, seconded by Representative Soloway, and the motion is to retain. The clerk may call the question. I call the roll.
Representative Mark.
Are you muted?
I thought I was.
Someone here in this room has been unmuted.
It's Beth's.
Okay. Try it now.
Representative Marsh.
Votes yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom. Yes. Representative Alexander.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow. Representative Snow.
Unmute.
Put your thumb up. Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21 yeas, 0 noes.
And the bill is retained. This ends the
Consent.
This ends the exec session on House Bill 602. The chair recognizes Representative Soloway.
For consent, Mr. Chairman?
It doesn't go.
It's a retained bill.
Okay. Oh, it's retained. Sorry. My apologies.
That's all right. Senator Lewis, we're about to say it. This opens the hearing on the executive session on House Bill 506, which we heard earlier this morning.
I'd like to make a motion.
Relative to equal access to places of public accommodation. The chair recognizes Representative Woods for a motion.
Thank you, Mr. Chair. I move that House Bill 506 be ITL'd.
Thank you. And a second.
Second.
I'll second that.
I heard a soprano voice first.
The soprano was probably Weber.
No, I'm second. Snow will second if you want. Doesn't matter. Oh,
I'd be
Weber's
glad to
fine.
defer.
No, go ahead, Weber, you're fine.
Okay, to settle this, Representative Woods moved and Representative Snow gets the second on ITL. And Representative Woods, would you speak to this motion, please?
Well, since we just heard this, there's probably not much I can add. My basic feeling is that there is a attempt to make a balance between the rights of the individual versus the rights of the people of accommodating entities. Nevertheless, I think this bill clearly would allow someone like, as you said, Typhoid Mary would go unchecked. And there's a variety of other things which are imminently fresh on our minds, so I won't go over them again, but I'll leave it at that.
Anyone else wish to speak?
Mr. Chairman?
Okay, Representative Soloway, then Representative Cushman.
Thank you, Mr. Chairman. I'd like to borrow a custom from Representative Woods, who has on occasion said, I will speak from 30 feet and I will speak from 30,000 feet, an image which I rather like. I have worked in government within this body and I have worked in public health. And I will confer, I will agree with some in support of this bill in that public health is occasionally a science and occasionally it is a religion propounded by people who tell us we know what's good for you, and if you only do what we tell you to do, your life will be better. The difficulty is that we really can't discriminate between the science of public health, which has saved countless lives over the generations, and those aspects of public health which are moralistic and religion and prescriptive, but not necessarily terribly well-founded. In such circumstances, what we do in response is to practice what we call the precautionary principle. And it's vitally important. If we do not know for certain, however, we suspect that there is a possibility, we behave as though we were certain, knowing that we may be proven wrong, but at least we will have avoided unnecessary disease and potentially death. I understand and appreciate the concerns for individual freedom. I appreciate the concerns about whether masks are effective or not. However, I have read the literature going back to Julius Roth's seminal article called Magic and Ritual in Control of Contagion, in which he talks about the use of masks. Do we know absolutely for certain? No, we don't. However, it is imperative that we practice a precautionary principle, and therefore I would support a motion to ITL this bill with confidence. Thank you for your attention.
Representative Cushman.
Thank you, Mr. Chairman. I would rather see this bill retained so it can be worked on. I hear that we have some agreement that individual rights need to be protected, and perhaps there's some language here that could be worked out and we could come to an agreeable form of this bill that we could pass so that we are protecting the religious, medical rights of individuals. So I would just like everyone to vote down this motion of ITL, and so that I can then move to retain this bill.
Anyone else?
Yes, Mr. Chairman.
Yes, Representative Snow.
The reason why I vote for ITL really is born out of what we call the Declaration of Independence from 1776, which begins by saying that we hold these truths to be self-evident, that all men are created equal and that they are endowed by their creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness. If we assume their intent was to prioritize those three rights, I think we'd have to agree that the right to life and to protect life is the first priority, and that liberty would include the kind of freedoms that they're talking about. Not that they aren't important, but our first obligation is to protect people's lives. And I think that's what the intent of these bills are for. And thank you for listening.
Thank you, Representative Snow. Is there anyone else in the committee that wishes to speak? Representative Gay.
I submitted, thank you, Mr. Chairman. I submitted an amendment that would have brought corrective wording to that concerned people about sick people just pretending that it didn't matter, that they would go anywhere they wanted to. And so OLS is pretty fast. So I just wanted to say that I did submit that a couple hours ago.
Anyone else? Yes, Representative King.
Thank you, Mr. Speaker, Mr. Chairman. Didn't want to elevate.
No.
So thank you, Mr. Chairman. I guess I'm a little confused because the way I was reading this bill is that it was about the discrimination, and yet I hear a lot of the discussion is about whether it's the right thing to wear a mask or not. And I'm with Representative Cushman that we should take another look at the language because it's apparently confusing.
Thank you. Representative Knurk.
Thank you, Mr. Chair. Basically, my feeling is that this, by accepting this, we take away the right of the business or the business, I'll leave it that way, to be able to set rules that they wish to enforce in terms of people in their establishment. And we're not, again, we do have, as we spoke about with the person who testified earlier, there are protected groups and they would be still protected. So you can't discriminate because of issues of race or gender and so on. But the issue is in public health, we sometimes have to lessen some of our individual rights for the safety of the population as a whole. And I think that if a business wishes to set up a rule that says that they want to protect their customers and their employees, that the person who wishes to patronize without wearing a mask still has the perfect right to not wear a mask. They just go somewhere else where they don't really care. And so that freedom is still balanced. They still have a freedom to go elsewhere if they choose to do so, but we preserve the freedom of that business to protect their other customers and to protect their workers. So exactly. I definitely vote ITL.
Thank you. Is there anyone else in the committee who wishes to speak?
There's two hands up. Dennis.
Yeah, but I can't identify them and my wingman's on another screen.
Yes.
Representative.
We're good done. So hand number one can speak.
All right, thank you, Mr. Chair, and thank you everybody for your time. Obviously, this is a tough one. We've been through the ringer on mask issues. It's hit really close to home with this body. It's important to remember that the issue with masks has been highly politicized. 1 year ago today is when Dr. Fauci made the statement that we didn't really have to wear masks. Then several months later, he admitted he did that because he didn't want to create a run on masks that would take them away from first responders. And it wasn't until April of 2020 that the CDC finally came out and said, yes, we need to wear masks. So this whole situation got off on a bad foot. Now, Having said that, my wife leaves the house every single day and goes out into homes with people that are infected with COVID and never got it because she wears her mask every day. So there's a lot to this. Ultimately, I'm going to vote to retain so that this discussion can continue rather than just to ITL. But ultimately, as it stands right now, I wouldn't support putting this into law. Thank you.
Thank you. And hand number 2. Other hand.
Thank you, Mr. Chairman. I too would strongly prefer to see this bill retained. There are very valid differences of opinion in the medical community. There are valid differences of opinion as to the wisdom of taking the COVID vaccine currently. There are valid differences of opinion regarding masks and certain medications that can help to treat people with COVID. You know, I hear the concerns about the rights of businesses. The problem is that when every business out there is towing the party line, there may very well not be another place to go. If you want to, I mean, even before the mask mandate, if you wanted to go somewhere and shop without a mask, you were suddenly starting to be very limited because all of the bigger stores were issuing their own kinds of mandates, and that was quickly followed. You know, there are a lot of people who, for whatever reason, cannot wear a mask. I don't think that it is moral for us to force those people to constantly explain themselves. I have an issue with that. I know people who are very upset by this. I have spoken to people in our state who have said they are thinking about moving out of New Hampshire because they are so upset by this. They're also not sure what their other options are in terms of where they can go. But this is a deeply held belief. There are very valid differences of opinion in medicine. And, you know, I think that Representative Acton put it well, which is that this is an important discussion. And I think it is our duty, it's our obligation to continue the conversation around this issue, whichever side of this issue you are on. I think that we ought to be continuing this discussion. I also will say that I think some of the concerns about, you know, tuberculosis, you know, medical workers with tuberculosis or typhoid are overstated, partially because I think most people are responsible, and I just don't think that that is a likely scenario, and partially because I think that there are other laws already in place that cover that. We amended HB, I think it was 220 or 221, to call out some of those exemptions specifically. So this bill can be made to work. It does need some clarifying language. And I think that it is an important issue that we as a committee ought to continue to stay engaged on. And that's why I would prefer to see this retained.
Thank you. Representative Marsh.
Thank you, Mr. Chair. As many of you know, I spent some time over the last year on the Governor's Economic Reopening Task Force. And one of the principles that we maintained throughout the year was that businesses had the right to put restrictions in place in their own business as they saw fit to protect themselves and their employees. To me, it's fairly clear that the intent of this bill is to override that, such that people who maintain a business that caters to the public would not be able to put such restrictions in place. To me, that's a step too far. On the other hand, I agree with several representatives who said the conversation needs to continue. I agree totally the conversation needs to continue. I believe that we did take a step in this direction with House Bill 220, which we amended and passed. But I think that we were very careful in doing that, not to remove from businesses the right to put whatever rules in place they thought they needed to in their business to protect their employees, which is a line that I am not willing to cross. And therefore, I will vote for this IPL motion.
Anyone who hasn't spoken? We'll do a quick round two. Representative Cushman.
Thank you, Mr. Chairman.
I haven't spoken yet.
Oh, Lucy.
Representative Cushman.
Okay. Thank you, Mr. Chairman. I just want to speak to Representative Marsh's point about businesses. I think that many businesses are requiring masks for entry because they are facing pressure from local health officers, from the Attorney General's office, and they do not understand or feel that they cannot accommodate people who are exempt under Emergency Order 74. So I would suggest that this bill be retained, and maybe we can put in a clause, no one shall be discriminated against, or, you know, no one shall be forced, you know, refuse service unless the owner of the business doesn't, you know, unless the business owner makes a policy for their business, because then that would allow other businesses who don't want to force customers to wear masks to feel like they have the freedom to make that choice. Because right now, with all the pressure coming from the AG and the health officers and the threats of fines that businesses are getting, even though the public is exempt under certain conditions from wearing masks, they still feel that they have to force customers to wear masks. And I've talked to many businesses about this. So I would really press that that my fellow committee members would vote no on the ITL so that we can retain and work on this bill.
Thank you. Representative Weber.
Thank you, Mr. Chairman. I have only 2 points that haven't been made to date. The one is, I very much understand the concern for the rights of the individuals that are trying to be addressed here. But the other thing that I see is the equally important rights of individuals, most of whom are either elderly or are medically fragile. And those are people who the COVID pandemic has particularly circumscribed their lives. And both in this time of, you know, right now we're operating under an emergency order, which will go away when circumstances change. And my hope is that that will be sooner rather than later, but we don't know. So I'm comfortable with the way things are under the emergency order, being aware that when the emergency order goes, the mask mandate goes too. And there will be no reason for anybody who owns a business to do anything other than state their own position, and then people can vote either with their feet or with their dollars. But I do want to just remind people that cloth masks don't protect the person who's wearing them particularly well. They do certainly protect them somewhat, but I do want to remind people that we're balancing the rights of two different groups of individuals. It's not just individuals versus the government. And that's a really tough balance. And I get it that it's a difficult question, but I'll be voting for the ITL. Thank you.
Representative Merchant.
Thank you, Mr. Chairman. I don't believe this issue has been raised, but my concern is going to be the elderly, particularly in our nursing homes. The way this bill is written, there's nothing to prevent a person from going into a nursing home if the nursing home is trying to protect their elderly. We know that COVID's been rampant in some of the nursing homes and so forth, and the ability for them to shut down the entrance into their establishment to protect the elderly, I think it's important. And the way this bill's written today, that would not pertain. They would actually have the right to go into the building, whether the nursing home believed that was the right public health policy. So because of those reasons, I would vote to.
Thank you. Anyone who's not spoken wishes to speak? The motion, by the way, I'm getting some what used to be called blue sheets. People writing in with a position supporting the bill 500, opposing the bill 84, neutral 2. And for the record on the previous, well, I'll do that afterwards. The motion before us made by Representative Woods and seconded by Representative Snow on House Bill 506 relative to equal access to places of public accommodation. The motion was ITL. Would the clerk please call the roll?
Thank you, Mr. Chairman. Representative Marsh.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
No.
Representative Gay.
No.
Representative Cushman.
No.
Representative Folsom. Yes. Representative Alexander.
No.
Representative King.
No.
Representative Kofalt.
No.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
$15 yeas, 6 nays.
And Representative Woods, if you would be so kind as to write the committee report.
I will do so, sir, and I will have it on the proper form this time.
Yes, Representative Cushman.
I volunteer to write the minority report.
And Representative Cushman, I'm sorry, writes the minority report. I just assumed it, okay? Thank you. And for the record, for the last bill that we retained, 602, 6 people signed in support, 1 person was neutral, and 226 people opposed. This closes the hearing on
506.
Exec session.
is this closes the exec session on House Bill 506. I opened the exec session on House Bill 146, requiring healthcare providers to furnish upon request a list of ingredients contained in an injectable medication that is recommended or administered. And we first have to consider amendment 2021-0507H, which is an amendment brought to us on February 25th by Representative Marsh and Representative Merchant. Would one of you like to speak to the amendment, please?
Yes, Mr. Chairman, I'll be glad to do so. What the amendment does is it clarifies what a list of ingredients is. By federal law for injectable medications, inactive ingredients are required to be listed on the label for injectable medications. And so therefore, this allows a copy of the label or a copy of the label which is on file in the archive of the medicine of the federal government to be printed out and given to someone who requests it as a list of the ingredients. And the ability to use a printed out copy is actually important because removing the label from an injectable multi-dose vial could result in medication errors and would not be a good idea. It also pays attention to what the FDA guidelines are as to what active ingredients must be listed, which people can look at. Because there are certain exceptions.
Thank you. Did we move and second this?
I don't believe so.
I don't think we did.
I will move amendment 0507.
Representative Merchant, would you like to second?
I will second it.
Thank you. Now further discussion. It seems to me that the amendment keeps the hearts of what the original bill was about, but makes it more practical or practicable to do. Anyone else?
Mr. Chairman?
Yes, Representative Merchant.
Thank you, Mr. Chairman. I totally agree. It retains the intent of the original bill to provide the information to a patient or their caregiver. It also does exclude situations in which we talk about with clinical trials and having to break the trial, which would not be beneficial to the patient because they're the ones opting into a trial. And number two, it does exempt an emergency situation where the provider believes at that point in time the need of care for the patient trumps, if you will, the right to get the information.
Anyone else?
Weber.
Representative Weber.
Thank you very much, and thank you for taking my question. I seem to be I seem to have once again lost track of my amendment, so I can't find it and put it right in front of me. But my question is does the amendment address the problem that we were spoken to about the bill? It sounds to me like what you've done is just say the list of ingredients that would be on a label if there were a label, as opposed to somebody approaching your car with a shot or sitting in your whatever. That the list of ingredients is going to be made available to them, but we're not going to require more than what is required currently federally in terms of labeling, because my concern here is making sure that we don't run afoul of federal preemption or the Commerce Clause or all of those things that made my eyes glaze over in law school and that I haven't thought about as much as I ought to have since. Or maybe I'm very glad I haven't thought about them since. So that's the concern that I hope has been addressed, and I'm willing to take your assurance for it if you can do that.
Representative Marsh.
Yes, Representative Weber, I'll be glad to email you a copy of the amendment again if you would like. But if you look at the amendment and you look on lines 15 through 17, what it says is a list of the medication's ingredients means a copy of the label on the injectable medication as regulated by 21 CFR section 201.100B5, or as listed in the Daily Med database maintained by the United States National Library of Medicine. 201.100B5 is exactly the statute that you were referring to, and so therefore it does not make any requirements over and above federal law.
Thank you very much. I appreciate it.
Anyone else?
Yes, Mr. Chair.
Representative Knurk.
Yes, I just wanted to ask a question regarding the mechanics then of how this would work. So the prescription drug manufacturer provides this information. You have a patient in the office. They request this information. As a provider, where are you going to, as a provider, be able to find this information quickly, print it, and give it to the patient? Just how does that work from a practical point of view? Either office or hospital or nursing home or whatever.
Representative Marsh.
Yes, thank you for the question. You would be able to copy the information off the label, which could be done simply by taking the label and putting it in your copy machine. or you can access the Daily Med database, which is a public database, and print out a copy of the label so you didn't have to remove the label from the bottle.
Got it. Thank you.
Any other questions about the amendment? Representative, I'm going to guess Woods.
Sorry, just a comment. Also, what we did in the office was if someone had a question, oftentimes for side effects, we just gave them the insert, the package insert.
Sure.
And that's very simple. And if you run, you can photocopy that as well. It's very straightforward.
Anyone else?
Here.
Representative Shapiro, I wish to apologize to the committee. I'm fighting an optic migraine, which is making me A, see the screen less well, B, getting more confused than normal. But Representative Shapiro.
Thank you, Mr. Chairman. I admit to also losing track of the amendments and the original bill. But my memory is that in the original bill, this applied only to people who requested the information spontaneously, that it was not something that had to be offered to every patient.
Yes.
Is that still in effect in the amendment?
Yes.
Representative Marsh?
Yes.
Yes.
Thank you.
Seeing no further hands up to ask a question or make a statement, we are voting on the amendment.
May I just say one thing? Just for those who are still trying to find it, obviously, if you have a search function, you just search under Marsh's name because he sent it out. But likewise, it came out on February 25. It's an email from Bill Marsh, February 25 at, trying to find out what time, 8 o'clock in the morning. So if you look back in your mailbox at that point, you'll be able to see the amendment. Thank you.
Would people like me to sort of
What's the number of the amendment, please?
I'm sending it out again so you all have it.
I have just sent it out for the members. It's in
Thank
your
you.
committee email.
So we'll wait to see the amendment and not just pass the bill to see what's in it, huh?
Just to kill time, I'd like to ask a question, Mr. Chairman.
Yes, we do. Representative Nelson.
How does that affect medications that are shots, injections that are made out of the country? They do this in China and they ship it over here. Do they have to provide the same information or what happens with that?
Yes. Simple answer is yes, Representative Nelson. The manufacturing of the product is not what's driving what has to be provided. It's what country it's being shipped into. So if it goes into the US, it has to comply with US laws. If it goes into Canada, it complies with Canada law. So in this case, because the product came from India or China, when it comes to the US, it has to comply with US law.
Let's vote.
Give folks a few minutes more to read what's before you.
It's a short amendment. I'm good.
I'm trying to get caught up in paperwork, so
Oh, okay.
I want to get credit from my friends while doing it. Okay. Amendment 0507H to House Bill 146. Moved by Representative Marsh and seconded by Representative Merchant. Will the clerk please call the roll?
Thank you, Chairman Pearson. Representative Marsh.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King,
Yes.
Representative Kofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Snow, Representative Snow,
Yes.
thank you. Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
and Representative Pearson.
Yes,
21 yeas, 0 nos.
21 to zip. Representative Merchant, I call on you for a motion.
You sure can, Mr. Chairman. I'll make a motion to ought to pass with amendment. Amendment number 0507.
And Representative Cushman is seconded. Now, we just discussed it, pretty much, but we'll give a few seconds in case anybody would like some more.
Point of
Yes.
clarification, I realize that the amendments that I have been reading are not Amendment 0507. If I look at the amendment sent by Representative Marsh, it is 0678, and it's to 503. Okay, I've got another one from Representative Marsh, and I've got it now. I had clicked on the wrong thing, so thank you very much. I will be quiet now. Appreciate
This
it.
is the tricky business of doing things the way we're doing it, and you know what? We're gaining on it every week. We'll have it all mastered by the time we go back to normal.
Right.
So, any further discussion on House Bill 146 as amended, as moved by Merchant and seconded by Cushman? I think I see a hand, but it might be a leftover hand. Representative Nelson to speak or leftover?
Leftover.
Okay. Seeing nothing more forthcoming, when the clerk is ready, please call the roll for House Bill 146 as amended by 0507H, moved by Merchant, seconded by Cushman. The motion is ought to pass as amended.
Thank you, Chairman Pearson. Representative Marsh,
Votes yes.
Representative McMahon,
Yes.
Representative Nelson,
Yes.
Representative Acton,
Yes.
Representative Gay,
Yes.
Representative Cushman,
Yes.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King,
Yes.
Representative Kofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Ken?
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson,
Yes.
21 zip.
21 to 0. Representative Merchant, please write the committee report. The chair regrets I did not have the information as to who signed in for what. And I've put in a request when they have the time, because it's very busy right now. For the record, if the fourth floor would send us out, all of us, copies on that.
Mr. Chairman,
Mr. Chairman, can I ask for consent?
Without objection, consent. And this concludes the exec session on House Bill 146. And I want to squeeze one more in before lunch. And Representative Marsh, would you tell us what the amendment is that you just wrote me a note about, so we'll watch for it?
Yes, I just sent out to the committee a new amendment on House Bill 503. This is the amendment that Representative Shapiro and I worked on last week to combine the duties of the proposed homeless commission into the existing commission that was discussed with us and established by the governor's executive order. The new amendment corrects one word in the prior amendment because we learned that the community behavioral health organization was that and not the community mental health association. So it changed the word mental behavior. That's the only change in the amendment.
And what is its number?
Number of that amendment is 06788. If you'd like, I will move adoption of amendment 06788.
Except we're not on that bill.
Bill, I thought you were on 503.
No, I just said, no, we're on 381. I was just asking you to let us know what we got in our inbox.
Then I'm confused. I apologize.
No, hey, it's your turn. All right, with that, we open the executive session on House Bill 381 FN. And Representative Marsh, you are recognized for a motion.
I move to pass on House Bill 381.
And do we have a second?
Second.
Second from Merchants. Thank you. And Representative Marsh, please speak to 381 FN.
Yes, this is a bill to allow people to access laboratories in the state of New Hampshire for testing without a physician's order. This is similar to a bill we had prior year. One of the interesting things that has happened since last year, at least to my knowledge since last year, it may have happened before that, but I was unaware of it before that, is there are numerous sites across the state of New Hampshire right now where people can go and get testing done without a physician's order, but then those lab tests are then sent out of state because our labs are not able to perform this testing at this point in time. This bill would allow our New Hampshire laboratories to compete on an equal basis with the out-of-state labs and perform testing if they so desire. And I believe that that is helpful. I think it's very helpful if patients have a concern, they want their lab tests done, and their doctor isn't particularly enthusiastic about the idea. It's much better for them to be able to just go get their lab test done at their own expense than get into a fight with their doctor about it. The major argument against this bill was a argument that the public would be put at risk due to the fact that people might not be able to interpret their laboratory tests correctly. I would contend that this has been going on for some time, that these sites are currently available, and that has not happened, and that is why I support this legislation.
Any questions or?
Well, yeah, I have a problem. I cannot find that amendment. I thought I had it. Now it's my turn not to have it.
Amendment is this, Representative Canard.
The one we're discussing right now.
No, we're discussing House Bill 381.
I'm sorry. I thought he had an amendment on it. No amendment.
Amendment was on something else.
My apologies.
Hey, you're among friends and co-conspirators.
Yes. Now, I do have something to say, though.
You're
I
up.
had my hand up.
Okay. I understand that we do have labs that will send it out of state, and you can do that. The problem I still have great reservations about allowing this. And I view this as a little bit like your kid coming in and saying, but all the other kids are doing it. Just because all the other kids are doing it doesn't mean you're going to condone them starting to smoke. And I think the fact that other states may be doing this and we might lose business to those other states does not make it a good idea to condone that behavior, because by so doing, we will probably increase the amount of these tests that would be done. And I do not think that that's really necessary. And I think not necessary because there are very clear issues about the diagnostic cascade, and somebody made a comment, well, the patient would pay for it, but no, not necessarily. When they come into their provider, the diagnostic cascade would start getting billed to the insurers. The other thing is actually it's simply the patient perception of health. And I have had patients with this. I know this is not covering imaging, but there was a very good imaging study done in imaging using MRIs on people where the MRI was really not even relevant to their issue. It showed degenerative change, like having gray hair and wrinkles. But when they read that, the study was, you either got the report or you didn't get the report. And the point is, those who read these nasty words like degenerative and all those things which simply imply normal age-related changes and tested them later on their perceptions of wellness, they viewed themselves as not being well. And I've had patients who came in and because of a test which was misinterpreted, felt they had that disease and changed their behavior. One was rheumatoid arthritis, other ones are Lyme disease. And so it is not a trivial issue in terms of people trying to use Dr. Google for understanding the importance or the meaning of a test, particularly the screening tests. And in medical school, we were taught you do a history that gives you a great deal of information that'll give you the diagnosis, then a physical exam. Laboratory tests are almost always done purely as a confirmatory or monitoring or in some senses screening, but we see incredible amount of disagreement on the United States Preventive Task Force when we come to screening issues, and it takes a lot of time to figure out what's appropriate and what isn't appropriate as a screening test. So I still see that there is more chance for harm. We have a dysfunctional healthcare system, I would agree. For example, Representative Edwards should not have had that 9 months he didn't have health insurance, but this is a Band-Aid on a bad health system that I think makes it even worse. Thank you.
Representative Nada Upham.
Oh, thank you. Thank you for listening to my comments. So a lot of tests have become available. When I was a young woman, you had to go through your doctor to get a pregnancy test. You don't have to do that now. You can go to the pharmacy. There were several times, a mother of many kids, you worried they had strep. You had to go through the doctor's office. You had to bundle all 4 of them up in the car to take the one, whatever. So I think there's a lot of upside in people being able to order A1C tests, strep tests. I'm sure many of you could think of a bunch of other tests. It's like either you've got it, you're not. So if I took my child and they had strep, then I take them to the doctor to get medication. I had a lot of time this weekend, I called my medical posse, my many friends that are nurse practitioners and a few that were doctors. And they said, yeah, why not? Buyer beware. So I'm going to vote in favor of this bill.
Thank you. Representative Merchant.
Thank you, Mr. Chairman. Speak to the second of the motion on the at the pass. Initially, when I saw this bill, I was opposed to it. But upon research, what I found out is that, as Representative Marsh said before, patients today can go into many locations throughout New Hampshire and have their blood drawn. And at that point in time, the blood leaves the state and goes to another state that allows for it to be processed. So this bill does not really enfranchise the patient to get the blood work done. It's just a question of where it gets done. So we're basically at this point in time, what changed my mind with the bill was saying, wait a minute, we have the ability for a patient today to go into a drawing center, have the blood withdrawn, and then it has to leave the state and go to another facility outside the state. So all we're doing fundamentally is taking the work that could be done here in New Hampshire and sending it to another state to get the work done. So the ability for the patient to get the lab work and get the results and so forth, this bill does not foster or doesn't basically permit. It's already there. All this does is allow for the laboratory to be located in New Hampshire to process the work.
Thank you. Representative Soloway.
Thank you, Mr. Chairman. Of the 400 members of the New Hampshire State House of Representatives, I would have to guess that 380 of them have no medical expertise to speak of whatsoever. It is therefore my suggestion that we keep our noses out of the practitioner-patient relationship where it simply doesn't belong. We have a system that works. There were no catastrophes out there. It seems to go along well. And I would suggest that we mind our own business and stay away from bad government.
Thank you. Representative Shapiro.
I've taken my hand down.
Representative Cushman.
Thank you, Mr. Chairman. I just want to say that what I'm hearing is patients don't know enough. They can't order their own labs. They don't have the expertise. I think we're selling patients short very much. I think patients, especially those with chronic illness, do become experts on their own conditions. Oftentimes, I have encountered patients who went misdiagnosed for years. And I'm glad that Representative Knirk brought up Lyme disease, because that's one of the diseases that often goes undiagnosed or misdiagnosed because many physicians are unwilling to order the lab testing after a short course of antibiotics, which doesn't always take care of the problem. Lyme can go and be chronic for years. So there are other physicians who will order these lab tests, but it may be cost prohibitive, or maybe someone can't find a physician who will do it. But I've known patients who have had Lyme disease for years, and for chronic illness patients, this will be very convenient, especially those who have to have repeat labs drawn, who maybe can't afford to go in for a visit every time, or go to a lab, every time they have to go to the lab. And they also become very knowledgeable on their normal range for their lab values. Sometimes physicians will look at patients' lab values and not understand that there's something else going on. I've had patients who, they know where their normal lab range is, and it may be a little bit below normal, and they're getting overtreated because their physician doesn't really acknowledge that that's normal for them. So I just think that we need to give patients the reins over their health as much as possible. In nursing, it's a value that we have, that when patients are more responsible for their health, their outcomes are better. So I think we should give them as much autonomy over their health as we can.
Representative Woods.
Thank you, Mr. Chair. A couple of points. I understand that the specific tests, HA1C and so forth, the patients really do get well attuned to monitoring it themselves. England was also an example of people on Coumadin. They established a home program, and the people had their blood and were able to monitor themselves, people on chronic Coumadin, and actually had better compliance and better end result when patients did it themselves. However, this instance bill does not identify any specific area. This is basically carte blanche. Everything goes. And that's the problem I have with it. Secondly, there's the legal aspect. They say, well, it says in here that the individual physician or provider would not be held responsible if they didn't order it. But if the patient calls the office and says, I had a test drawn, you are now obligated to respond. If you're in a healthcare system where that lab is within an overall healthcare network with a common healthcare chart, automatically, if there's an aberrant lab, it shows up and is addressed within whatever office that patient normally attends. And therefore, there is a legal obligation to respond. And in fact, New Hampshire is one of the few states that mandate in RSA the standard to which physicians, I don't know about nurses, physicians are held is the AMA Guide to Ethical Behavior. And in that, so that's the standard we're met, that we have to meet to be board certified, to have our license. And in there, it specifically states that if you're aware of an aberrant situation, it's your obligation to respond. That means you may call your partner and say, can you handle this for me? Or call a consultant or whatever, but you can't ignore it. So that's the standard that we're held for our licenses. So for those reasons, I kind of like the idea of people taking responsibility. I love having patients that can do that. But I think this goes a little bit too far and just has some of the other unintended consequences that Dr. Knerk has outlined, as well as the other ones that I've just mentioned. Thank you.
Thank you. Representative Kofalt.
Thank you, Mr. Chairman. I agree with Representative Cushman that I think we're selling patients a little short by assuming that they can't be responsible with information from test results. Having said that, I think all of the discussion as to the wisdom of allowing patients to order their own tests or not is actually moot because they can. As Representative Marsh said when he introduced this, they already can. So the only practical implication of this, as I see it, is whether or not we want more jobs in the state of New Hampshire or more jobs outside the state of New Hampshire. Do we want to strengthen businesses in New Hampshire or not? And I'm open to hearing why that might be wrong, but that's how it occurs to me at the moment.
Thank you. The chair calls on himself for a couple of comments. I talked to the 3 PCPs that are under my employ on this. And one of the things they said is, yes, patients come in and present test data from wherever. And of course we respond to that. And if we heard a patient call in and say, oh, I ordered a test and here it is, we'd say, make an appointment and bring it in. Of course we're responsible for that. Then the second thing is numbers of our patients come in very well read, many of them very well educated. Some of them get their education from Dr. Google or its younger brother, People Magazine. And so sure, we've got a number of people who come in who have researched what they believe or they actually do have as a symptom. Many of them are very well educated, and that can be helpful. It certainly means the patient is taking responsibility for his or her own medical care. And the ones that come in who are have a lot of information, much of which is bogus, these are pretty much our patients who, if they didn't research it, they wouldn't believe what the doctor told them anyway. So the conclusion that my 3 PCPs came up with is, this is okay. So I'm certainly going to be supporting the bill. Any other comments? Or Representative Gay?
Thank you for taking my comment. I'm one of those patients like you described, who I read up everything I can. And ultimately, we patients have to decide who to go to. I had to go to 3 spinal surgeons before I got one who actually believed the MRI report that was written by a doctor at Baptist Hospital, very famous. I had 2 doctors who didn't believe it. And so I didn't feel comfortable. I kept going. I don't think I'm unique in that I feel I evaluate what that doctor tells me. And there's no way that a person can go get a blood test or any kind of test and treat themselves. They still have to go to a doctor if they want to get medications ordered or treatments ordered. So it's still a partnership. It's kind of paternalistic to be told that as patients, we're not supposed to be kept as aware as possible of our own medical condition. It is a partnership, and we have to hold our own. So I certainly think this is a great bill.
I'm certain Representative Gay, one of the spinal surgeons with whom you had a negative experience, was not Dr. Knirk.
No,
No, I didn't think so. Certainly, of course.
I thought he would really listen to that statement though, because it's so personal. No, they were down here in this end of the state.
Yes. Anyone else with something to say, share, ask? Seeing nothing, the question before us is House Bill 381 FN relative to laboratory testing. The motion is ought to pass, made by Representative Marsh and seconded by Representative Merchant. Would the clerk please call the roll?
Thank you, Chairman Pearson. Representative Marsh.
Votes yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative Weber.
No.
Representative McKay.
No.
Representative Snow. Representative Snow. I can.
He's trying to unmute.
Yeah, right.
You see a thumb?
Okay, yes,
Yeah,
sorry.
there he is.
Got stubborn again.
I'm sorry, can you repeat your vote?
Yes.
Representative Knirk.
No.
Representative Soloway.
No.
Representative Cannon.
No.
Representative Nutter Upham.
Yes.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
14 yeas, 7 noes.
And Representative Marsh, if you would write the committee report, and who would like to write the minority report? It doesn't have to be one.
Knirk has his hand up.
Representative Knirk has a hand up.
Representative Knirk, would you like to write the minority report?
Unmute.
Mute.
Yes. Yes. My apologies.
I stuck up for you a minute ago, so come on here, hurry up, buddy. So you're going to write the minority report?
Yes.
Thank you. This concludes the exec session of House Bill 381 and begins the lunch period until about 1 o'clock.
20 minutes for lunch.
Minutes. You can choose 6 times.
I'll be back in
20 minutes.
Perhaps time for all of us to mute again.
That's a good idea.
Are we live and in person?
Yeah, I can hear you talking.
Ah, hi, Jim. How are you?
Good.
Jim, you're my hero.
Committee
You're my
room is not
Chairman, the
live.
room will have to be unmuted.
I
It's
just
currently muted. Oh, perfect. There we go.
okay.
You should add to your list of Tufts graduates myself.
Oh yes. Oh, I'm perfectly aware. But more than that,
Yeah.
you are my role model because if I want to go to age 90 in the house,
Right.
I know somebody who's done it.
Well, you got Mary, who's 94 with the white. Of course, everybody's listening to our conversation.
I haven't said anything criminal yet.
Not yet.
Yes, I want to catch what you have.
Okay.
Whatever you have, such delicious advantage.
It currently only applies to those of us.
I don't read them, but it has cashews in
I
it.
don't.
Right. I knew you're allergic to those.
I got my inoculation today. Anybody who hasn't had it, you have nothing to fear. There's no pain and it's several hours later and I don't feel a thing.
That's really great, Jim. I'm so pleased.
Yeah,
I'm happy for you.
I got the J&J, so it's a one-shot deal.
Oh, you're done.
Where'd you get it?
Yeah.
At the racetrack and just.
Oh.
Yeah,
You have to wait any length of time, Jim?
about 10 minutes.
Wow, because they said they had 3 and 4 hour waits the first day.
Well,
We went up to Sears. We've had both of our shots. We got the second shot, Pfizer shot, about 10 days ago now. And they were really well organized. Really very, very efficient, knew everything, got us through. And neither one of us had any side effects for either one.
I was very impressed, but so I got my old number plate, which has me as chairman of Health and Human Services, something or other. So the guy came and he said, "Were you sent here to check on us?" Those license plates, Jim, are very valuable, you know. Right. They are. So what I said was, if they sent me to check on you, the response would be that you're doing a wonderful job.
Congratulations, Jim.
Yeah.
Yep.
You can probably put that in the paper. You know, you had such a marvelous experience.
Yeah, because I was nervous going in, to be honest about it.
Excuse me, my fire alarm is about to start going off, so I have to go to finger pointing to.
See you on the other side, Jen.
Yeah.
Okay, we gotta get back. It's almost 1 o'clock somewhere. And I am now reopening the hearing of House Bill 103, which has to do with establishing a dental benefit. And you should have received on the 3rd of March a revised footnote. And my advisor tells me that there's no vote needed. It's just an updated fiscal note. So your fiscal note that's operative is March 3rd. And so now the hearing is open again on the dental benefit. And the chair calls on Tom Raffio from Northeast Delta Dental.
Can you hear me?
Yeah.
Oh, great. Well, first of all, thank you all for your service to the state. And Representative McKay, I'm glad your vaccination process. I haven't yet gotten it, but I'm sure it will be as good as you suggested. So I'm Tom Raffio, President and CEO of Northeast Delta Dental. I know most of you. And of course, this bill is, similar to HB 250 last session, which, like many things in 2020, didn't make it over the finish line. Northeast Delta Dental, we are not non-for-profit, but the largest dental benefits insurer in the state. We have one mission only, and that's to improve the oral health and access to dental care for everyone. So our new tagline is everybody deserves a healthy smile. Not just people with traditional dental coverage like yourself, if you have it through Delta Dental, and we have probably 60 to 70% of the employers in this beautiful state have our coverage, and many individuals have it through our private exchange or healthcare.gov, but everybody deserves a healthy smile. And so HB 103 builds on the important work of the work group that was enacted in law in 2019 to create an implementation plan. I, of course, understand that the Senate Bill 150, which passed out of the Senate with a 5-0 vote and will be voted on by the full Senate this Thursday. This bill is consistent with that, and I understand that there may be an amendment to, make it even more make the two bills even more consistent.
That's correct.
So, implementation date. I mean, I've been at this literally. I came to New Hampshire in 1995 and have been talking about this issue literally now for a quarter or a century. And I was hoping that in my professional lifetime that this could actually happen, and I think it would have already, perhaps, short of the pandemic. But now now we have this great opportunity to make it happen, even if it's not implemented until 2023. We have to keep the ball moving forward. It'll increase the employability of many working New Hampshire adults. And we've given you all these stats, but it will save on emergency room costs. There's a lot of studies out there which suggest, and we're very conservative here, but it'll also save a lot on the medical side. There's so much interrelationship between a lot of conditions. And so in the long run, there'll probably be savings on the medical side. So we really need to continue the progress and move this forward. I want to urge the committee to pass HB 103, and that amendment that I think will happen is fine with us. We thank Representative Shapiro for bringing forth this legislation, and all of you for staying the course. The mouth is part of the body. You can't have good overall health without good oral health. Will, in the long run, save the state money, get more people employed, and everybody deserves a healthy smile. And let's make this happen. We're in sync with the New Hampshire Dental Society, with the department. Everybody that's has concern about oral health is on the same page here. So please, let's make this happen. And I'm happy to answer any specific question on costs or implementation or Delta Dental's role.
Any questions for Tom Raphael? Sorry? Representative Woods.
Thank you, Mr. Chair, and thank you, Mr. Raphael, for taking my question. Do you have any studies from the dental perspective of the exact economic impact of improved oral health? Do you have anything available?
Yeah, I mean, the department's had a lot of that. My actuary, Courtney Morin, has been on the work group. There's a famous study called the Wakely study, which is relatively new, which gets into the benefit of the value proposition. So I think the committee, Representative Woods, has all of that, but we can certainly send you over, the more data as well.
Anyone else with a question? Yes, go ahead.
My space bar didn't work. My space bar didn't work. Secondly, this is sort of a side question. Do you know if, from the dental perspective, that they're working with other agencies like the American Medical Association to collaborate in terms of efforts to incorporate dental health into general health plans?
That's a great question. That's what my life proposition is about. More and more physicians and dentists are cooperating. There's more and more cooperation between medical schools and dental schools, between pediatricians and dentists. So we are working towards that. There's a great book called Teeth by Mary Otto that I encourage you all, if you get a chance to read, and really gets into, you know, the direction of the country on this. We've come a long way. It explains why originally the head was separated from the body, but we all now know that we have to connect the head, dental health, mental health with everything. And so I encourage you to, if you get an opportunity to read a book called Teeth by Mary Otto, it'll get into a lot of the macro question that Representative Ward's asked.
Thank you.
Thank you.
Any other questions?
Well, thank you, and let's make it happen. Thank you.
Thank you so much. The chair calls Michael Apfelberg from the United Way of Greater Nashua.
Yes, good afternoon. I presume you can hear me all right?
We can hear you all right.
Yes, good afternoon. My name is Mike Apfelberg. I'm the president of the United Way of Greater Nashua, and I'm coming here today to you in support of HB 103, establishing that New Hampshire Medicaid programs be expanded to include a substantial dental benefit. As an organization, we are strong supporters of the Greater Nashua Dental Connection, providing access to dental care, high quality dental care for low income residents, recognizing, of course, the value of dental care and the overall health of our community. We all know that good dental health and oral hygiene is of critical importance. In fact, many people often are surprised to learn that the number one cause, other than a pandemic, the number one cause for a young person to miss a day of school is still an untreated toothache. As an adult, you don't have to have good dental coverage. If you don't have good dental coverage, you're much less likely to undertake preventive care, such as annual screenings and cleanings. You are also much more likely to have small issues, such as routine caries or periodontitis, become more serious issues requiring extensive procedures like extractions or gingivectomies. Oftentimes, lacking dental insurance means that these procedures become emergency room procedures, much more expensive to treat. Reactive dental approaches can also lead to significant pain, which in turn can result in addiction to pain medications. Poor oral health can easily result in other negative consequences affecting a person's employability and mental health. Data shows that a strong community return on investment for good dental care and demonstrates that dental health is a significant determinant in overall health. For all of these reasons, we would strongly endorse HB 103 and encourage you to pass it with a recommendation. Thank you.
Take any questions? And that exhausts the list of people that I have who have signed up by the deadline to testify.
Representative Woods has his hand up.
Representative Woods.
Yes. I didn't have my, oh, I'm sorry. I didn't take my hand down. My apologies.
Not a problem. I see no further people testifying and no questions. And we are waiting. Sorry? An amendment has just been sent to the committee relevant to this bill, and I'm hoping hard copy will come down to us on the third floor. Relevant to this bill.
Is there time for me to go to bed? Time for me to work? Do we have enough time?
Sure.
for that?
Ellie?
Chair, may I suggest we take a 5-minute recess so people can look at the amendment that we just sent out, and then Betty, Representative Gate can get water?
Sounds like a plan all around.
Am I right in thinking that the amendment is 0778, just so we've got the right?
I didn't hear that. Zero.
The amendment is 0688, H to House Bill 103, and my name is
103?
Representative Shapiro's name.
Okay, 0688. Okay.
And we're just waiting now for that to come down.
Mr. Chairman, I don't think that's been sent out to the committee. The last one I have from Ms. Forcier is 0678, and that's House Bill 503.
It came from Bill Marsh.
It
115 from Bill Marsh. It says forwarded.
Okay, I'll check.
I just received it.
About 6 minutes ago.
Yeah, I have it in hand right here and printed.
Wow. Could you hand me one?
Here you go. Here, have my copy.
Thank you.
Well, I have 9,684 amendments from Representative Marsh, but not this one, but that probably means that Comcast has eaten it.
Oh.
Aha, there it is. It's just come in. Thank you.
Perfect.
Comcast is slow.
Comcast often does odd things.
Hot off the
I'll
press.
second that motion.
Can I ask a question though? Although we said we take time to look at it, one thing that will guide us is if we know what things are different. For example, I'm looking at lines 3 through 9, and they seem to be quite similar, if not the same, as lines 13 to 19 in the original bill. Could you identify what parts are different so we can focus our attention on the different parts?
And are we actually in the executive session yet? We shouldn't.
We're moving that way.
No, he hasn't opened an executive session yet. What this bill does is it makes the statutory part of House Bill 103 identical to Senate Bill 150 as amended by 0612S. So the two final sections of the bill are where the changes are.
I'll go through
Okay.
the changes when we introduce the amendment.
But since we're supposed to spend 5 minutes looking at it, it'd be helpful if we knew where to look. Can you just tell us what page, what lines are different?
I have got it out to you guys as fast as I could.
I think there are a few things. One is that it changes the date of implementation, which is on line 25 on the first page. It also aligns the actual benefits on the second page, the lower part of the second page, to be aligned with Senate Bill 150 and the current.
But what lines? It helps much if I know what line.
Line 14 on page 2.
Okay, thank you. Yep.
And so it aligns the actual benefits, it changes the implementation date, and it makes clear that at some point this will be merged with the children's dental program.
Okay.
Representative Shapiro,
Yes.
on the amendment on page 2, on line 6, it doesn't have a deadline or a time frame for the state to modify the state plan with Medicare, Medicaid.
Well,
was the
it
original bill.
refers back to the date of implementation. It says within the quarter of the year, within the 3 months of the date of implementation.
Okay.
Okay, thank you.
It's coming. I just told. Those of you in the room, committee service just said the amendment's being run down here.
Have you closed the hearing on?
No, just to make it formal, I'm going to close the hearing and open the exec session.
Are we ready?
On House Bill 103.
Did you actually?
I read it here. You have not read it.
Sorry, Nancy?
Whoa. We can certainly discuss
Yeah, I
it.
just haven't looked at them yet.
Are you ready for a motion or
It's
should
kind
we-
of now.
You need to open the executive.
Yeah, I have opened the
Oh,
exec
you
session
did that.
on 103, so we can discuss this while a few of us are awaiting it.
Well, I would move that we adopt amendment 0688.
I will second that.
Okay, and we're going to wait, we can discuss that while some of us are waiting for it.
Like which lines are new? Last two.
Okay. So I think I already said this, but if people didn't hear it or people didn't have the amendment in front of them, I think this amendment does a few things. One, it aligns House Bill 103 with Senate Bill 150, which has just been passed out of Health and Human Services in the Senate by a 5-0 vote ought to pass. So it really makes these identical bills. And one of the things it does is it changes the date of implementation to January 1st, 2023. It also takes the language about the actual benefits. It doesn't really change what the benefits are, but it takes the language about the actual benefits on page 2, line 14 to line 20, and makes those identical with the Senate bill, and also aligns them with the working group in DHHS about what they've based their estimates on. The other thing it does is makes clear that this will eventually be merged with the children's dental benefit to try to put it all into one program to affect cost savings. So Representative Marsh can add something if there's more, but those are the major changes that this amendment makes.
I would agree with that, and I would point out that some of those changes are made so that we can actually do it in the current fiscal environment, and that is something that's important to me because I try to be responsible. And so that was my major objection before. We didn't have an actuarial note, but now we have good actuarial data that we received just within the last few days, both from the state in fiscal note and from Delta Dental and the actuarial analysis. And that persuades me that this is a reasonable time to move forward.
One additional thing about the amendment and pushing the date out further, which pains me to tell you the truth, January 1st, 2023 seems like a long ways away. But the estimates that the Dental Benefit Working Group and DHHS made were meant to look forward to a time after COVID, so that the numbers of people on Medicaid which have swollen during the pandemic would go back down to a more normal numbers, and therefore it would be more affordable to have the benefit start later.
Representative Gay has something to share.
Well, actually, it was a question of, and you probably both answered it. Financially, you're afraid of adding this expense right now. But 23 does sound, do you ever do it like 6 months before 23? Or, yeah, I also don't want to make things super expensive, but I'll bet you a cost analysis is going to show that we're paying out a lot for medical costs when dental care is not provided. I'm assuming y'all did this painfully, but I really don't like to have to wait till January 23 either.
I can speak to that. I am completely with you. However, one of the things I've learned is that there's an awful lot of moving parts to anything, but specifically to this. And there's a lot of people involved, and there's the Senate, and there's the House, and there's the working group. And, you know, my interest is in it eventually happening. And I think this is what we had to do to work with all the other people who are working on this to make it happen.
I would agree with that. There are a lot more influential people than myself or Representative Shapiro who've been working on this issue. And for us to quibble about, I won't say it's a small detail, but the greater, compared to doing it or not, it's a small detail. We would rather not get in the way of that process. So this is just us endorsing what they've done in the Senate and coming on board and saying, yes, we would like to see this happen if we can make it happen financially.
Senate, what's 2020?
Anyone else with something to share or ask or what have you?
Representative Nutter Upham. So did I hear you say the Senate just passed this 5-0? Their committee?
Senator D.K. Jassett has not gone to the floor.
Right, just the their committee there.
Right, that's correct.
Yes, thank you for that clarification.
Representative Merchant.
Thank you, Mr. Chairman. On the fiscal note, moving it out to 2023, how does it impact the fiscal note? Is it favorable, unfavorable, or it doesn't make any difference?
I think it's favorable because the numbers of people on Medicaid right now are inflated due to the coronavirus. And it is assumed, although I learned that we can't assume anything about the virus, that those numbers will go down as the virus recedes and more people go to work and more people are insured in other ways.
Thank you.
Anyone else? This is on the amendment 0688H, which we've got now in the room. And it was moved by Representative Shapiro and seconded by Representative Marsh. This amendment will make the bill equal to the Senate equivalent. Any further discussion? Seeing none, when the clerk is ready, would you call the roll, please? On amendment 0688H to House Bill 103, moved by Representative Shapiro and seconded by Representative Marsh.
Thank you, Mr. Chairman. Representative Marsh.
Votes yes.
Representative McMahon. Representative McMahon. Back. Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes. Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
We have one absent and 20 yeas.
It's 20-0.
20-0.
The bill passes 20 to.
Amendment.
The amendment passes, thank you. The amendment passes 20-0. And the chair now calls on Representative Shapiro for a motion.
As much as it pains me to do this, I am going to move that we retain House Bill 103, and I will tell you why. I don't know if there's a second.
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 Cushman seconded.
Can I speak to this?
Yes, you may.
Okay. As I mentioned before, there are an enormous number of people involved in this and a number of, there's two different bills. And there's the fact that money was not in the governor's budget initially. And so there are a lot of moving parts, and I have done my best to be in touch with Senator Rosenwald, who sponsored the bill in the Senate, the people in the working group, Representative Marsh, who seems to be a conduit to Representative Bradley, and senators in the majority. And I think there are a lot of positive signs at this point. The working group has come up with a list of benefits. The financial note was $7.4 million per year, and Delta Dental came in with an estimate that was less than that, although they weren't comparing exactly the same things. Representative Pearson has told me that the House Finance Committee is looking for what are healthcare priorities, and that he has informed them that a dental benefit is a priority. So there's a lot of things that are looking very positive, but we all know that this has never really happened. So the reason I am making a motion to retain this is that there seems to be a group of people in the Senate who are coalescing around a plan to put the money into the budget in the Senate and put the policy into the budget in the Senate, maybe including tabling the Senate bill. But in any case, making it a reality in the budget. Second thing is that I've been informed by Representative Wallner that if our bill goes to the House and gets defeated, it will be very difficult for our party, maybe both parties, to advocate for putting this money in the budget in the Finance Committee. It would make it much more difficult for them to say that the House endorses this idea. Thirdly, by retaining this bill, if a dental benefit does not get put into the budget, does not get put into the House Bill 2, then we have a bill that's aligned with the work that's already been done and is ready to go for next year. So I feel very badly about asking you to retain this bill that I've worked really hard on, and a lot of people have worked really hard on. But I think it's the logical, strategic choice for the moment.
Any response? Representative Marsh.
Yes, I thank Representative Shapiro for that. And I was thinking along those same lines until very recently. At this point in time, it does look to me like the stars are aligning and that the money is going to actually be there to get this done. And that our committee passing this may be the impetus to push the Senate bill over the finish line. So I personally would like to see a motion, vote on not to pass as amended motion before we vote on a retained motion, but if that's the will of the committee to do otherwise, I respect it.
Can I have a point of order?
You may.
Thank you. I'm having a hard time hearing Representative Marsh. There's an echo. So were you asking us to do a motion of ought to pass and then retain it?
No.
Oh, good. Because if we move ought to pass and it passes, it's out of our hands. So unless somebody moves to reconsider. So am I right in thinking that you are also in favor of retaining at this point?
No, what I said is that I would like to see the committee vote on not to pass as amended motion.
So you would like to pass it straight out onto the House floor?
We amended it, yes.
And what would be, if the House doesn't go along with us, what happens then?
That is a problem, I recognize that.
Yeah. So what was it that changed? Because I'm trying to wrap my mind around the fact that there have been a gazillion negotiations on this and a gazillion concessions made in all kinds of different directions, and suddenly we're getting mixed messages.
I understand that, but I think we finally got the financial analysis that we asked for some time ago.
I mean, I'd be delighted to pass the thing. I'm just concerned about representations that have been made to people who are not in this room. That's all. Or compromises that were made and that people are not necessarily part of.
Representative Soloway.
Thank you, Mr. Chairman. I have listened with, dare I say, some confusion to the representative from Keene, for whom I have the highest respect. And I've heard his ambivalent feelings about asking to retain this bill. I also heard him indicate that there was movement in the Senate, but he suggested that the Senate was likely to table this motion. So I have some confusion there. I've also listened to the representative from Brookfield, for whom I have equal respect, who says that the numbers are now in place. Further, looking at the state revenues that are coming in, it is very likely that, to my surprise, we will have the budget available to fund this program. We all agree that the program is of extraordinary value. I must tell you, I've worked on this topic for 5 years now. It is time. It's time to make this move forward. And there's a cost savings built into it. We need to take the leap. It's an act of courage. Please let us defeat the retention and pass this bill.
And if I may, Mr. Chairman, just speak to the table in the Senate.
And then Knurr.
Yes, go ahead.
Go ahead, Representative Weber.
What the Senate usually does, their process on sometimes tracking ours, but often not tracking ours, with bills that contain a fiscal impact, is they will pass them on their floor and then they will table them and just leave them on the table. But it's not the equivalent to retention. But that is a procedure that they follow regularly with many, many bills. That's how they get things into the budget. They don't pass the bill itself, which would absolutely require it gets into the budget. They view it more as a statement of policy that the body's adopted. That having been said, if it's the will of the committee to go ahead and vote this ought to pass, I'm certainly not going to stand in anybody's way.
Representative Knurr.
Thank you. Yes, I very much want to see this pass too, but I recognize the strategy, and if we do have things moving in the Senate, including putting it into the budget, I think keeping this in our back pocket as a bill which we will have retained gives us that ability to come back in the next year if perchance it somehow implodes and doesn't happen. And I think that the arguments that were made by Representative Shapiro regarding the might be more difficult to push it along if the House has taken a position against it, makes it a little bit more difficult to just move ahead with a ought to pass, because of the fact that I can see some downsides of how it might cause trouble, and I can't see any downside of holding back if the Senate is going full steam ahead, including in the budget, and there's an upside of holding it in retention to give us that fallback position should we need it. So I kind of favor the retention for that reason.
Anyone else? On the screen.
Mr. Chairman?
Representative Merchant.
And then Shapiro.
I'm looking at the amendment that we just passed. And in the amendment, the date of the contract to take effect is January 2023. So if we do retain this and we act on it next year, we're still not going to impact the implementation date. Is that correct?
That would be correct. We could pass it in the exact form of the vote.
So again, strategically speaking, if things don't materialize either in the Senate or in House Bill 2, we could revisit this if we retain it, to make it a policy to go into the budget. Is that correct?
Is that correct?
I didn't understand your question well enough.
So basically, if we retain the bill as it's amended, and the Senate doesn't act on it, or doesn't go into House Bill 2, which is the budget, we could next year pull it off the retaining, act on the bill, and still hit the January 2023 implementation date.
That's a very effective argument, Representative.
And it's not in the budget because the budget was passed this year.
Correct.
I think that's undetermined, because we don't know what'll happen if we have to submit this bill again next year. We don't know what the numbers will be. We don't know what. I think that it's possible that the implementation date could be the same, but you never know.
Thank you.
I had a nice chat with Representative Weiler, head of House Finance, and convinced him of the wise economics and the frugal economics of doing the right thing. It's one of those occasions that we love when doing the right thing for people is also cost effective. And he heard that argument, he received that argument. What he does next is up to him, but we've had a good discussion and he said he took my point. Representative Weber.
That's a residual, I'm sorry.
Okay, anyone else? Representative Shapiro?
Yes, I am, as I said, I was extremely ambivalent about asking to retain this, and now I'm more than a little bit, I'm surprised by Representative Marsh's suggestion that we not retain it, since part of my decision, only one part came out of discussions with Representative Marsh and his suggestion that we retain it, or his passing on suggestions from the Senate that we retain it. So I am completely baffled. Certainly emotionally, I would like to see it go forward and pass. So what am I trying to say besides that I'm confused? I guess one thing that I don't know that there's an answer to, but I would ask Representative Marsh and maybe Representative Pearson as well, what your thoughts are on what will happen if this goes to the House. I mean, I am certain that the Democratic caucus will support this wholeheartedly. And so I'm really asking, I don't know if this is exactly appropriate, if you have any sense of what the Republican caucus and leadership will do in terms of supporting this bill should it go to the House. Should we pass it or to pass?
All I know to answer that, Representative Shapiro, is I have spoken to numbers of my Republican colleagues who listen to me, at least, and I believe I am making an effective case for this and would speak for it, but I could not promise an outcome. Representative Marsh is nodding affirmatively.
Yeah, House sessions seem to be attendance driven at this point in time. And I don't think any of us know what the attendance will be. It's a gamble. It's one of those high risk, high rewards versus the safer situation we go. And you made a very effective argument, Representative Shapiro.
So could I suggest a way forward?
You're calling the question.
Could I suggest a way forward, Mr. Chairman?
She would like to suggest a way forward.
Yep.
Please do.
It seems to me, on the basis of the current discussion, that if the maker of the motion and the seconder of the motion wished to withdraw, we could withdraw this motion and another motion could be made. Otherwise, we are going to have to vote on the motion to retain. And I will just state that I have heard enough that I will now vote against the motion to retain so another motion can be brought.
This is a question that goes. This is a question that goes to Representatives Shapiro and Cushman if they are willing to withdraw, and if they're not, that's perfectly their right. Representative Shapiro.
Yes, I will. I will withdraw the motion and let the committee decide on whether to send it to the House or not.
Representative Cushman.
Well, so it's going to be the same outcome either way. It's going to either be retained or passed, and people will, yeah. So I'm fine with withdrawing the motion.
Okay, Representative Cushman withdraws, and so there is now no motion on the floor. Representative Weber, do you care to make a motion?
No, I don't care to make a motion. I think that somebody who has worked on the bill should make a motion.
Yes.
My question, thank you, Mr. Chairman. My question is, what's the downside of retention? What is the downside? What is the risk?
Yes, you may.
I want to thank Representative Alexander for subbing at our committee today. It's good at keeping us in the realm of reality. And he pointed out to me that a certain bill that we discussed at the last House session got completely out of hand. And this could very well go the same way, and that could be distinctly disadvantageous to all of us. And he has convinced me, and therefore I will make a motion to retain this bill.
Second.
Oh, for God's sake.
Okay, Marsh and Representative Cushman was quick to jump in. So Marsh and Cushman now. Do you have enough paper over there, clerk?
Same amendment?
Retain doesn't have.
No, retain the.
Okay.
We passed the amendment 20 zip. So the motion now before us, and I really hope there's no more discussion, is to move to retain, now moved by Marsh and seconded by Cushman on House Bill 103 as amended by 0688H. And would the clerk please call?
Can I have a point of order?
Point of orders acceptable.
I in no way want to complain about Representative Marsh wearing a mask. I completely endorse his wearing a mask, but I couldn't understand what he said when he all of a sudden made another motion to retain it.
Representative Shapiro, I heard of this business and not personal.
Thank you, Representative. I would not be in this building without my N95 mask manufactured in the state of New Hampshire, which I think ought to be made the mask of the state. But I want to thank Representative Alexander, who called me to my senses and pointed out several realities. And this is certainly the safe way forward, as you correctly pointed out earlier.
It's always nice when the census works out. The motion on the floor, would the clerk please now call the roll?
Thank you, Chairman, I think. Representative Marsh.
Votes yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay,
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King.
Yes.
Representative Kofal.
Yes.
Representative Weber.
With great confusion, Representative Weber votes yes.
Representative McKay.
No.
Representative Snow.
Yes.
Representative Schnurch.
Yes.
Representative Soloway. Representative Soloway. You're muted.
No.
No. Okay. Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
19 yes, 2 no.
It does not need a blurb. This just in from our viewing audience. I have been reminded that one does not move the question in committee. So when I moved that question, I shouldn't have. So apologies, and here we are. So we are retained. And this ends the executive session on House Bill 103. And we will now begin the exec session on House Bill 503. And it is the codifying the Council on Housing Stability.
Yes.
Well, having shout no several times, it's nice to hear the other word too. Thank you. Representative Shapiro sets aside his amendments 0379H and 0464H. And there is an amendment that I have in my possession, 0634 of March 4th, but just hot off the press is the amendment 0678H, Shapiro and Marsh. So I need to know about the previous amendments, which is 0634 by Marsh and Shapiro. Is that the one you wish us to deal with or another one? Representative Marsh.
Yes, Mr. Chairman, I'll move amendment 0678H, and I will speak to my motion.
All right.
Someone has to second.
Second.
Thank you, Mr. Chair. The difference between the two amendments is a single word on page 2, line 17, where we change the word mental to the word behavioral to accurately reflect the name of the association.
Oh, got it.
That's it.
That's the difference between the two amendments. What this does is it merges the intent of the original bill into the existing council, which we were told by the department would be duplicative, so that the issues that we asked to be addressed would be addressed faster and would continue to be addressed on an ongoing basis because the council has no expiration date.
Any questions on the amendment to Representative Marsh?
All of your current account information is available.
Seeing none, the motion is on Amendment 0678 to House Bill 503, moved by Marsh, seconded by the chair. And the clerk may call the roll.
Thank you, Mr. Chairman. Representative Marsh.
Votes yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21-0.
21-0. Representative Shapiro, do you have a motion now?
I would defer to Representative Marsh.
Okay,
Thank you, Representative Shapiro. I was going to defer to you because it's your bill. But if you truly wish, I'll be glad to make the motion. But being as it's your bill, I would be very happy to let you make the motion. You don't seem to want to.
Well, it was not my bill initially.
I thought your name was on it. But
No.
all right, in that case, I will move on to pass as amended. House Bill 503 with amendment number 0678H.
do we have a second? Representative Soloway,
No second discussion.
we have to have a second. Who
I'll
would like to
second.
second?
I'll second it.
Representative King. Now we can discuss it.
And Soloway.
Representative Soloway.
Thank you, Mr. Chairman. I would like to speak against the motion. First of all, I'd like to praise the representative from Manchester for his compassion in dealing with the issue of homelessness. I have spoken with him about this privately, and I certainly feel that his heart and mind, as usual, are in the right place. However, I was warned by a previous chairman of this committee, the representative from Walpole, that the state has numerous commissions which typically don't get an awful lot done. Creating a new commission is going to pull together numbers of people representing political constituencies, which is the manner of such commissions, such as, for example, somebody from the Medical Society, somebody from the Nursing Association, somebody from ACLU. Oh, no, I take that away. Legal Defense, I don't know. Numbers of political constituencies that will come together, none of whom necessarily has substantial expertise in the area in question. We have a Commission on Housing Stability, and my friends, I would like to point out to you that within the state of New Hampshire, we have not one, but two nationally recognized experts on homelessness. Homelessness in the urban communities is best represented by our own representative from Newmarket. May I name her, Mr. Chairman? I know it's not normally done.
Yes, you may.
Representative Charlotte DiLorenzo is one of the founding members of the Pine Street Inn in Boston and is extremely well-versed in issues of urban homelessness. At the same time, at Salem State College is Professor Yvonne Vissing, a resident of Chester, New Hampshire, who is the author of the book Out of Sight, Out of Mind, Homelessness in Small Town America, which speaks to the issues of rural homelessness. We have these two people just within our midst who put together in the same room for 2 hours could write a report with an action statement appended that would make a great deal of sense. I believe, members of this committee, that creating yet another commission is not the most effective way to deal with homelessness. I believe that we should remand it to the Commission on Housing Stability with our instruction that they confer with Professor Vissing and Representative DiLorenzo for their help in coming up with a plan for homelessness in New Hampshire. And I thank you for listening.
Chairman, may I respond?
You may respond, Representative Marsh.
Thank you, Representative Solomon. I want to say that I agree with you entirely, and I will point out that the motion on the floor does not create a new commission. What it does is it sends the issue of housing and homelessness back to the Council on Housing Stability. It expands their already existing duty to address the issue of homelessness with some of the concerns raised by the initial bill, and adds a few members to the commission who were thought to be interested in and important in dealing with the problem. So we are not creating a new commission by the motion currently on the floor. We are remanding it to the Council on Housing Stability, which is exactly what you said you supported.
Anyone else? Representative Gay.
Yeah, I guess, thank you for taking my question. It really is. The problem with the wording is that on 14, line 14 of page 1 of the amendment, that it says where Council on Housing Stability established, maybe established isn't the word, made permanent, expanded, might be more accurate. And certainly we were, some of us, he can speak for himself, another member on this committee, we were very impressed with Representative, Longs. He was commending organizations that have boots on the ground, who have a track record. It's not just higher ups planning things. It was, and maybe you could finish this conversation. Could I give my time to him?
Sure, go ahead.
All right. Yeah, I was impressed with the presentation that was made last week. And the people that are part of this this House bill are people that are involved in the community and they're involved in their areas. And so I think that the boots on the ground is just what we need. You know, to Representative Salloway's, we don't need another person or another bureaucratic committee that's actually telling us what to do without having any kind of representation out on the streets. So I that's one reason why I like this bill.
Anyone else?
Point of information, Mr. Chairman.
You are recognized.
I'm wondering if my understanding, we were talking, the bill has been amended. So the bill is now, my understanding is that the amendment replaces the bill in its entirety. Is that correct?
Yes.
Okay. I just wanted to be sure that we were all in the same place. And it is for my further understanding that what this has done is taken an existing council, which was established by the governor, and is now giving it the authority of statute and the blessing of the legislature, and is putting a few more members on it and is directing it to address the homelessness issue specifically instead of just peripherally. Is that correct?
That is correct.
Okay, thank you.
Representative Merchant.
Thank you, Mr. Chairman. Again, I think Representative Weber kind of spoke to it, but I'm looking at the additional members that are on page 2, line 31 on. Those are the members I believe that the Representative Long spoke to, and the other people who addressed this committee. We're talking about boots on the ground. That's where they're coming from those membership. Is that correct?
Customers who are not enrolled can fax a signed letter
The way the amendment is set up, the initial section are the ones that were originally put in by the governor's order. And then the second section is the ones that we are adding which are not duplicative of members in the first section.
So,
So that list from the original bill.
so those would start on page 2, line 31.
Correct.
Thank you. So we are basically adding what I call boots on the ground, people who are in the homeless arena, added, if you will, to the existing council.
That is correct.
Thank you.
Representative Snow. Please unmute.
You're muted, Ken. Ken, you're muted.
Hello?
How's that? Am I unmuted now?
Okay,
Am I unmuted?
you're unmuted.
Thank you. I was hoping I could speak to Representative Long. I did get a message from the mayor of Manchester, who's quite concerned about the original construction of this committee on housing. And because it was really the original committee as set up by the governor was really not looking at homelessness at all. It was looking at workforce housing and having affordable housing for people as business and opportunities expanded. And very little attention being given to homeless. And we had a strong feeling we're going to be swept under. And I think this is a particular concern in certain communities, at least Manchester and Nashua, the big cities where they've become kind of a magnet for large numbers of homeless people. And during the COVID-19 event, you know, the restrictions on the existing shelters and so forth, it's becoming a gigantic problem. And you've seen it in the papers with tent cities having to be broken up and so forth and so on. And we were just, I think everybody was concerned that this committee as originally set up, it had people that from mental health and health and human services, but they were all really bureaucrats that do not have their feet in the ground to doing it. It's expanded. Unfortunately, I don't have a recent version of the bill, so I don't have a complete list of where it goes, but I do remember seeing it, and that certainly is better. I would feel a lot more comfortable about it if this, like finance, was divided into two separate divisions. One on housing, one on housing stability, as they said before, and workforce housing, and the other on homelessness. It could also be one committee, but to have two divisions. But I'm terribly afraid the way it's constructed right now, the issue of homelessness is going to be an afterthought and not much attention is paid. And I see it as a gigantic problem here in Manchester. I wish, do you know, as the sponsor of the bill, is Representative Long on the list to testify today or not?
This is an executive session, Representative.
But did he sign in to be present for the executive session? I'd love to find out if anything has changed with the mayor and others. I was hoping to see him at this noon meeting and I didn't get a chance to leave on time to do it. But I have real concerns about this, that this bill is going to do very little about that other side. And I think we have to take a look at how we can.
Representative Long is not on this meeting in any way.
No, I understand, but he's entitled to attend. I mean, he can sit in as a witness.
He is, but he hasn't.
No, he hasn't.
Thank you.
I paid by check.
Representative Shapiro.
Yes, thank you, Mr. Chairman. I think I would agree with some of the sentiments that people have about this being less than an ideal solution.
305.
I think that the Council on Housing Instability, as it will be set up, if this passes, will have many tasks and many people, including the membership, which will be heavily weighted in terms of government. Someone used the word bureaucrats. That's maybe got a negative connotation, but it's weighted in terms of people in state departments. So I think it's far from ideal, but when DHHS said that testified against having a homelessness commission, I guess I thought that the commission was doomed and that this was a compromise, would at least increase the membership and to include the people that were in Representative Long's initial bill. So I hope that on the council, they will take the initiative to give weight to the homelessness problem and maybe divide themselves into subgroups.
Representative Soloway.
Thank you, Mr. Chairman. I would like to amplify on the representative from Manchester's comments and the representative from Keene's comments, both of which I think are very well taken. However, if you look at the construction of such commissions, they have a decidedly urban focus. Here in New Hampshire, we also have a rural homelessness problem, which I think is not being addressed in the legislation. If you go back to the book Out of Sight, Out of Mind, and you go through, there's also a documentary film that accompanies it. If any of you have had the opportunity to drive down a dirt road in New Hampshire, and at the end of that road, you find a foundation of a home with no home on top of it, plywood boards across the top, and people living in the basement of what was supposed to be a home. If you drive down that dirt road and you find an old RV that has people living in it through the winter, if you find a tent camper with people and their kids trying to survive the winter, those people are not addressed in a commission that has an urban focus. This problem might be better addressed just by having DHHS write a consulting contract for people like Professor Vissing and Representative DiLorenzo. I think that we're creating, yes, a bureaucratic morass that's not going to give us a concise directive solution. Thank you, Mr. Chairman.
Thank you, Representative. Representative McKay.
I withdrew, but partly it was more of a complaint. There's so much, it's like somebody else's voice is being broadcast simultaneously, and I can hear it right now. So I don't know what you can do about it, but it was more of a complaint that it's hard to hear.
Yeah, it's somebody has something in the background. Ken, it often comes from you. Could you mute yourself and see if it goes away? Let's see how that works.
Anyone else with a hand up?
Thanks, Ken.
Representative Snow?
I don't think he ever took it down.
Anyone else with a hand up? Representative Gay?
Thank you for taking my question. I really am in question mode now because it seems like we're all in agreement that there's a serious housing problem in the state, both rural and in cities, that needs to be addressed. And we just haven't found a way that we think is the best way to put a group together. My real question is that there could be an appointment, I don't know if that's called ad hoc, but an appointment of people who are experienced, which would be named in the bill, in the Representative Long's bill. And if more people have been mentioned who have professional, who have a long track record of addressing homelessness. I'm so sorry that we are up against the deadline because it sounds like we're all concerned, we're all aware, we have great ideas and how to put them together. Do we have to pass a bill to do that? I also have serious reservations as soon as these two groups of people were combined into one because their concerns really are divergent. Yes, they all need housing, but just getting housing doesn't solve, how do you get housing to people who don't have money or have mental issues. It's not the same as making affordable housing for people who are working. So, you know, again, I want us to do something, but what is the best way? Is this amended council gonna do it, or should we be thinking something more effective?
Anyone else? Representative Knirk.
Yeah, sure. There are mechanisms. For example, the person who Representative Salloway has mentioned could be appointed under V on page 2, line 27. Could be appointed by the governor to this council. That would certainly be reasonable. We also have the statement in here of 3 mayors or their designees, and it doesn't say that it has to be a mayor of a major city. Except for the small ones don't really have mayors, never mind. So that may not work. But I think we could get some of these other experts in with the current structure that is in the amendment that we just passed. Thank you.
Anyone else wish to share, ask anyone else a question? Okay, seeing one, Representative Snow.
I'd just like to clarify my position. I was sounding terribly negative about it, and I guess in a lot of ways I am. But I'm also saying I think the new bill with additional people is an improvement over the previous bill, which to me would end up only talking about affordable housing for people moving in for business expansion here in New Hampshire, and would ignore all the people. And even among the homeless, we have a big difference between what happens in cities like Manchester, Nashua, perhaps Portsmouth, and some of the other larger cities, and rural communities where you have people doubled up, living in basements, as he said, in other places. Even among those two restricted groups, there's very different problems that go on. This is a mammoth task. I understand that trying to get 2 commissions set up, and that's why I suggested, is there any way of making sure that it's understood that we didn't just add all these additional people onto this Committee on Housing Stability to make it look more generic? I'd like to make sure that those people that are at it are really going to have the power and the ability to address it. I don't know how you go about doing that. I don't pretend to know. But I think this bill, while it's an improvement, is clearly going to leave the homeless population in a big disadvantage.
Representative Snow, may I make a parallel from work I do with the deaf and hard of hearing? We get something in place that we thought it would do something, and it did, but it was good, but it wasn't what we had wanted. So now I'm coming back with a second try, and I think we'll now wind up with 2 good things. So if it's the case going forward over the next several months that it doesn't seem that the Council on Housing Stability really addresses what some of us have been looking at, the rural poor and so on, several good folks can work up a new bill over the summer.
Yeah, I guess that's the best we can do.
I think it is. I think so. That's what I had to face. Representative Nelson.
That's true. Hand down.
That's true.
Representative Marsh.
Yes, thank you, Mr. Chair. I wanted to point out to people that this amendment does not just add people to the existing council. It also expands upon the charge to address homelessness. The initial charge to the council was a very short one, which is seen on lines 28 to 29, to develop a comprehensive update to the state's plan on homelessness. We expanded on that by adding the 7 items that were in Representative Long's bill, which are found from there down through page 4, line 7, and added line 8 at Representative Shapiro's suggestion to explore national models that successfully address and mitigate homelessness. So I think that clearly we will be directing the council to pay more attention to homelessness than they are doing at this point in time, which I think was the intent of the legislation.
Thank you. Representative Shapiro.
I was really going to say the same thing that Representative Marsh just said. It does add the charge from Representative Long's bill, as well as adding all the extra people.
How long does it take?
Once again, it's far from ideal because it's a lot of people and it's a lot of tasks, but it is inclusive of the tasks and membership from the original bill.
Anyone else?
I just have a
Representative Cushman.
Thank you, Mr. Chairman. I just have a question. Do you think that any of these members, any of these representatives who will be on this board will be coming to the table and bringing the principles of perhaps reducing regulations to allow the free market to help meet the needs of the homeless, to help with housing stability, et cetera?
And who would you address that to?
I will address it to Representative Shapiro.
Representative Shapiro?
Can you repeat the question?
So I'm seeing, I'm seeing, all of these bureaus and groups, and my instinct is telling me that what will come out of this is first of all, it's a very large board, or commission, council, sorry. I foresee that there's going to be some recommendations for, centralized control policy, probably similar to the governor's workforce housing policy that he wanted to put into place. And I was just wondering if any of these designees or executive directors or commissioners, if any of these positions, do you see them coming at this with some suggestions for how the free market or reducing current regulations on, say, zoning or building to deal with housing instability? Do you see any of these members bringing that kind of information to the table?
Thank you. I had not thought about it. I had not thought about it in that way. It does call from a representative from the business community. And there are, in the council as it's already set up, I'm looking through this as I'm talking to you. There is one particular representative from the business community with an interest in affordable housing. I don't know if that point of view would be, to what extent that point of view would be represented.
Okay,
so I guess I can't really answer.
Fair enough.
Anyone else?
Yes, please.
Representative Weber.
Thank you. Unfortunately, Representative Snow, oh, yes, he's behind the piece of paper. I have two things. One is a point of just how the committee works. It appears to me, and I will ask this through the chair, it appears to me that when Representative Snow is muted, we do not get the voice in the background. So I am wondering if the chair would ask Representative Snow to mute himself when he is not speaking, because we're getting, this is a follow-up to what Representative McKay said, we're getting a huge amount of somebody else's voice. And when you're muted, we don't hear it, or I don't hear it. But when you're not muted, there is a noise coming in the background. So most of us mute our computers when we're not directly speaking, and that helps.
Thank you.
So that's item number one. Item number two, to respond to Representative Cushman, I see as members of the original group, somebody from the Department of Business and Economic Affairs, and they may or may not have an interest in free market economics, depending on who appointed them and what their background is. But I also see a representative of the Landlords Association, a representative of the New Hampshire Builders Association, local providers of housing services, so, and a county economic development council. So it seems to me that there is at a minimum an opportunity for those voices to be heard, although not being in charge of appointing them, I can't make any promises, but I think that there is a fair amount of that available.
Thank you. Representative Gay.
I'll come up with a sort of a proposal. One is that we pass the amendment with all this humongous group of people, and that we make the suggestion to the people who are boots on the ground that they form their own committee so that they can come up with the request, things that they need money for, things that they need approval for, and present them. It can be people who are on this, who are proposed to be on this list, on this committee, but they can meet separately, whether they're ordained to meet separately or which they just do on their own. But then they come back to this group and say, this is what we need. And so that then they have a big group of people who can advocate for them. I'm very concerned that if that doesn't happen, when you have the commissioner of this and the head of this and the director of this, I don't think that's going to be real effective. They can vote on things, but I don't think they're going to really be directing the actual boots on the ground work. But maybe if they were a clearinghouse and an approval and an advocacy group, then they might really lend their weight to making some things happen.
Thank you.
Mr. Chair, if I might.
Anyone else wish to be recognized?
Yes.
I do, Mr. Chair. Oh.
Representative Snow, go ahead.
Yeah. I do want to apologize. Unfortunately, I do believe I was at fault for that. My wife had to take a phone call in a room down the hall, and she was trying to be very quiet, but not successfully. But I'll be very conscientious about muting when we can't. This is a small apartment, so I'll be more careful in the future. And secondly, what I said when I was talking was very much the same as what Representative Cushman that just spoke. That's what I was thinking. If we could get this committee to operate the way finance does, into divisions where they work in divisions, but then they have to come together as a whole committee to make their recommendations. And there'd be some agreement that both sides would be represented in any final recommendations. That would seem to work better. I don't know that you have to put that in the bill. It does seem to me, looking at the list, that there's enough strong-minded people who of the group with boots on the ground that they're going to insist on this anyway. Pat Long doesn't sit quietly for anyone. So I think there's no concern about that. And I think on the other side, we have a lot of high-ranking officials that are on the other side. So I think the more I think about this, it would work, but I think we need to try to move people in the direction of seeing it as being two separate subcommittees that then come together and operate. We did that with this committee last year. Jim McKay and I headed up a separate group on mental health, substance abuse, and marijuana. And the remaining members did together. And then we all came together in executive session to finalize it. And I think that worked out reasonably well. And if we could get this group to operate in very much the same way, I think we have a better chance of not leaving the homeless way behind. Sorry.
Thank you. And if you could mute, please. And now Representative Knurk.
Thank you very much. I'd just like to point out that on page 3, line 10, it says the council may form subcommittees as necessary in the course of its work. So that ability is there to develop a subcommittee who might very explicitly work on the homelessness question separately. And I would think that would be likely. And also in response to Representative Cushman's comment, one of the other things she commented on was zoning. And a lot of the homeless organizations, particularly the New Hampshire Coalition to End Homelessness, they also have often addressed the question of zoning and particularly the over 55 restrictions and large lot restrictions and how that interferes with housing availability, which trickles down to interfere with to cause homelessness. So I think that would be addressed as well on this commission. Thank you.
Anyone else?
Shapiro.
Representative Shapiro.
Yes, I think there's a lot of, understandably, there's a lot of angst about whether this idea of combining these two things will actually work or not. And I understand that. I think that that's understandable. I share that. On the other hand, today we only have the power of passing this bill as amended or not passing it as amended, unless we're going to recess and get in another amendment. So I think another possibility is those people who really are concerned about this being too many members or not focused enough on homelessness, make it their business to be in touch with people who serve on this council and come back in a year if there are real problems with a new bill that would solve those problems. But for today, I think we can only pass it or not pass it.
Okay. Anyone else? A few minutes. I'm in the middle of a memo to upstairs that I have to finish up right now. So hang in there for a second, folks.
At this point in time, there are no more hands, Mr. Chair.
Okay, well, I'm almost done. Done. With no more hands, the motion before us is ought to pass with amendment 0634.
0678.
There it is, 0678H. Moved by Representative Marsh and seconded by Representative King. The motion is ought to pass. Would the clerk please call the roll?
Thank you, Chairman. Representative Marsh.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Sorry, which motion?
To pass with amendment.
No.
Representative Folsom, yes. Representative Alexander.
Yes.
Representative King.
Yes.
Representative Kofalt.
No.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
19-2.
And Representative Marsh, if you would write the committee report, and between Representative Kofalt and Cushman, who would like to write a minority report, if any?
I will be happy to do that.
Thank you. Representative Kofalt writes minority report.
Is this going on the regular
It
calendar?
goes on the regular calendar. Representative Cushman, could you go out in the hall and look for that amendment we've been discussing?
Yeah.
Thank you.
Or,
6, 7, 8.
yeah. Another amendment. I think that's something coming.
May I ask what amendment we're talking about? Is there something we're supposed to be looking for in our email as well?
Yeah, eventually, um, eventually, not right immediately, we need an amendment I'm reading it as 676.
Yeah, 06.
0676 of today should have gone out to you by email. I just don't have a hard copy of it.
And I've received it.
I just have a hard copy of it.
Well, which bill?
What bill?
I got this.
601.
One at a time, let me answer 601. And we're not dealing with it next, but that's Jerry,
Got it.
Representative Connector asked, and so for future, that's
Yep.
what it is.
I've got it.
Okay. Let's have about a 5-minute stretch break. And oh, by the way, that ends the exec session on House Bill 503. Thank you. We'll take a 5-minute stretch and bathroom break, and during the interval, we can look for Amendment 0676, House Bill 601. We'll need a little bit later this afternoon.
And Mr. Chair, am I correct in thinking that we have left 3 bills left to exec? Is that correct?
Could you number them for me? Because
We have, I believe, 295, which is the birth record
Yep.
bill, 601, which is the privacy of personal information bill, and that's the one with the amendment you just referenced, and 605, which is the cannabis bill. Is that correct?
Yes.
I'll have to look at 605. Yep, that is correct.
We have 5 bills.
The clerk thinks we
What are
have
the
5.
other 2?
What are the other 2?
Okay, it is, I'll do them in numerical order. 290, which is the required for health facilities and special health care licenses.
We did that. That was in the
Yeah.
calendar for the House session.
Oh, never mind. Sorry.
Your turn. Everybody gets a turn.
I tell you, it's just crazy. What about 492?
492.
That is the COVID dashboard.
We killed it.
That was ITO.
Never mind.
Anymore? Let's get it straightened out.
Well,
Well, no, this is the time to do
This
it.
is the,
Yes. Why
it's
should you
called
do
being
it
gone
yourself?
for the week and trying to come back and find all the right
So
papers.
295,
So 3
601, and
bills.
605.
Yep.
So we've got a few minutes.
And I would take this moment to thank the clerk again for all of her work.
Yes.
because
Clerk.
it is
Yes.
a really, really, really tough job, and it really is admirable, the job you're doing. We appreciate it.
Yes, but the chair has quite a job proofreading all my stuff.
I had to read a copy of the chairman's speech this morning that was not my original. My original had unsplit infinitives where there were split infinitives in the original. I had to do it. That's why I was stumbling through it. And so I will try to go back to the more edited version next time.
Other people don't know what a split infinitive is.
Okay, we should form a study group on dangling participles, split infinitives, improper reference. And Representative Weber, I just am sure you're thinking of your 3rd and 5th grade teacher.
I am indeed, but I will decline to be on that committee because, as you all know, my ability to proofread, particularly my own stuff, is not good. So.
Well, I was very grateful in a couple of the books I wrote 20 years ago that I had as my external editor from the publishing house a husband and wife team who had ghostwritten almost 100 books. And anything I learned about writing, I learned from them.
I highly recommend E.B. White's essay about William Strunk's Elements of Style. but the White E.B. White essay about omit needless words, and then because he had omitted the needless words, he said everything 3 times. So in class, he would go in and say, omit needless words, omit needless words, omit needless words.
The worst kinds of redundancy is tautological ones. Yeah,
Yes.
that's a redundant tautology.
And Representative Nutter-Uppen can actually locate the books in her library, which I'm very, very envious of.
Wow. A rabbi friend of mine, his favorite joke is, what's another word for a thesaurus? I thought it was hilarious. A thesaurus being a book of other words for words. Okay, tough crowd here tonight. Just
Oh, yeah, we know.
thank you.
And are you here all week?
Yeah, I'm afraid not. Yes.
Are you going to need me for all 3?
I'm going to need you.
I have office after that. So. Is that all right if I'm outside?
Representative Soloway, how is Sophie? I haven't heard Sophie today.
Sophie was remanded to the exterior of the house, so that she takes great offense at my being in these conference calls. Feels that we are not paying attention to her. By the way, if any, may I make a comment, Mr. Chairman? Are we back in session?
No.
For those of you who care to access Out of Sight, Out of Mind, the book by Yvonne Vissing, several things. It did win the National Coalition on Homelessness Book of the Year Award. It's very good reading. And the documentary that she made was featured as the social action theme of the Ben & Jerry's One Heart, One World Group Hug Love Dove Folk Music Festival in Stowe, Vermont. She really has done an extraordinary amount of work. And as you read the book and you read the preface, you will find that it is dedicated to me.
Wow. And speaking of, would you tell the assembled multitude why we could refer to you as Louis today?
I'm amazed that you know that. Yesterday, we had a play reading here in Portsmouth at our synagogue, and I played the part of Louis, the gangster, in Neil Simon's play Lost in Yonkers. And it's great fun. And Jennifer, my beloved, was Gert, who spoke only on the inhale, not on the exhale. And we had a lot of fun doing it.
Breathtaking.
You may call me Louis from now on.
We should do this at our committee picnic this summer.
And Mr. Chairman, I think you are already aware of this, but in addition to the medical community represented on this committee, are you aware that there is a Tufts alumni delegation?
Tufts?
Tufts.
Go Jumbos. Who are they besides yourself?
Representative Weber and Representative McKay.
Go Jumbos. Williams used to beat you guys every year in football until we came into the new millennium, and now Williams is scared of Tufts football. Okay, we're coming back. Opening the House executive session on House Bill 295 relative to initiating amendments and corrections to birth records. And Representative Cannon, this is your bill, and you also have an amendment. Representative Cannon.
I have it somewhere in my file. I'd like
All
to.
right, you have a friend here.
I brought bringing House Amendment number 0608H for House Bill 295. The amendment,
Say the number again, please.
it's 0608H. I emailed it to all of you last week.
Motion before she speaks to it.
And before we go further, and while they're looking for it, you need to make a motion on the amendment, please.
I move that we approve Amendment 0608H.
Is there a second?
Second.
Okay,
It was Merchant.
it was Merchant, okay. Now, please address your amendment.
Following up on this, on the bill and our discussion, one of the pieces I added, it's paragraph F, which is on the bottom of the amendment, which was to charge the Secretary of State with creating the form that's needed to go along with the application for gender change on the birth record, the one that's been overdue since 2005, to essentially define the process and the information required to make it reality. I have also, based on conversations with others, I have changed the requirement for when the information is submitted to the clerk's office, that it should be sent to the Vital Records Office, and then the original birth certificate shall be retained in its original form, and a copy will be issued without a marginal note. And that's for a couple of reasons. First off, one of the reasons that an individual comes forward to request a new birth certificate is to not be called out for having a sex or gender change. And to put it in a marginal note is calling it out. And by doing so, we might actually be in the situation where that person is being discriminated against by providing that information in a printed form on their birth certificate. So I have changed, let's see, it is lines 25 through 27 by removing part of the sentence indicating that the record has been amended in accordance with this paragraph. Essentially, it's to the new birth record with marginal note instead. And then the birth record shall reflect the gender as male or female. Please be aware, this really doesn't change the original statute. What's done in the original statute in RSA 5-C:87, Roman numeral 5, because this is what we actually do. There is no marginal note on the birth record that's issued then. There will not be a marginal note on the one that's issued now. The Secretary of State's Vital Records Office told me that this is what needed to be added to the paragraph to be consistent with the current statute, and that the original record, birth record that people have been concerned about will be retained in its original format, and that instead of trying to figure out which multiple groups could produce an application for this, we're just going to toss it over to the Secretary of State's office and said, you have the responsibility to do this. I did go out to the Secretary of State's website, and they don't have any information about being able to change the record, but the statute still does exist. Thank you.
Are you, do you have some more, or are you ready for some
That's it.
questions?
That's it.
Representative Snow. Please unmute.
You're unmuted.
You're fine, Ken. Oh, you just muted it.
He must have left his hand
I
up.
think Representative Snow just has his hand up from before. Is that correct?
Thank you. Representative Shapiro.
I likewise must have had my hand up from something previous.
Okay.
Mr. Chairman, do we need a second for the amendment?
Yes, we did.
We have it already, is that correct?
That's correct.
Representative Cannon moved, Representative Merchant seconded. The chair now calls Representative Alexander.
Thank you, Mr. Chair, and my question is for the prime sponsor of the bill. I know it's just the amendment, but I guess my confusion is the analysis of the bill talks about the procedure to change to reflect a sex designation at birth, but then the entire text of the bill talks about the gender designation change. And I want to know if you can help me distinguish the difference between the two, and if there needs to be the change in something from OLS. Thank you.
I understand that there's references to gender in the document. Where many of us are familiar with gender versus sex. However, on the document that's produced, the birth record includes sex. It doesn't identify gender. We had this same issue actually when we worked on the driver's licenses. The bill was identified as gender, but the DMV prints out sex on our driver's licenses, so that's what it is. In this case, it is sex that's actually printed on the birth certificate, although many of us identify with gender. So it's written in as gender, but it is sex on the actual form.
Anyone else? Representative Cushman.
Thank you, Mr. Chairman. I'm just going to speak briefly to the amendment. I support the bill, but I can't support this amendment simply for the fact that I think that the birth certificate needs to have a notation on it indicating that it's been amended. Not just the original that's with the town clerk. I think that it needs to be acknowledged so that when procuring your birth certificate to whatever organization is asking for it, they can see that it's been changed. So I can't support the amendment, and if it passes, I won't be able to support the bill.
Representative Gay.
Well, I speak in opposition because I think that it's correct to, well, let's see. I apologize for not being a very good speaker. I'm better at writing because you can delete. The issue here that's in the room that nobody's saying is that there's a real concern about trans girls who have retained their male advantage, physical advantage for participating in girls' sports. This is a very complicated issue that needs to be addressed separately, because some trans girls you can look at and you would never, ever guess that they were trans. And others that we've seen on TV who are excellent athletes really do look like boys. And that's probably a medical thing about the treatment when it was done or if it's been done. So yes, I think that is an issue. But in this case, most people are not trans girls trying to participate in sports. That needs to be addressed. But in this case, I think it's important enough that the original birth certificate is kept on record along with the new one. and that everybody has a right to their privacy when they need to show a birth certificate for any number of reasons, the few times in your life you really need it. I don't think it's anybody else's business what you have gone through to change your sex. It's not something casually done. It takes years, and it's just a really not only expensive, but expensive in money, but it's expensive in feelings and time and attorneys, and it goes on and on and on. So I think that it's extremely important to allow people who are trans, who have completed it, just like they get a driver's license, they ought to have a birth certificate that doesn't give away their private medical history to any stranger that they have to show this to.
Anyone else? See no more hands up. What is before us is Amendment 0608H to House Bill 295, moved by Representative Cannon and seconded by Representative Merchant. And before the clerk is asked to call the roll, I'm going to vote yes on the amendment, because I believe as a general principle, the sponsor of a bill should be able to present exactly the bill he or she wants. So I believe that irrespective of what I believe in the amended bill, I believe it is the sponsor's right to have exactly the bill the person wants. So therefore, for that reason, I'm going to honor Representative Cannon and give the amendment a yes vote. Will the clerk call the roll, please?
Thank you. Representative Marsh,
Yes.
Representative McMahon,
Yes.
Representative Nelson,
No.
Representative Acton,
No.
Representative Gay,
Yes.
Representative Cushman,
No.
Representative Folsom, no. Representative Alexander,
Yes.
Representative King,
No.
Representative Cofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson.
Yes.
Sixteen to 5. It passes.
Representative Cannon, do you have a follow-up motion?
Muted, Jerry.
Representative,
You're muted, Jerry.
this is Christina.
I move.
all need to be on camera in order to have our votes count per the speaker. So if you are in the executive voting mode, you need to be seen on the screen.
Are we all set to vote? I mean, all set?
Representative Acton.
No, wait,
See Acton?
I think I have to
Yeah,
move
just
this.
a picture.
Can you see Acton?
Now I can.
Okay.
There he is.
Thank you.
Representative Cannon, you are recognized for a motion.
Yes, I move out to pass on House Bill 295 as amended with amendment 0608H.
Seconded.
By Representative Weber. Is it? Yes? Any further discussion?
I want to remind people with this bill doesn't change the intentions of the RSA that already exists and has existed since 2005. And that RSA was RSA 5-C87, Roman numeral 5. This bill adds a process that didn't exist back then and hasn't existed for 15 years. It costs the state and our jurisdictions money to implement it currently. This will reduce the burden and the cost associated with processing these birth record updates. That RSA has already determined that sex changes can be recorded on a birth record in New Hampshire. It doesn't change that. It does provide for a form to be used in the process to simplify that process for the clerks and the Vital Records Office, as well as the individual, to make this properly happen. Thank you.
Anyone else? Representative Cushman.
Thank you, Mr. Chairman. Representative Cannon, just a point of clarification. So yes, I understand that it is legal to change birth certificates to reflect change of gender, but am I correct in my understanding that that requires currently a court process and a judge ordering that change?
It does, and it requires a physician make the decision that a judge makes the judgment upon. This bill requires a physician to sign the form and have it annotated that they are in fact signing it themselves, and it would be perjury for doing so.
Thank you.
If it was somebody else.
Representative Folsom.
My feelings about birth certificates is that they should stay the way they are. And it doesn't matter what the change is. So this has nothing to do with why this particular bill has come forward. I just believe that any change in a birth certificate should have a notation on the birth certificate that a change has been made.
Anyone else?
Mr. Chairman?
Representative Merchant.
Thank you, Mr. Chairman. I also want to point out with the amendment, by having the Secretary of State create a standardized form to be utilized across the state, it minimizes the issue of city clerks or courts themselves and have multiple types of forms in the vital records. So I think having a standardized form across the state is important. And I also want to stress what Representative Cannon said. It doesn't change the process. It doesn't change the law. It only provides a vehicle so the law can go forward. This has been around since 2006. It's sad that we have to actually have an amendment or a statute to create an application process that should have been done probably 14 years ago.
I see no more hands up.
There's more.
Merchant Snow and Shapiro.
Weber, Merchant, Snow, and Shapiro. Representative Weber, sounds like a law firm.
Well, I'm very glad that I got to be senior partner, but it's, let me say it's a disadvantage to have your law firm start with a name with a W. So always get the one who's first in the alphabet. I just wanted to point out, and I thank Representative Cannon for her changes on this, but we do actually amend birth certificates for all kinds of reasons. You can amend them, generally speaking. I'm not sure that this is the case in New Hampshire, but it certainly was the case in Vermont. You have a grace period of a couple of years to amend the name on a birth certificate. We issue new birth certificates when a child is adopted. There are other reasons, and they don't come immediately to my mind, but we do change birth certificates. I think that it is very important that we retain the original record, and this bill has done that. But I also think that the whole purpose of what we issue, and this is the way we do it now, is that the individual get a new birth certificate that they can hand to somebody else that does not have a marginal note on it that affirms who they are. And as, again, you know, this is not done lightly or easily, even though we have the only thing we're doing here is taking the court process out of it, thus saving money and time both for the individual involved and for our overburdened court system. It's a thing that's better done with medical personnel and the people who keep the records. So thank you, I'm supporting it.
Thank you. Representative Merchant.
I got to take my hand down. Sorry for that, Mr. Chair.
Representative Snow.
Sorry, I forgot to remove my last time. No questions.
Representative Shapiro.
Thank you, Mr. Chairman, and thank you, Representative Cannon, for taking
Oh,
my
it's-
question.
That's not it.
Am I correct to think that as well as reducing the burden on courts, that this bill, when passed and signed, will create more consistency for people who want to make this change in their birth record? That when people go to the courts to do that, that different judges might use different criteria to decide what constitutes a change in sex? For example, whether there needs to be surgery or not, but this will create a situation where there is consistency across the board, that people can ask their healthcare provider to vouch for their change in gender.
That's correct, Representative. Currently, our courts are given different information from different physicians and different applications. There is no consistency. Even the clerk's offices are handed handwritten letters or typed letters or whatever, but it's all different information in all different forms and formats. This bill would standardize the information that's provided so that the Vital Records Office will get the information they need, and the local towns or cities will get the information they need to keep a standard record and format. I do want to say that currently, people do this. They have been doing this for 15 years. The information is widely varied that's gone to different courts, and courts may have 2 or 3 times that they have to bring the applicant and their medical professionals in to educate the court on how to make a decision on this. So the court becomes completely dependent on the medical professionals that have been working with this person. If we don't pass this bill, they will continue to use this very confusing process. It won't change what we're currently doing. People will still continue to get their birth record changed without a marginal note on their birth certificate. So this bill doesn't change that. It does simplify the process and it standardizes the process.
Representative Knurk.
Thank you very much. Yes, I think that it is appropriate to get the courts out of
Self-perception, which to me is a very strong reality, but self-perception laid parallel with hard, cold facts. If a birth certificate has the wrong area of the country, that has information that may impact diseases that are of much more in one place than another. The data gets a little off. Or Representative Nelson's comment about 65. I'm 71 because I showed up in June of 1949, irrespective of how I feel like I'm an extremely young 71 and want everybody to know it. I'm thinking of Alexander Hamilton, who really wanted to be president, but he could not be president because he was born in St. Kitts and Nevis. And if he said, look, I've been here in America for a long time, I feel more American than Uncle Sam and anybody else you want to mention, I really, really feel myself to be an American. The fact is he was born in St. Kitts and Nevis. And no, his birth certificate shouldn't be changed. Or how about the woman who's so identified with Black folks and loved them and loved that culture and so on, and did various things and took various things and passed for Black and became head of an NAACP chapter until it was learned she was white. And, you know, it's wonderful to identify with her Black community and whatnot. You know, cultural appropriation be damned. She was happy to do that. But the fact of the matter is she was not Black. And so for me, documents that would say, here is how I perceive myself to be, here is what I wish people to know me as, people call me as, and all of that, rock on. But the chromosomes were there at birth. And if there is a document that is the I really believe myself to be document, now becomes the birth certificate. When a person goes to a coach of a girls' sports team and say, I want to play on this team, and there's only 14 people on the team, and now one of them's going to be bounced from the team. And what is the proof that you should play on this team? Here's my birth certificate. It unequivocally says I'm female. And now somebody's been bumped. You know, in terms of celebrating who one believes oneself to be, you know, yeah, absolutely. But in terms of documents that not only are supposed to be objective, but are used to prove your age. I'm over this age now. I really want to get Medicare or any other use. No, to me, that's not right. So I will not be supporting the bill. Representative Weber.
I understand discomfort with certain changes enumerated by several people who have spoken, but that's not the bill that's in front of us. The bill that's in front of us simply makes easier a process which has already been the law in this state for 15 years. That's all it does. You can already do everything in this bill by going in front of a judge. So you can't change your age, you cannot change your race, you cannot change the fact that you were born in Nevis. You can only change this one thing. And with the amount of effort and pain and personal journey and medical interventions that go along with changing one's birth gender to one's real gender, the idea that somebody would go through that for the privilege of being able to play on a girls' sports team, thereby bumping a girl with female chromosomes rather than playing on a boys' team where they might not make the team, is just ridiculous. The issues here are so much more complicated than that. And the process is so much more complicated and so much more difficult that I can't imagine that anybody would go through it unless they had that voice inside of them saying, I'm not a girl, I'm a boy, or I'm not a boy, I'm a girl. So for that reason, this is only changing an administrative procedure. It's not changing anything else. And I urge people to vote for it.
Thank you. Representative Cannon.
I need to make a comment. My health history in all of my records with my health care flags that I am a transgender individual, male to female. Those records go with me wherever I go as far as an individual. So people from a healthcare perspective know exactly who I am and what changes have been done to my body. My birth certificate exists down in Newton, Massachusetts. I have a new birth certificate that indicates my new name as well as my new gender. I haven't had the chance to have to use that birth certificate for anything except for updating information on my Social Security card and my passport. And even in the case of the passport, I had to provide a doctor's statement that I had changed my sex. I did change information on insurance policies. There were no questions asked. They just asked, except for a copy of my revised birth certificate and name change. And they just took it as this is the way it is, and they updated the information. There was no question in the process. For me as an individual and my own mental health, it was something that needed to happen in my life to make me feel whole. This didn't happen until, I didn't change my information until 5 years ago. I'm 68 years old now. A lot of people go through this process and fight all their lives. And that was an affirming thing for me. I will probably never use my birth certificate again. It will sit in the drawer where I put it, and it will stay on file with the city of Newton in Massachusetts in case I ever need it. Thank you.
Thank you. Representative Shapiro.
Thank you. I completely understand people's discomfort with changing a birth certificate. That just doesn't seem logical. And for logical people like me, it kind of sticks in my craw. And likewise, recently, in the last couple of years, somebody in my extended family asked all of us to start calling them by a different pronoun, by they, them. And it was incredibly difficult for me. At first, I could do it maybe 1 in 10 times. Over the last couple of years, I've gotten better. I can do it maybe 70% of the time, but I often get it wrong. And somehow it makes me uncomfortable in terms of just my, the grammar that I learned my whole life. It just doesn't make sense to me. But I've thought about this a lot, and I can't compare my discomfort with something that seems off grammatically to me. I can't compare my comfort to the healing that this means to somebody, and I could never really articulate it better than Representative Cannon just articulated it. So I'm very willing to have my discomfort with these things so that people who are who struggled their whole lives and have tried to come to grips with who they really are and have the courage to make changes out in the world to feel more like themselves. I can't compare my discomfort with a birth certificate or with trying to get the grammar right. I'm the one that has to get over it, and it's well worth getting over it. So I will vote yes for this.
Representative Nelson.
Representative Nelson didn't take the hand down, I guess.
Anyone else? Representative Gay.
I think this is kind of like a compromise, because if you're like me, you thought that in the past 15 years, you thought that the original birth certificate was retained. It turns out there were two paths. Representative Cannon, I'll have to explain it if you want to know, but there were two paths to get your birth certificate changed. And one of them, when the judge did it, your original birth certificate was destroyed. So this is a step for everybody who really wants records kept. This is a step in the right direction to retain the original, to keep the history. So that does not, this bill does not deal with the issue of how much is someone's sex change when they're a kid in high school. Should trans boys, trans girls get to play? That affects some people and it is an issue, but it's not this one. And that if you really want the records to be right, this bill makes them more correct than the old methods.
Seeing nothing further, the chair calls on himself for a motion, and the motion is ITL on Bill 295 as
No,
amended.
there's already a motion on the floor, OTP. Cannon and Weber.
The motion is ought to pass as amended, made by.
The chair apologizes for that. Yes, you are correct. The motion on the floor is ought to pass as amended, as moved by Representative Cannon and seconded by Representative Weber. House Bill 295 with the amendment 0608H, and the clerk may call the roll.
Thank you, Mr. Chairman. Representative Marsh,
No.
Representative McMahon,
No.
Representative Nelson,
No.
Representative Acton,
No.
Representative Cushman.
No.
Representative Gay.
Yes.
Representative Folsom, no. Representative Alexander.
No.
Representative Kofalt.
No.
Representative King.
No.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes, that was a yes.
Oh, thank you. Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant. Representative Merchant.
Yes.
Chair.
Oh, sorry. Representative Pearson.
No.
11-10, it passes.
The bill passes 11 to 10. Representative Cannon, would you like to write the report?
I will do that.
All right, thank you. And this concludes,
Minority report.
I will do the minority report. This concludes the hearing on House Bill 295. Excuse me. This concludes the exec session on 295. And so we can get done while we're young. The chair opens the exec session on House Bill 601. And there were a number of amendments from Representative Ammon that he has withdrawn in favor of the only amendment he wishes to consider, which is Amendment 0676H. And would somebody choose to move that amendment? Representative Cushman, you would choose to move the amendment?
Yes.
And I will
second.
I
I'm
will
sorry?
second that.
And Representative Kofalt. Okay, please speak to the amendment.
Okay, so Thank you, Mr. Chairman. This amendment, a little background on the bill. The Department of Health and Human Services, without legislative input and without executive council approval, entered into a contract under the emergency orders to develop a closed loop referral system. This closed loop referral system will be created to enhance coordinated care for New Hampshire residents seeking social services by creating a single database of recipients that can be searched by a network of providers, and the goal is to treat the whole person. In seeking a vendor for the sole source contract, the department sought a solution to reduce the number of informed consent forms needed to connect clients with services in an effective manner. The amendment puts a pause on this system, so it will not be able to be used on the general public. As I understand it, the protection of personal private information is of critical importance to New Hampshire citizens. And this amendment here basically says it shall not be put into operation for members of the general public before July 1st, 2022. This will give the legislature a chance to look into the system and make some decisions on it, and if it needs work before it can be broadly applied.
Before I call on Representative Marsh, I hope everybody got the letter from House Counsel James Cianci relative to this, and some of us from both parties raised a question of constitutionality. House Counsel Cianci does not make a final ruling, but agrees that there could well be some difficulty with this. Representative Marsh, please.
Thank you, Mr. Chairman. I'm of the understanding, because of communications between myself and the Department of Health and Human Services, and because I personally reviewed the contract, which I downloaded from the Executive Council website, that in fact this data sharing rolled out and became effective in December 2020. I personally believe that it is unconstitutional to pass retroactive laws. And while I totally support the idea of privacy, and I do feel the department could have done a better job of protecting privacy, I don't believe it's in the purview of this legislature to pass retroactive laws, and therefore I unfortunately will have to vote against this amendment.
Anyone else?
Yes, please.
And the chair calls on the person who said yes, please.
The yes, please person was Representative Weber. Thank you, Mr. Chairman.
Thank you.
I agree with everything, well, almost everything that everybody said. I'm very concerned about this process and how it's rolling out. And I do think we ought to look into it more. And that is something that both this committee could do, either by creating an ad hoc committee to look into it, or some members of the committee, less than a majority, could look into it entirely on their own, or we could refer it to the Health and Human Services Oversight Committee. And I think all of those things should be done. But I agree with Representative Marsh that I am concerned enough about interference with contract that although I agree with the sentiment in the amendment, and I think it is a better way of going than the original bill, I cannot vote for this amendment and I cannot vote for the bill. So thank you very much.
Thank you, Representative. Anyone else? Representative Gay.
I'm intrigued by the offering that there could be a meeting of minds to discuss it. Is there any action that could be taken post passing this bill or not?
Representative Cushman.
My understanding is that
to protect people's medical history, just like we passed, the whole state passed the Privacy Act addendum to our Constitution. If there's going to be a change, let it come out, but not us just say, oh, it's fine, it's okay, we can't do anything. So I would definitely support this amendment and the bill.
I see a hand up. I cannot
Kofalt.
recognize. I'm sorry?
Kofalt.
Representative Kofalt.
Thank you, Mr. Chairman. So I support the amendment and I support the bill. And yeah, I thank Representative Cushman for pointing out the fact that this was not a contract that was approved by the council. My concern is that there is not, there really has not been any legislative oversight for this contract. I'm concerned that, you know, we have a duty to protect the privacy and the security of information of New Hampshire residents' information. And, you know, a lot of the people who are served by social service agencies are, you know, may not necessarily be understanding what they're signing or understanding what they're opting into. So as it is right now, if I go into a doctor's office, they're going to ask me to sign a form. And that's going to be pretty specific as to who, you know, what information can be shared or who it can be shared with and when. And my concern is that under this closed loop referral system, there is kind of a wide open door. In fact, additional agencies could join. I could be sharing my information sort of on a blanket basis with lots and lots of agencies, sort of whoever comes into the closed loop system in the future. And in that respect, it's kind of a blank check. So, you know, if somebody who is dealing with a substance abuse problem comes in for help and is, you know, is essentially giving consent to have their name entered into this closed loop referral system, it seems to me that we're asking them to sign a blank check, so to speak. And I think that's a dangerous precedent for us to be setting. The concern I have is that there needs to be legislative oversight. So if something like
it fails. So the amendment fails 15-5. Now we go to the original bill, which the amendment was to replace. All other amendments have been withdrawn. Would Representative Marsh have a motion on the original bill?
I've already pursued the reports. If somebody else wants to make a motion, that would be wonderful.
Or somebody else could write the report.
I don't see anybody else making a, thank you, Representative Weber.
Representative Weber, a motion.
I would move ITL on the bill.
I will second.
All right. Now we discuss the original bill.
I don't think we need to discuss it a lot. I think the concerns that we have are present in the original bill, only more so. So it interferes with contract, and I think that that's a bad place for us to be going. So that's really all I have to say about it.
Thank you. Anyone else? Seeing no one. The motion before us is House Bill 601 FM in its original form. Moved ITL by Representative Weber, seconded by Representative Marsh. Would the clerk please call the roll?
Thank you, Mr. Chairman. Representative Marsh.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Acton. Still absent. Representative Gay.
Yes, no, sorry, no.
Representative Cushman.
No.
Representative Folsom, no. Representative Alexander Smith. Representative King.
No.
Representative Kofalt.
No.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow. Okay, yes. Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson,
Yes.
I have a question. Were there two people missing on the last
There were two
vote?
people
yes,
missing.
I'm going to fix that.
Yeah. So it was 14-5.
14-5.
Yes, and this one was also 14-5 in favor
Of ITL.
of ITL. And the previous one was 14-5 with the
No.
motion failing.
I thought it was 15.
Thank you, and Representative Whitmer,
We had two absents.
please send me.
I will do that.
Thank you very much, and I am very, very merciful if you care or care not to use the form that has been sent down from on high that I can't figure out myself. And if-
I will do my best, but I'm pretty sure I track it pretty closely. in any case.
Thank you. This closes the hearing, this closes the executive session on House Bill 601, and last,
Were we gonna have a minority report?
oh, of course, thank you.
Uh-huh.
Minority reports. Who wishes to do the minority report?
I will do that.
And that is Representative Kofal. Thank you very much. Last, unless you can find another one. I found one this morning. Good thing, too. We are now opening the executive session on House Bill 605. And we've got a plethora, multitude of amendments here that, since Mason gives us a lot of latitude, we can take up all four of these amendments together. And they would be Representative Marsh's.
The second part had to do with visiting qualifying patients. It's important to realize that I was asked a question which I couldn't answer. The visiting patient access was not a DHHS request. However, Michael Holt had worked very hard on the language with the sponsor last year, which passed our committee and the House. There were also concerns raised about this proviso having to do with any countries. And the question is, how would we know what a card looks like and so on? In regard to verifying out-of-state cards, it is actually the Therapeutic Cannabis Program already has been dealing with this. They've shared their card design with many other states, and those other states share it with ours for that exact purpose. Many states allow this kind of reciprocity. Some have formal reciprocity agreements with other states for that purpose. Others simply need to just simply share that card template with the other state dispensaries so that dispensaries can verify what an out-of-state card looks like. And that's rather similar to sharing a state license design state to another state to curb underage drinking. The goal we felt would be probably reasonable for Therapeutic Cannabis Program to develop a nice simple system for the ATCs. It might be like a little, almost like a scrapbook with the copy of the cards from the various states. And so we added in rulemaking authority for them to do that. In addition, it's important to realize that the initial aspect of this bill had to do primarily with other states and Canada. And the reason is we border Canada. And just as we have many people who come to our state for an extended period of time from either Maine or Vermont or Massachusetts, or perhaps even other states, either students or people who have second homes, we do have a significant number of Canadians who come here to stay for an extended period of time. Again, to realize that if they are a qualifying patient in their home jurisdiction, to wander across state lines with cannabis is illegal. To wander across international boundaries is even more illegal. And so if you have a patient who is a qualified patient in Canada, and by the way, Canada has a nationwide program, not province-wide, nationwide. So they want to come down from Quebec and stay at a place for a few weeks down in New Hampshire and go hiking. They don't have to carry it. They would be able to have their, get their cannabis here. That's the whole point of this. So we currently have in statute the authority to allow other states, other qualified patients from other states to be able to be protected in the same fashion as our patients are protected, meaning they won't be arrested for possession. This just simply allows them to be able to purchase. So again, please pull out 0646, because I'll use that as a template to go over the aspects of the amendment so you understand all the details. The first lines 3 through 8 has to do with the OUD. And that's the one that just simply makes it much more stringent. We already covered that. The next lines 9 through 14. What that does is it simply allows the ATC to be able to convey to a visiting qualifying patient. Lines 15 through 18 actually is a prohibition statement. It is in the it's in the statute where it says it includes all except the following. And what it says here is that the cultivation or purchase from a qualifying patient or designated caregiver is not covered. In other words, you can purchase from an ATC, but you can't purchase from another qualified patient or a designated caregiver in this state. So again, though that looks like it's allowing it, it's not. It's saying it is not covered by the card. Then if we go to lines 19 through 29, that is the part that allows the patient who is a qualifying patient in another jurisdiction to be able to possess, and again narrowed it from all countries to only Canada. And then if we go to lines 30 30 to the second page, that is the one that once again takes away all countries, goes to Canada only. And then there was a very interesting thing which I found when doing a deep dive in this, that there was a drafting error, that if we look at lines, page 2, lines 9 through 11, it actually had been worded incorrectly and said you couldn't purchase from the ATC. We tidied that up. So now it just says that a visiting patient shall not cultivate, and they also cannot purchase from a qualifying patient or designated caregiver, a redundancy with what was there before. But it does not say they can't purchase from an ATC, because that was the whole point of this. And then the last one is the new section, which just gives the rules for the cards. So the idea is that the Therapeutic Cannabis Program will develop a system for the ATC's verifying cards so that they're all using the same method to do verification. So basically, again, 646 is the one that includes both OUD and the visiting patient provisos, allowing them to purchase from an ATC. 0644 allows OUD only, does not address the visiting patient question. 0645 addresses the visiting patient only, does not include the OUD question. So that way we can decide which one we want to go with. We can then vote on that and not have to do a whole lot of time. The chair and I had discussed perhaps doing a quick straw vote, because if it seems like everybody is pretty comfortable with both, then we could just move 0646 and not have to go through amendment after amendment in an amendment-a-thon.
But wait,
So
it's even more complicated. It gets even more complicated, because Representative Marsh in this amendathon has 0482, who would do something quite different yet. And Representative Marsh.
Yes, thank you, Mr. Chair. In the event none of these amendments are adopted, I will bring my amendment forward. But I believe I could support amendment 0645H, which allows out-of-state patients from the United States and Canada to utilize our ATCs for the valid cards. I don't believe I can support the other two amendments, because I think the data on opioid use disorder is quite equivocal at this point in time, and that there is at least some data that would lead me to believe that it may actually make opioid use disorder worse, and I can't support that.
May I actually speak to that for a moment too?
May actually speak.
Okay, yes, and the board really does agree with what Representative Marsh just said. The whole point is that THC gives reward, therefore it will increase issues of use disorder. It's the CBD which has the ability to work on withdrawal and the craving issue. And that is why we set up such tight guardrails, so that you have a person who is aware of that, because we were pretty convinced that your average practitioner, your average PCP, even a medication-assisted treatment PCP, is not going to have enough knowledge base to be able to make that distinction. Because remember, a provider, which in this case should be an addiction psychiatrist or addiction medicine specialist, has the authority, and the ATC must follow it. They have the authority to request a CBD predominant or CBD only preparation. In other words, it isn't that they just go and the ATC decides what they want. They can request CBD only, and that must be followed.
And this is the chair speaking. Remind me, please, you said there was a drafting error. That is not in Amendment 6458, correct? That was in the...
No, the drafting error was in the original bill.
Okay.
Yeah, and we fixed that. I just simply found the inconsistency, checked it with Mike Holt. He agreed that was incorrect, and we corrected that.
Thank you very much. Representative Shapiro.
Yes, thank you, Mr. Chairman. Representative Knirk, in Amendment 0646, which includes the opioid use disorder and the visiting Canadians, I'm concerned about the kind of strict guardrails or guidance around who can qualify that person. And I wonder if Michael Holt has chimed in, or whether he can chime in right now, about will that create problems in administrating the ATCs and following that strict guidance?
If Mr. Holt is in the meeting, wave.
Yes, I texted him and he is in. Yes.
Then wave and unmute.
Hello, thank you for the opportunity to ask a question. My name is Michael Holt. I'm the administrator of the Therapeutic Cannabis Program. Representative Shapiro, can you repeat your question? Are you concerned about the ATCs verifying out-of-state cards, or is your question about the department's ability to enforce the provider-type guardrails for the certification for OUD?
My concern is in regard to somebody being qualified with an opioid use disorder. There's a lot of conditions about who can be the qualifying physician and what kind of excuse me, product can be used. And I'm wondering if that's going to create problems for the ATCs in terms of being able to follow all those different conditions.
Okay, I understand. Thank you for the question. So there's two elements here. The first is the department's ability to enforce the provider qualifications. That's not an issue for us. We would establish those documentation or verification protocols so that we can be assured that the providers certifying for OUD are in fact board certified in addiction, psychiatry, or medicine. It's not an issue for us at all. Regarding the second piece about the ATCs enforcing or implementing a provider's instruction on dispensing, that's a process that we already have in place right now, where providers can send instructions to the ATC, and then the ATCs are required to follow those instructions when they dispense to that particular patient. So that's something that we could that we wouldn't have an issue with enforcing either.
Thank you.
The chair recognizes Representative Merchant.
That was an error. Mr. Chairman, I put my hand up.
You're always welcome when you want to come back. Representative Folsom.
I think I'm agreeing with Representative Marsh on this one. I am really happy that they made the changes to Just Canada. I feel like they got that whole ID kind of program under control as far as the medical marijuana cards. But I just don't feel comfortable with the opioid right now. I think that science, the science isn't totally there yet. And that's due, to the fault that nobody can do a lot of the research yet until the federal government makes up its mind what it's going to do. But I'm just not feeling comfortable with the opioid, but I would definitely feel comfortable with the sharing of medical marijuana cards and purchasing from state to state, and with the cannabis protections that are in 0482.
Thank you. Anyone else? Representative Weber.
Thank you, Mr. Chairman. I think with the guardrails, which are pretty steep guardrails, I'm okay with the opioid use disorder treatment provision. And I am very much in support of the visiting patient provisions with the addition of patients from Canada. I wonder if perhaps a way to proceed would be to offer 6, and if that's voted down, then to offer 45, because that way we would have we'd have both if both pass, but if both don't pass, it's very clear which direction I think the committee's going in, unless other people have something to say. If you'd prefer to do it via straw poll, I'm glad to do that too, but I think sounds to me like those are the decisions we're making, is whether the opioid use disorder treatment is in or out.
I'm leaning towards doing a hybrid of both, and that is a straw poll, just to kind of see where the room is, because the body language, we can't do that so easily here. And then do that descending order of voting on amendments. Representative Woods.
Thank you, Mr. Chair. I'm in favor of both, going with, I guess it's 6. In terms of the OUD, I'm very pleased to get the result from the Oversight Committee. Knowing the people that are on there, and I know a lot of them personally, if this came out unanimous, knowing the general flavor and the strictness with which these individuals, and as I said, I know many of them, I'm very surprised to see it unanimous support for OUD, knowing these folks. And the fact that it did come out as unanimous means that it passed very stringent, standards. So I'm in favor of doing that and moving ahead with 6.
May I respond to Representative Woods for a moment?
Yes, you may.
Yes, and indeed, Molly Rossignol, Ed and Seddon Savage were both there and did vote for it. And yes, you're so right. Seddon totally opposed therapeutic cannabis in the beginning, and they are extremely strict. So that was that's why I was amazed. I didn't expect this outcome at all. Thank you.
I know they're both on there, and the fact that it was 9-0 means they had to be there.
Anybody else? Let's see how we can wrestle this thing. How do we do this?
Well, by the way, I think that Representative Weber's idea is pretty good. If we vote for the one with both and it passes, we're done. If it doesn't, I think she's right. OUD seems to be the one people are stuck on more so than the visiting patient. And we would know that it died because of OUD. So I'm comfortable with either a straw poll or just going to 6-4-6 and then 6-4-5.
The 6-4-6 is you're comfortable with opioids and Canadians. 6-4-5, you're uncomfortable with opioids, but comfortable with Canadians. And all right, I'm going to stop talking now. Would somebody move 6-4-6 amendment? Representative Knurk. And second?
Yeah.
Oh, you can't second it. You just moved it.
I second it. Weber.
Representative Weber. Okay, we have before us amendment 0646H to House Bill 605 FN. It was moved by Representative Knirk and seconded by Representative Weber. And the motion is to accept the amendment. Would the clerk please call the roll?
Thank you.
May we clarify though for everybody, this one has both OUD and visiting patients.
Thank you.
Representative Marsh,
No.
Representative McMahon,
Yes.
Representative Nelson,
No.
Representative Acton,
Yes.
Representative Gay,
No.
Representative Cushman,
Yes.
Representative Folsom, no. Representative King,
No.
Representative Kofalt,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Snow,
Yes.
Representative Knirk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Also, yes.
Representative Shapiro,
Yes.
Representative Shapiro,
Yes.
thank you. Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson,
No.
It's 14-6. It
14 to
passes.
6, it passes. Representative Knirk, do you now withdraw 0645 and 0644?
Yes, sir.
Representative Marsh, I believe, Representative Knirk.
Sorry? Yes. May I make a motion then to accept 605?
No, I will not accept that just yet.
Okay, got it.
We also have a parallel motion, and I'm going to ask my predecessor for some wisdom here. Would it be possible to accept both the amendment we just looked at and Representative Marsh's amendment and have OLS meld them?
No.
Um,
You're muted.
Hey, Chairman.
You're muted. Lucy, you're muted.
Sorry. I can't offer an opinion on that because I can't remember what was in Representative Marsh's amendment. I think that in the past, and to be really safe, you'd need to check this with the clerk, because I might be remembering from a previous clerk, when two amendments were not conflicting with each other, you could adopt both. And the OLS would produce a third amendment which combined the two for ease of dealing with the calendar, because I think we only do one committee amendment for the calendar. But I don't know what the subject of Representative Marsh's amendment is. If Representative Marsh wants to offer his amendment, that's one thing, but we don't have to actually do anything with Representative Marsh's amendment unless he chooses to offer it. It just.
Correct. I just wanted to see what we could do.
And may I speak to that too?
No, I think Representative Marsh is going to speak to his amendment next.
Right. The issue in my amendment was the issue of employees being protected when they're transporting cannabis between locations while they're on the job. And it's my understanding that that is being addressed by another bill. And so I do not feel compelled to bring it forward.
So the question is moot. Now, Representative Knirk.
No, that was all I wanted to say. It's an SB 162, that the Senate omnibus bill. It's already in there, so we don't need 482 because it's covered in the Senate bill.
Thank you. Now, let's see. We've got this wonderful amendment here to House Bill 601 that is.
Oh, wait. We haven't voted on 605 yet.
605.
So we're up to a motion on the bill.
Right. We passed the amendment, but we haven't passed the bill.
Yep, that's correct. Let's pass it quickly because I'm fading fast. Representative Marsh, would you take the chair, please?
Yes, thank you. At this point in time, we're discussing it ought to pass as amended by 0646H. And Representative Knurk, I recognize you to make that motion.
Yes, indeed. I want to move that HB 605 be ought to pass with amendment 0646H. The one we just passed.
Second to the motion.
Second.
Thank you, Representative Pearson. Is there further discussion? I see Representative Woods and Representative Folsom's hands are up, but I believe that they are from past discussion.
Sorry, yes. Correcting them.
Representative Acton.
I just want to quickly thank Representative Knurk for the amazing work he's done on pulling this bill together. Good work. Thank you.
He has done a good job. He can vote against it, and still think he's done a good job. Is there any further discussion on the motion on the floor? Seeing none, the chair will ask the clerk to call the roll.
Oh, okay. 1 second.
When she is ready.
I'm sorry, I was not paying close attention. Who moved it?
Representative Knurk moved and Representative Weber seconded the motion ought to pass as amended with amendment 0646H.
Thank you. Thank you, Mr. Acting Chairman. Representative Marsh.
Representative Marsh votes no.
Representative McMahon.
Yes.
Representative Nelson.
No.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative King.
Yes.
Representative Kofalt.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knurk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
No.
Seventeen to 3, it passes.
Representative Marsh will vote to break the minority report.
And Representative Weber, the majority.
No.
I think it's Representative Kirk.
I'll take care of that. I mean, I've already done the work on it.
Thank you. I did
Yeah,
not
it's
make the
easier.
motion.
Yeah, I made the motion and I've done the work. It's easier for me to do.
So repeat again, who is making the majority report?
Jerry Knurk.
Minority report, Marsh. 17 to 3, it passes as amended. I think that's it. I want to thank, first of all, I want to apologize to everybody. I've been pulling a migraine all day and I have been more confused than ever. I apologize for that. I hope I wasn't rude to anybody. And if I was, I also apologize for that. We got it done, folks. This has been great. We're not going to have a lot coming over from the other people. And I'm hearing from the Speaker's office that we probably will have our next big voting sessions in early April. So already start planning the odds and have a good time. So
Wait, I have a question. Are we meeting this Thursday?
no, we're done.
Oh, no, I'm going to have to work. And then there's,
Sorry,
I'm sorry, I have another job.
you do?
And then I
Oh.
do, but I won't go into detail because everybody's tired. And so we are not having a big session in whatever football stadium on March
Yeah, March
16th.
28th.
It looks like the next session for voting as a House will be in Bedford in early April. That isn't set in stone yet, but that's what it looks like. We are not meeting on Thursday. House Bill 605 exec is concluded, and thank you very much, everybody.
Wait, before you go, let me just thank the chair. It is an extraordinary accomplishment to have gotten through all of these bills in any case, but doing it this way is much more extraordinary. And I just wanted to thank you for your kindness to all of us and your fairness to all of us. And I hope that your migraine passes quickly, but I just didn't want to let that go without saying thank you. We appreciate it.
Well, I wish to thank both my predecessor, who has been my parliamentarian without any comparison, and also to all of you. It's been great because we've all wanted it to be. We've all wanted to be fair and polite. We disagree about things, but we're not disagreeable to each other. So it's been an honor. I've chaired committees before, and this is my favorite. So thank you too. Thank you.
But another
Can I
thank you to the
share with
people working in the background, running the computers.
Oh, yeah.
Visual.
That too.
Thank you to House
Yeah,
Committee
thank you,
Service.
Christina.
Thank you, folks.
A great job.
I'd like to share a story about our esteemed chairman that might improve his headache a little bit. 3 years ago, when I was hospitalized for an extended period of time, my wife was informed that they had to reserve the number of visitors that came into my room. And you had to have a password in order to get into the room and all the rest of it. And all of a sudden, Mark suddenly appeared in the room, and I said, "Oh, did you get the password?" No. Why would a man in a clerical collar need a password to get into a room at the Catholic Medical Center? And he was a regular visitor to me while I was in the hospital, and always wore his clerical collar. He does know how to get around the tough nurses that were there.
Wrong collar. Wrong collar. That's the Catholic. Anyway,
Didn't matter. They don't make that distinction.
no, they don't look that close.
And I believe Representative Snow said, "I'm not Catholic," and I looked at him and I said, "I'm not either." And then and after he got over being scared, I prayed with him, and we were both quite happy after that. And lo and behold, he's back. So here we are.
Yeah.
Canon Mark is a priest.
Just an Anglican priest. Yeah.
Yes, I know that and respect that.
I did not see it was an appropriate time to get into a long historical discussion with the people running CMC. I walked in, they looked at me, they said, "Right this way, Father." I said, "Thank you very much," and the rest is history.
It was a great relief to me, I can tell you.
Thank you.
And with that,
Bada bing.
bada bing.
Hi, guys.
Hi, everybody.
Yes, we're going to go home now. Thank you,
everything.
everybody. Say goodnight to Sophie, Representative Soloway.
And vote Tuesday, if please
Tomorrow.
Salem.
Tomorrow.
Yeah, tomorrow.
Oh,
It's nice.
Vote.
I have to go and be a poll worker for the first time.
You're not gonna pass.